All right, I'll call the Assembly Committee on State Affairs to order. I'll have the, obviously we got some virtual here going on, not much though, which is kind of cool. Most people are here in person. I'll have the clerk go ahead and call the roll.
Representative Swearingen.
Here.
Representative, hold on one second. I can't pin his.
If you are joining us virtually, members of the legislature, if you could go ahead now and start your video, and the clerk can get you recorded as being in attendance.
Representative Jagler. Here. Representative Schra. Here. Representative Knodel. Here. Representative Kugelich. Here. Representative Summerfield. Here. Representative Culp.
Here.
Representative Vorpagel.
Here.
Representative Sinicki. Here. Representative McGuire.
Here.
Representative Onstad.
Here.
Representative Crowley. Representative Stubbs.
Here.
And Representative Cabrera.
Here.
Is that everybody?
Representative Tauken.
Here.
He still doesn't have his.
Okay.
We'll move on, I guess.
Gary, is your video on?
There it is.
You're a good man. We'll start and make sure we get it as we roll along. So, just some housekeeping, informal housekeeping. This morning, the committee is going to be taking just an informational hearing on from a bunch of, I would call them stakeholders, I would call them business owners, on kind of telling their story about what's been going on in terms of the Safer at Home order and the extension since roughly St. Patrick's Day. And also we're going to be having a presentation by WMC on their back to business plan for Wisconsin, along with somebody from University of Wisconsin talking about some ideas they have there. If you think that this is going to be a bashing of Governor Evers, you're in the wrong committee hearing. That is not anywhere near the intention of what's going on today. I think that I got a letter yesterday from the Democrats concerned that they weren't really involved in the hearing process or who we invited to testify today. I am more than happy to call this like a first attempt at trying to vet ideas and people that have their own vision about how to get back to work here in Wisconsin or how to get their business up and running again. But it is by no means a bashing of the administration. And so I just want to say that from the outset. Like I said, I admitted I got the letter from the Democrats yesterday, and I get where they're coming from, and I appreciate the letter. The truth of the matter was, I got the letter about 11 o'clock, and we put out the hearing at noon, So if this has to be the first hearing of its type, so be it. And, if we want to get back together again next week for another hearing with some more stakeholders and some more opinions, I'm all for that as well. But I would kind of like both sides to lower their defense shields here today. And let's just have some genuine input from stakeholders, including WEDC, and people that have been involved firsthand on the impact that this insidious virus has had on the state of Wisconsin. So with that being said, I'm going to recognize Representative Sinicki. I think she wanted to add a few comments.
Yes, Mr. Speaker, or Mr. Chair, I'm sorry. Thank you for that clarification. It's much appreciated. But I do, and I appreciate the fact that you also said this is not a bashing of the administration or the governor. And I hope everybody follows that advice. So thank you for bringing that up. But I just do want to point out, before I ask my questions about some of this, I do want to just point out in the meeting notice, if I can find it, it does say that that you would entertain additional speakers. So, I mean, we thought maybe, you would be willing to add speakers, seeing as you did put that in the hearing notice. So, I guess I am disappointed, but not surprised. So, and I'm happy to hear that you're saying this is the first attempt at it, because we have a real strong concern about who is not on the speakers list, of course, and that would be the actual workers, the laborers. What about medical personnel? I mean, any decision we make in opening businesses in the state should be driven by science and should be driven with the input of medical experts, not just based on business. And I also want to bring up several of the communications that we've received on the WMC plan is asking us to please vote in favor of it. I want to point out this is not legislation. This was not drafted by legislators. It was drafted by a business group. So there will be no action taken on this. I want to make that perfectly clear. And Mr. Speaker, if we're going to do this again, I am right here requesting an answer as to whether or not you're going to allow us to have input into who speaks.
You know what? Like I said, Representative Siddiqui, if you want to work together on the next one, if we deem the next one necessary, I'd be more than happy to entertain whoever you want.
I deem it necessary right now.
Yeah, fair enough. Let's get together on what we want to do, from steps being taken here. And actually, you're absolutely right. This is not a hearing on a bill. It's just an informational hearing, so there'll be no voting going on. But I think, the WMC plan, even according to the administration, has some merit, and I thought we should entertain listening to it, as well as the presentation from the UWS.
Right, and I'm looking forward to hearing from them, but keep in mind, Mr. Chair, I keep wanting to call you Speaker, I don't know why.
Don't promote me.
You might do a better job. I'm sorry. But I know members on my side of the aisle have many questions, so I hope you will bear with us and allow us to ask our questions.
You bet.
Thank you.
Keeping in mind also, I should tell everybody in the room that we do have, because of the logistics of the calling in, the technology going on here in the JFC room, there is a schedule that I'm going to be following, which concludes us, if we can stay on schedule, roughly about 4:30 or 4:45. And the reason for that is obviously some of these people are calling in, and so we have actually allowed those time slots to, out of courtesy, obviously everybody's busy. So with that.
Oh, can I ask one more?
Yeah, go ahead.
Make one more point. I just want to make sure that everybody's aware that we did pass out another packet with information that has been sent to us on maybe a different position on this plan. So I just want to bring that to your attention, and I hope everybody has the opportunity to look through it.
Okay. And then for those members that are participating virtually, I guess it's very similar to the way we had the assembly session back on April 14th. So the goal of this hearing, obviously, to kind of run as normal. But if you wish to speak, obviously, just kind of use the website that's set up in front of you, and you're also responsible for muting your own mic. So hopefully you guys used it last time. You'll know more than I do when it comes to that. So with that being said, I'm going to try to keep to the schedule, and at 12:10 roughly, we are supposed to be joined by Scott Manley of the WMC over Skype. Is Scott available to us?
I am available, Mr. Chairman.
Well, good afternoon. There he is.
Good afternoon.
Scott, welcome to the Committee on State Affairs.
Well, thank you so much for having me, and thank you for the opportunity to talk to you about the Back to Business plan. We just sent around to all legislators and staff a copy of a letter urging legislative action on this plan, and that letter was signed by more than 24 statewide business trade associations and more than 50 local chambers of commerce from across the state. So we're really excited by the level of support for this plan to safely get Wisconsin back to work. I want to go over briefly the elements of the plan for the committee, and really want to start by setting the table and talking about why we think reopening our economy is such an economic imperative. As we sit here right now today, we have 19% unemployment in our state, which is twice as high as it was during the worst days of the Great Recession. We've got 450,000 people who have filed for unemployment claims since social distancing regulations took effect. And we've got businesses in Wisconsin seeing a reduction in foot traffic of 50% for the retail sector, and certainly much higher than that for restaurants throughout the state. One of our key and most important industries, the dairy industry, has been hit really hard, especially those dairy farmers who supply food for restaurants, schools, and other food service customers. They're struggling to survive. Many of them have had to dump milk or even cull portions of their herd. According to a recent survey of businesses that was done by the WEDC and UW-Oshkosh, 35% of businesses, about 1 in 3, that are closed down right now, say they'll never reopen if the shutdown lasts for 3 months. So the economic impact of shutting down our economy and keeping it shut down has been absolutely devastating, and unfortunately it's getting worse every single day. And that's why we thought it was so important to put a plan together to allow us to reopen our economy in a safe way. And we think now is the time to do it. I mean, we've really done a great job in Wisconsin of flattening the curve. Hospitals in all portions of our state were able to respond to the peak of this pandemic, and were able to do so providing services to everyone who came through their door. One of the primary reasons why the Safer at Home order was put in place was to make sure we flatten that curve and make sure that everybody who needed to be treated was, and we've been able to do that. We've stabilized our infection rates, and new cases in the vast majority of our state are minimal. And I think it's important to point out that we divide our state into 7 different healthcare readiness regions. And Mr. Chairman, 4 of those 7 regions have more hospitals located in them than they do COVID-19 patients. I think that's remarkable. That's a huge achievement, and we ought to be proud of it. But I think it's evidence that when 4 out of 7 regions in our state have more hospitals than they do patients, it's time to think about reopening. And that's why we're here today. The Back to Business Plan presents you all with an opportunity to enact, and of course it would have to be drafted into a bill first, but to enact a legislation that would safely reopen our economy in a way that recognizes risk and manages it and mitigates it. The plan would allow all businesses to open based on the risk level for that particular business, calculated as either a minimal risk, a moderate risk, or a substantial risk. How do businesses get that risk factor, that risk score? It's calculated based on 4 factors. The first is the infection rate in the county that business is operating. The second is the population density of that county. The third is the transmission risk associated with that specific type of business. And the fourth is the local hospital capacity and utilization in the area that business operates. All 4 of those factors are scored using trusted data from the Wisconsin Department of Health Services, as well as medical providers, both of whom, DHS and medical providers, update this data every single day to reflect real-time conditions that are happening on a county-by-county basis. To get their risk score, each business would visit the DHS website and enter 3 simple pieces of information: the name of their business, the county they operate, and the North American Industrial Classification Business Code for their sector, which is a code that the U.S. Census Bureau uses to describe literally hundreds of different types of businesses. We had private sector experts who specialize in occupational safety and industrial hygiene assign the transmission risk score for more than 311 different business sectors using these North American Industrial Classification System codes. And they did so by applying the federal OSHA guidelines for COVID-19 in the workplace, which assigns different levels of risk for businesses based on what their operations are. We then had stakeholders from the medical community review those risk factors for each of these 311 different types of business sectors, and they were able to provide us with some additional input, which we incorporated into the model. So our plan establishes mitigation steps that are based on these risk scores, these overall risk scores, that all businesses who want to reopen would be required to follow. Once a business knows what their score is, which again is based on those 4 specific factors, the DHS website would then show the business the mitigation requirements that apply to that particular business in that risk level, and the business would then be required to implement those measures in order to reopen. I think it's important for the committee to understand that the risk mitigation factors that the businesses would then be required to implement are based off of Centers for Disease Control COVID-19 guidelines for businesses. And as you probably would imagine, the higher the risk level for the business, the higher the score they have, the more significant and substantial the steps that the business would be required to take in order to protect their employees and their customers. The mitigation requirements include things like social distancing of workers and customers, enhanced disinfection protocols, limiting common areas like break rooms for employees where they congregate, among many other factors. When you get into the higher levels of risk, like the moderate or the substantial categories, we end up having a situation where businesses would have to take much more significant measures, including things like requiring PPE for workers and reducing operational capacity associated with their business. Finally, I want to say with respect to the mitigation requirements that we know that one size fits all does not always work. So these mitigation requirements under the plan are customizable to really reflect the specific circumstances of individual business sectors. For example, in this hearing, you're going to hear later from folks in the tourism and hospitality industry about the hardships they've been facing in their sector. And these groups were able to compile some really great industry-specific mitigation steps that ensure that their employees and their customers are protected after reopening. Because the infection rates and hospital capacity factors can change in real time based on current conditions, the plan requires businesses to visit that DHS website every 7 to 10 days and input their information and get an updated risk score. Because you know the plan utilizes that real-time data every day, we think it's important for businesses to check back regularly to see if conditions in their community have changed in a manner that would put them into a different risk category and therefore change the mitigation requirements that they'd be required to implement in order to protect workers and customers. So with that bit of background, Mr. Chairman, we would ask the support for the committee and the legislature of a whole to back the Back to Business plan, because we think it represents the best model for safely reopening our economy and getting people a chance to rescue their livelihoods and their businesses. We think that the plan is tactical in that it provides businesses with very specific steps that they can take to protect their employees and customers. We think it's granular because it assigns industry-specific risk factors to businesses based on 311 different North American Industrial Classification System business codes. It's very customized in that it assigns risk based on circumstances that are unique to the local county and community that business is operating in. So it's very much not a one size fits all approach, and I think that's really important. The plan is data driven. It literally uses real-time, day-to-day data from public health regulators and medical professionals as the basis for assigning risk and mitigating risk. It's credible in that the mitigation factors that businesses are required to take are based on CDC and OSHA guidelines with additional input that we incorporated from medical professionals. The plan is responsive because it dials risk up and down based on what's actually happening in their community, according to DHS COVID-19 infection rate data and the data on hospital capacity and utilization. So if things get worse, risk levels increase, businesses are required to do more. Conversely, if they get better, which is what we all hope happens, risk levels will go down and businesses will be able to relax some of those mitigation steps that they're taking to protect workers and customers. Finally, the plan is forward-looking because it assigns risk factors based on current hospital capacities, real-time hospital capacities for things like how many ICU beds are available, how many ventilators are available, what are the PPE supplies for masks and gowns and that sort of thing, again in real time, so that we're dialing things up or down based on that data. So with that, Mr. Chairman, I want to thank you and the members of your committee again for the opportunity to discuss this plan, and would be happy to answer any questions the committee has.
Thank you very much, Scott, for the thorough report. I know you kind of gave us the 30,000-foot view of what's going on. There's a couple of questions. I know we only have you scheduled until 12:30. I think we can wiggle that for a couple extra minutes. If you could just give us some quick answers to some questions that members may have. I just want to clarify the risk factor when it comes to, and I'll use my own county as an example. So in Oneida County, up in Rhinelander, we had a maximum at one point of 6 cases. Since then, all 6 have recovered, and we are now down to 0. Obviously, that would make our risk factor, and I'm talking about in terms of potentially opening regionally. I assume that's kind of what you're talking about, correct?
That's correct. So businesses in that county would be assigned a risk factor based on, again, what type of business they are, because a golf course has a different risk profile, for example, than a movie theater does. So it'll be based on that. It will be based on what are the infection rates in that particular county. And then again, what is the hospital capacity and utilization? What's the ability to be able to treat patients for hospitals in that region if the need arose? So yeah, if all of those factors are working in your favor, then you're likely to have a low risk score, as opposed to, for example, I'm not trying to pick on movie theaters, but for example, a movie theater or a museum in Milwaukee County would probably fall into that substantial risk category. And then the difference then is that all businesses will be required to take mitigation steps to protect workers and customers. It's just that those businesses in the substantial risk category will have to take more steps and reduce their operational capacity as opposed to businesses in a low risk category.
Okay, thank you for the answer. Representative Sinicki.
Thank you, Mr. Chair. A little disappointed that the author of this plan is only going to give us a few minutes, then has to be on his way. So I will try to I got 2 questions right now, and I'll try to make it fast. My number 1 question is, what happens when a business opens up too early and the employees are not comfortable coming back to work? and they don't want to come back to work. What happens in that case?
Well, we think this plan, because the mitigation requirements that businesses are required to implement to protect workers and their customers, they're based on CDC guidelines. And so I think part of what we tried to do with this plan is set this up so that we can instill confidence in both workers and customers that what businesses are doing to prepare for a successful and safe reopening, is based on these CDC and OSHA guidelines to protect and mitigate COVID-19 in businesses. We've all been fed a very steady stream of, if you leave your house, you might get sick and die, and I don't want to minimize that because that's certainly true for some people, but there's a way we believe to recognize the risk, to manage the risk and mitigate the risk in a way that is protective, again, of both workers and customers.
Mr. Chair, follow up on that one, please.
Yeah, go ahead.
Mr. Manley, you did not really even answer my question about what is going to happen to employees that don't want to come back to work. If I was to support, even entertain supporting your plan, I think we would need a guarantee that there was going to be worker protection in that area. I mean, this is what's going on in Iowa and Texas. It is a way to throw people off of unemployment because they have a job to go to but refuse to go to it. So at some point, I want a direct answer to that one. The other question I have, and then I'll move forward, let others ask their questions. Where are you getting the information that the curve has been flattened? I have not seen that yet.
Well, we've heard that from the Department of Health Services. I mean, the Secretary-Designee Palm has said that. I believe that Dr. Westergaard has said that. I mean, if you look, Representative, again, I'll go back to the fact that 4 out of our 7 healthcare readiness regions in Wisconsin have more hospitals located in their region than they have COVID-19 patients. Flattening the curve was all about making sure that we reduce the spread of infection so that we don't overwhelm the healthcare system in our state. And each of the 7 regions in our state has done a fantastic job of being able to provide services to COVID-19 patients. And they have, even in Milwaukee County, where we've had the largest, or southeast Wisconsin, the southeast region, where we've had the largest outbreak in Milwaukee County in the state, they've got plenty of healthcare capacity.
I just need to follow up one more time, Mr. Chair.
Make it
I'm
quick.
sorry. I will make it as quick as
Okay.
possible.
Yep.
So given the fact that I am from Milwaukee, and we still have cases rising in Milwaukee, I don't understand where this thinking comes from that the virus is not going to cross city borders. If you open up regionally, you better believe people from Milwaukee are going to leave Milwaukee to go up north or go to a restaurant in Brookfield, whatever. You can't contain it in one city. I don't understand that thinking, and maybe you can address that. That would be my final one. I'm sorry.
Okay.
Sure, I'd be happy to do so. And I would just say this, that the OSHA guidelines for addressing COVID-19 in the workplace contemplate that very scenario, Representative, where it contemplates the idea that people would be traveling from one part of a state where you have higher levels of infection to areas of the same state that have much, much lower levels of infection. And indeed, it also contemplates that you would have people moving from state to state among states that have different levels of infection. And they built that scenario into their safety guidelines for how you deal with COVID-19 in the workplace, how you assign risk and how you mitigate risk. So, and because our risk factors are based on that OSHA guideline, that factor, that circumstance is built into and is embedded into the plan and the model for assigning risk.
Thanks, Scott. Just for the committee's clarification, and Representative Zinicky, the timeline established for Scott Manley and WMC to speak today was established by the committee, not by Mr. Manley. So he's certainly willing to stick around as long as we need him. However, that not being the case, Scott, I got one more question from Representative Cabrera, and then maybe Representative McGuire if we can get to him. So Representative Cabrera, you have the floor. Can you hear us?
Okay.
There you are.
Can you hear me?
Yep, sure can.
Okay, so I have a couple of questions because my number one priority is public safety. And so when you mentioned the four criteria that is considered, you mentioned the first one was infection rate. And it sounds like what you're basing that off of is cases that are known. And what we also know about this virus is that people can transmit it even when they're asymptomatic and have not been tested. And so I don't know that just basing it off of known positive results is the metric to use for infection rate. It sounds to me that would be an inaccurate number, and so I would think that part of your plan should include some type of testing and contact tracing in order to accurately reflect what is happening in any area. And so I was just wondering, how do you respond to that? The fact that there is no part testing and contact tracing is in no way part of your plan, even though it's a plan that's supposed to be addressing how to safely reopen our economy.
Thank you for that question, Representative, and it's a very good question. And the answer is this, that we think that testing and contact tracing is a really important part of the strategy for how we move forward and defeat this virus. And it's really sort of the blocking and tackling of what a good response to a pandemic is. We see our plan as working in conjunction with the efforts that Governor Evers' administration is putting in place right now to increase our testing capacities and capabilities, and to increase our contact tracing capabilities. Our plan, and so while those are really important and we support them and we know they have to happen, we sort of viewed that as something that happens on a parallel track and in conjunction with our plan. Our plan really focuses on what we can do to recognize risk, manage risk, and mitigate risk for businesses to allow them to reopen. And of course, the more robust data that we get on infection rates, because we're increasing our testing capabilities, that will just enhance the value of the data that's used in our plan to assign risk.
So, okay, I have another question, but just to clarify what you're saying, your plan is not to replace the Badger bounce back plan provided by the governor. It is to supplement it and to work with it. And then my other question was because you mentioned that businesses would need to go back and enter new information to get an updated score every 7 to 10 days. And again, that's very concerning to me because we know that this virus moves very quickly, and 7 to 10 days, a whole lot can happen. That if you look at Brown County, for instance, they had a very low rate, and then within a week, their rates, their cases went up by 1,000%. So that sounds very reckless and worrisome to me to be updating the information and requesting updated instructions and how to proceed. But if you could just clarify first that did you just say that your plan is to supplement the Badger Bounce Back plan, not to actually replace it? And then secondly, addressing the issue about waiting 7 to 10 days to get updated instructions and how to proceed if your business circumstances change as far as employees with positive results.
So just to be crystal clear, Representative, our plan would be a replacement for the Badger Bounce Back plan, which we think is flawed for several reasons that I don't think we have time to get into at the hearing today, and that's not the subject of the hearing. But to the extent that that plan references a goal of increasing testing and a goal of increasing contract tracing, we're very supportive of that. In terms of your other question, 7 to 10 days, there's a lag time between when infections happen and when testing is done and when testing results take place. So we're very comfortable that this plan will recognize upward trends in infection rates if they occur in real time and provide businesses that information and the tools that they need based on that higher risk to keep their workers and their customers safe.
Okay, I'm going to jump there in. Representative McGuire's got a quick question, and then Mr. Manley, have you answer that very quickly, and then unfortunately we've got other people that are already dialed in. We're going to have to move on. So, Representative McGuire. Hit your button. There you go.
Yes, thank you for squeezing me in, Mr. Chairman, and thank you, Mr. Manley, for testifying today. We appreciate it. I have a lot of other technical questions that we can perhaps touch on some other time, or perhaps they'll be answered later. But for now, I'm just curious. I understand that there are sort of 3 tiers. There's minimal, moderate, and then sort of a severe. At which point along the way would we've been discussing, the impacts on worker safety here? At which point along the way would employers be obligated to provide PPE or have specific cleaning levels?
So specific cleaning and sanitization are requirements of all 3 levels. Once you get, and I would just add that for certain of the sector-specific mitigation requirements that have been suggested to us from the hospitality industry, so think of restaurants, taverns, hotel and lodging, et cetera. Those would come into play, I believe, certainly at the moderate level and in the substantial level. For all other types of businesses that don't have that sort of unique mitigation factor, at the moderate level, it's looking at establishing PPE plans, and certainly at the substantial level, it's a requirement. So it's more of an encouragement for employees at the moderate level and mandatory at the substantial level.
Okay, thank you.
Okay, Scott, if members have questions beyond the meeting, should they just reach out to you directly, or you want that? We could do it through my office. What would be easier for you?
Be happy to answer whatever questions I can, and my contact information. I sent everybody on the committee an email today, so if anybody wants to respond and ask questions or set up a time to talk, I'd be very happy to do that.
Thank you very much for your time, and I have to apologize to the rest of the members who wanted to ask you a question. Unfortunately, our slot is kind of filled up, and we are ready for our next testimony. So with that, thank you very much, Scott, for taking the time to join us today.
Thank you, Mr. Chairman.
With that, we will move on to the Grocers Association, and Skyping in is Tim Metcalf, the president and co-owner of Metcalf Markets. Is Tim available? There he is.
Can you hear me?
Yes, welcome to the Committee on State Affairs. Thanks for taking time. I apologize that we're running a little bit on legislative time, which is typically late.
That's perfectly okay. I appreciate this opportunity to chat with you and the committee. So thank you, Mr. Chairman. My name is Tim Metcalf. I'm the president, co-owner of Metcalf's Markets. We have 3 supermarkets, 2 in Madison and one in Wauwatosa. I'm a 4th generation grocer, operating for over 103 years, and we have a little over 500 employees. I've been asked to talk today about the steps that we've taken in our stores in response to the current COVID-19 pandemic here in Wisconsin. I hope that what I'm going to go through is helpful for you. It's basically a snapshot in time of what we've gone through today. I'll briefly go over some of the actions that we've taken at the store, some because of mandates and some that we just put in place to protect our team and our customers. Many of these things is what we are currently discussing. Many of these items are what we're currently discussing when it comes to reopening and what that might look like going forward. So basically for us, this started March 6th is when we kind of jumped into action. The first things that we did is we started communicating with our staff about the fact that they were essential workers. We could see that from what was happening in Italy and also what was happening in China, that the only 3 things that would be up and running in the middle of a pandemic would be the hospitals, the pharmacies, and grocery stores. So we started communicating immediately with our employees about to stay home if they were sick, about washing their hands, about social distancing, and then emphasizing with them that they were essential workers and to pretend in a way that they were like doctors or nurses, and when they left the store they should consider themselves that way, and make sure that they take care of themselves at home, washing their hands, socially distance themselves from other people within their area, because they're an essential worker and the community needs them, and they need to make sure that they're able to get back to work and be healthy. Immediately, we eliminated face-to-face meetings at the store level. We prepared for telecommuting for those people in our organization that could do that. We stopped all demos and sampling at the store level. We hired an infectious disease consultant to guide us in our decision-making processes. Then we moved into the closing of the schools order. So this is roughly around the 14th of March, and the shutting down of the UW. And that's when things really became real in the grocery business for us. We immediately saw a rush of people coming to the store, and we immediately had out of stocks, and there was a little hoarding going on. We immediately reduced our hours so that our staff could get a break, and also that we had the proper time to clean, disinfect, and restock our stores. At the same time, we closed self-serve areas like salad bars, hot cases, coffee bars. We made sure that we had enough sanitized wipes for our customers to wipe their carts down. We stopped all demos, and we reallocated personnel that were in some of these service areas to enhance cleaning and doing a 2-hour protocol throughout each department for both customer-facing and employee-facing areas and touch points. Then we moved into closing our service departments and went to prepackaged items. This was our service deli and sliced meats, our service seafoods, our service bakery departments. We removed all bulk dispensing, bulk coffee, bulk water, closed all our water fountains, and sheltered our cafes with no tables, and removed and did social distancing in our break rooms. This was not per an order. We did this on our own because we wanted to reduce the number of touch points between our customers and our employees. We also felt and were concerned about the social distancing, if we'd be able to maintain that in front of these service cases as customers queued to try to get products for those areas. So we were kind of maybe a lone wolf in that area, but we felt that that was something that we needed to do. We also started wrapping our produce to add an additional level of safety for customers, that they would have a feeling that other customers didn't touch that prior to them being there. Once the Safe at Home order went into place, here at Metcalf's, we added a $2 premium for our frontline workers. We installed special hours for seniors and healthcare workers, and we alternated that so that they didn't come in on the same day, but they had separate areas to shop. We started cleaning our carts for customers at the front door, and the reason for that is we felt that we would not be able to maintain our supply of sanitized wipes, and we wanted to conserve that for our front ends. So we went to a disinfectant and had our employees do that for customers up front. We installed plexiglass on all our customer service counters, and check stands. We posted social. We started doing social posts on our Metcalf social media for both customer-facing and employee-facing about what Metcalf was doing in response to C-19 and changes that we were making to protect both our customers and our employees. We installed social distancing signs on our floor to help remind people to social distance while they were here. We also did over speaker announcements every 10 minutes to remind them to social distance. We developed protocols for the possibility of a positive case and what our action would be to that. We also developed protocols for a customer case if we should be contacted by local health officials. We hired an outside sanitation firm to do sweeps through our store with a hydrostatic sprayer and disinfectant. We've recently purchased 3 hydrostatic sprayers for our stores, cost about $12,000. And we're using that to sanitize our carts so that they're pre-sanitized for our customers before they go shopping. We also purchased 3 portable hydrostatic sprayers, and those will be used for our self-checkout stands, our checkout stands, and frequently touched areas by our customers and our employees, so both customer-facing and employee-facing. We also got prepared and made preparations, and these units also gave us that ability to be prepared to do deep cleaning should Metcalf's get a positive C-19 case here, and we would be prepared for that. We've made gloves mandatory for our employees. The reason behind that, and this was taught to us by our infectious disease consultant, is to remind ourselves to not touch our face. So not necessarily to protect the employee by wearing gloves, but by wearing the gloves, just by having them on, it's a reminder to the employee to stay away from their face, because that's how this disease is transmitted, by getting in the T-zone. So that's why we got gloves for all employees. We stopped allowing reusable bags at our stores. We put in a no return policy. This is to stop things from coming into our stores. We also had to put in place no rain checks because we had issues of stock conditions. So that was put into place. We took all our aisles to one-way aisles to help with social distancing within our stores. And then we also put up signs to request that customers would shop alone or 1 cart per person. It wasn't a mandate. But it was a request of the community to help us maintain our social distancing plan here at Metcalf's. We also requested customers that they would shop for 1 or 2 weeks, and I think that's been very successful. We recently have mandated all our employees to wear masks, and again, that is to protect other workers. If you should be sick, you that won't spread, hopefully, to other workers. And also wearing a mask is another reminder, a constant reminder, is to stay away from touching your face. And it was helpful in that regard. We also gave literature to all our employees regarding the wearing of masks, because it's very important when you are wearing a mask that you wear it properly, that you clean it, that if you touch the outside, you don't touch the inside. So there's really specifics on how to wear a mask and to keep yourself safe. So we did a lot of training with our employees on how to do that. We also put up signs recommending that our customer wear masks. We're aware that other retailers recently have required that. We haven't gone there yet, but it's something that we're aware of. We also implemented occupancy limits. Currently, we're about 16% is what we're running at Metcalf's, is what our limit is. That's about 150 customers at a time. We count customers as they come in and as they leave, and we keep track of that number. We've had a few occasions where we've had to queue outside, and we have cones out there that help customers know where they need to be in terms of a 6-foot distancing. We recently installed an electronic foot traffic counter, so now we don't have to do it by counting by hand. We have an electronic mat in that counts customers coming in and leaving. So we'll have a real-time number of the number of customers that are in our store. That also will be live on our webpage so that customers, if they're coming to the store, would be able to see how busy we are at any given time. Before we're open, again, we have those cones outside that help customers queue up before our opening hours, and or if we should ever have to queue them if we ever hit the 150 mark. We are prepared here at Metcalf's to do temperature tests, and we have protocols in place on when that would begin. Just a note for the committee is that we found it very problematic to find temperature equipment. Should that be something that we're doing? Our first order that we ordered came in counterfeit. It didn't work at all. So that type of PPE equipment out in the marketplace is very scarce. So if employers are required to do temperature checks, or if it's part of their protocol, it's a very difficult item to secure at this point, and hopefully that'll open up. So those are kind of the actions that we have taken. The list actually goes on and on of other actions that we've taken, specifically maybe in the HR area regarding our sick leave policy, our PTO use, our protocols if someone should come in sick, and what that protocol is for them to come back, changes in our benefits, and the list goes on. We still have at least about 30 days in this current stay-at-home order, so our plan currently is focused around looking at retail, what departments are going to reopen and when, what those trigger points are for reopening of those departments, what added precautions we will take when reopening to maintain the safety of our customers.
Hey, Tim.
And our employees.
Tim?
And we'll go ahead.
I hate to interrupt, but I want you to stay on the line, and obviously you're giving us a pretty thorough report. I've got two other people in the same block as you, so I'm going to ask you to stay on the line. I'm going to bring them into this discussion as well, and then the committee will ask all three of you questions.
Sure.
So I didn't mean to cut you off, and I know I think you're getting close to wrapping up anyway, but.
I was.
Yeah. Why don't you stay on the line, and I got a couple of people in the queue that we're going to get in for the committee to ask everybody questions.
Thank you.
So we're going to move to Troy Berg, who is the CEO of Dane Manufacturing. Troy, are you with us on Skype?
I am, thank you.
Hi, Troy. How are you?
I'm good. Thank you for having me today.
Good. Thanks for taking time to join the Committee on State Affairs. If you could just give us, your overview as well. I've got one other person behind you, and then I'm going to have you and the other person and Tim come back to answer some questions after all three of you have presented. So you have the floor.
Thank you very much. Thank you for letting me address your legislative body today. Appreciate the chance to be here and speak with you. I'm Troy Berg, the CEO of Dane Manufacturing. At the same time, my wife and I are the owners, so we are a mom and pop shop, as they say, and have been for the last 20 years. Dane's a 102-year-old business operating in 3 facilities, so I want to give you a little background on the business first, talk a little bit about some facts about the business, and then talk about why we're an essential business going forward, and then speak a little bit about the uncertainty of where we're at in the state. And then I'll take questions with the other 2 speakers. So we're a 102-year-old company. We operate 2 facilities in North Dane County with 100 employees. And our 3rd facility we operate in Spartanburg, South Carolina, where we have an additional 50 valued employees. At Dane, we manufacture a lot of metal products, like a lot of companies in Wisconsin, for a lot of Wisconsin-based manufacturers and OEMs. Some of them are essential businesses by the definition, and some are not. Many are not. Our company in Spartanburg makes its own products. It's an OEM called Dantherm Cooling, and they manufacture electronic cooling products, primarily for telecommunications and oil and gas, and they ship all over the United States. We're a small business with a significant impact in our relatively small communities with which we operate. We have over 200 different suppliers, 90% of them located in Wisconsin. I'd really like to stress a couple of key points. Every job in our factories, on average, impacts 4 people. So that's a family, that's an extended family, that's partners, significant others, children, parents, and seniors. That's 600 people that are impacted by our 150 employees. If you take the multiplying effect for manufacturing, for every dollar of production, there's a multiplier of 1.33. Our 150 employees impact about 1,400 people. So it is really a big deal that every job we have be protected and maintained through these difficult times. So that is my goal, and that is my leadership's directive, is to maintain every job. We're fortunate at Dane because we're considered an essential business by the definition of Governor Evers' Safer at Home order, as well as the Critical Infrastructure Act and Homeland Security, which the governor's orders point to. Because we manufacture products directly for healthcare and hospital construction, hospital maintenance, construction industry, as well as energy production and telecommunications infrastructure. For these reasons, we've been able to continue to operate. Like Mr. Metcalf, on March 5th, we sprang into action and we closed our campuses to any outside visitors. Inside of our factories, they're rather large, so we're able to have our workers do their jobs at very safe distances, much longer than 6 feet from each other. So social distancing is not a problem while they go about their everyday work. That's part of our normal operation. And we've instituted a lot of additional procedures for cleanliness, including wiping down a lot of the common surfaces that workers might touch on the machines. A lot of our workers operate with gloves anyways during their normal operations, so there's been a reinforcement of that procedure for their safety as well as for this disease. We do run a 3-shift operation and have taken extra precautions during shift change times as well as break times and lunch hours and dinner times to maintain the social distancing by rotating those times throughout the day for the different employees. Employee safety is our number one goal here at Dane Manufacturing, and like many employers, we care deeply about our people and we love them. We have no employees since February up to through today that are testing positive for C19. So some of our procedures and our being extra careful and educating of our employees has been effective measures, I think, in in keeping this disease outside of our campuses. Speak a little bit about the impact of the Safer at Home order on the business. I can't overstate the negative impact to the business and the continued mandated shutdowns we've had for our customers. Many of our customers are not considered essential businesses and therefore have been required to shut down and remain shut down in order to bend the curve. Now, flatten the curve has turned into squash the curve and some more uncertainty. Some of our customers were able to run by the essential definition, but many have shut down anyways because of the softening of demand for their orders with their products. With our customers idle, they don't need parts out of our factory, and that in turn impacts us. In March, our sales dropped about 15%, and that's understandable given the disease's impact. In April, those sales dropped 30%. And I'll tell you, many businesses can't sustain a 30% reduction in revenue. We're fortunate we're not in the hospitality industry where the revenue's gone to zero. So in most cases, when a company experiences a 30% reduction in revenue, many businesses will make hard decisions and hard changes to reduce their headcount, change their pay structure, reduce some of their staff to try to remain viable. We haven't done any of those things. And so in April, we lost money. And I know that everybody says, well, you're a big company, you're a fat cat, you can handle losing money for a little while, so just suck it up and keep going. You need to understand that no business can continue to operate at a loss and to remain viable. At some point in time, our creditors and our banks step in and say that's not okay. And so it is a big deal to maintain all of our employees. And sales in May and June look worse than they have been in April. So it does not look very good out there. These are terribly hard decisions for me and my leadership at Dane to make, given these times. But maintaining our employees is our number one goal. The extension of the Safer at Home order with no certainty or conditions for reopening our economy is completely devastating to somebody in my position. We need certainty in order to plan, and in order to plan what we're going to have from resources, as well as suppliers, as well as materials, what we need to keep on hand, inventories, and operating 24 hours a day just exacerbates those challenges. I'm going to conclude with support for the Back to Business plan from WMC. I don't understand, the governor's one-size-fits-all approach to this shutdown. Many of us in the outlying regions don't have near the infection rates nor near the challenges that the major metropolitan areas have. Both of our plants in Wisconsin are in rural areas and small rural areas where the infections don't exist, and C-19 is not prevalent. We support a common approach back to business plan from WMC. We need certainty in order to plan for our operations and for our employees. It's a straightforward approach that tackles the reopening without throwing caution to the wind. And the number one goal is safety for all of us, including this plan. One of the key elements is the location of the business inside of the state of Wisconsin, and then the healthcare capacity in that location. Not all areas have the same population density nor the same disease infection rates. So please work together with the governor and try to create some certainty around some plan with some attainable metrics so we can reopen Wisconsin for business and we can get our people fully back to work and engaged. They're all here, but eventually they're all going to be pushing brooms. And at some point in time, that becomes untenable. Thank you for your time.
Well, Troy, thank you very much for taking time to join the committee here in Madison today, giving us the background of Dane Manufacturing and your employee situation and what you've been going through. I'm going to ask you to stay on the line, and I'm going to bring in another speaker, and then I'm going to take questions from all three of you, actually, okay?
Thank you.
Very good. I'm going to ask Mike Nicolai, the president and CEO of Wapaka Foundry, to join us. Hey, Mike.
Good afternoon.
How are you?
Thank you, Speaker. Very well. How about yourself?
Good. Thanks for taking time. I apologize we're running a little late, but I would like to give you the opportunity to tell us about Wapaka Foundry and what's going on with your business. And then I'm going to ask you to stay on the line, and the committee has questions for all three of you.
Yeah, and maybe I'll, since my counterparts answered some of the essential questions and I would say the health and safety mobilization, so I will try to maybe address more of the back to business plan. But just to the lead into that, I would say this is a risk-based plan, and I got a funny little story. I took some risk last night because I told my son I'd like him to give me a haircut. He's only 16 years old, and I think he did a pretty good job. So there's something good coming out of the stay-at-home orders. So just a little bit amusing. So to give you a background about our business, we're 100% owned by Hitachi Metals. So if you see the Hitachi excavators, that's Hitachi Limited, which owns 51% of Hitachi Metals. We have over 4,700 employees in 6 states, and our plant locations all have similar demographics. The plants we operate are all in small towns, so less than generally 7,000 citizens. Specifically for Wisconsin, we employ 2,450 people, both here in Wapaka and in our Marinette plant. The good thing I'd like to say is we've had no cases now in all of our plants in all of our locations. We were deemed an essential industry, and this is mainly because we have a large transportation industry connection. We do work for Caterpillar, all the OEMs, and also for John Deere, who's generally one of our largest customers, and they've all deemed us essential. So because of our Asian connection with Hitachi, we started having action teams in all of our plants in January because we were getting feedback that there was a risk to this. So we've put in action plans through our health and safety, and we've all been mobilizing. The level of mobilization changes daily based on the different municipalities and government areas that we're having to react to. So I think my counterparts explained a lot of the mitigation that we're doing. I guess what I wanted to add here is I think as an essential business, we have demonstrated that if you take the proper actions to protect your employees, we can be both essential and safe. One of the questions I heard prior to for Mr. Manley was this plan doesn't include the employees. And I can tell you from my perspective, when you manage plants in towns less than 7,000 people, and generally our plant populations have between 750 and 1,000 people in the plant, we're a substantial portion of that economy. So we do think about our employees first. One of the first things we did when the safe home orders hit was we did give all of our employees an additional week's vacation because we knew there was going to be a lag in the unemployment benefits picking up. So we did try to protect the employees, and when you talk about the monetary effect, that's about a $3 million effect for our company. So the economic impact, right now our business is about 50% what you would consider automotive, 50% non-automotive. Our business here in April for automotive is at about 1% of our budget. So we generally do 50 to 60 million in automotive business. We're at about just over $2 million for the month of April. We expect the same result in May right now. So the biggest thing I wanted to do is tell you why do I support the Back to Business plan? When I first saw the outline of this plan, what I wanted to explain to the group is that this is a risk-based system. Our plants supply a lot of safety critical parts. So when you get in a car and you put on the brakes, it's generally a Wapaka Foundry disc brake or a caliper that stops the vehicle. So we always have safety risk in all the products that we driven. And if you look at it, we have to meet international standards called ISO 9000, IATF 16949, and these are quality and safety systems that are using this exact same risk-based methodology that looks at the occurrence, the severity, and the mitigation. And if you can reduce your risk, it allows you to open. It also uses very good best practice. It was developed using the OSHA guidelines. One question was, what about the medical? The Hospital Association was involved from the start to look at the hospital availability, and then we've used also the CDC guidelines. What I like to think is it's easy to understand. It gives something where if you go into a business, the consumer knows its risk. So if you choose to stay home or go out, before you walk into a place of business, it can be posted and easy to understand. Also easy to update. I heard the question from one of the questions about whether, is it easy to update? The goal of this would be to be able to go on and update your score. It's based on a 7-day rolling average based on the infection rates. I believe the system can be adopted quickly, and if we ever get back into a pandemic situation again, if we adopt it, the system is there and the government can enact it based on the principles. So with that, I'd be glad to take questions for our group.
All right, thanks, Mike. Appreciate the update from Wapaka Foundry. We are certainly proud to have you guys doing business not only in Wapaka, but in the state of Wisconsin, so hang in there. With that, we're going to move to a couple of questions. I believe Representative Vorpagel had a question for Tim Metcalf from Metcalf Markets. So, Tim, are you still with us?
Yep, I'm here.
Representative Vorpagel.
Thank you, Chairman Swearingen. And actually, what started off as a question, I wanted to get in and got a little ahead of myself because I was going to ask how you and everyone else were dealing with employees and if the concerns that they have, and then you went and listed a laundry list, everything from PPE to social distancing limits to plexiglass to, you had mentioned changing your sick leave protocols and benefits, and it really showed that you guys put a lot of thought and value your employees. So I guess what started off as a question you guys had already asked and wanted me to say thank you for everything you guys have been doing to respond to this and staying open and keeping employees on the books while you're sometimes maybe not being as profitable. And I know this isn't just the three of you. It's also, I hear all the time from my employers in Sheboygan and Manitowoc County that every single one of them are doing the best they can to keep people on. And I guess maybe just to end with a question, if there's anything you guys to add on things that you guys have done that you think are important to engage with your employees and make them feel comfortable, just go ahead and add it.
Yeah, I guess what I would just say is that I think all three of the speakers, on this call today are emphasizing that employers that are essential businesses, we all take the responsibility of our employees and our customers, very importantly that we take care of that. We're essential to this economy and making sure that they're healthy and get here back to work and training them. And I think all three of these gentlemen on this call, and I think the businesses that are going to be restarting up, I think they're all going to take it very seriously in terms of taking care of their staff and abiding by whatever we need to abide by to make sure that our customers and our employees are safe.
Okay, thanks, Tim.
Yeah.
Representative Schra, you have a question for?
All three.
Okay.
Actually.
Yeah,
Three,
go ahead.
three quick ones. And if it helps Representative Sinicki at all, gives you any consolation, it's my understanding that I'm Chairman Swearingen's favorite committee member and most trusted confidant in the whole building. I begged him to have somebody come from my district, and he turned me down. So if it makes you feel any better.
And now back to the question.
So my first question would be for Tim. And Tim, you mentioned you were talking about the possibility of using face masks or requiring your employees to use face masks. And I know that there's a certain retailer that has a membership fee that has announced now that they're going to be requiring members to wear a mask. And I'm wondering if you have given any thought to how that plays out. If they don't come with a mask, do they not get in? Is your store going to offer them a mask or have one available for sale? So, if you could just touch on that a little bit.
Sure. I mean, we just heard that. We've heard about that coming out of New York and other areas where retailers were doing that, and some of it was, government mandated that customers were required to wear masks instead of just being asked to do that. Today is when we learned about the membership retailer that you mentioned, and also another Wisconsin-based retailer requiring that. The Wisconsin-based retailer is offering masks for sale for $1 a mask at the customer service counter. We have quantity enough here at Metcalf's to be able to do that. So that was in our discussions today. We haven't made a decision if we're going to go there. We're just going to kind of see what happens in the marketplace. We would be supportive of every customer wearing a mask, but right now we're not requiring it. But if we did require it, we would have them for sale at our stores at the customer service desk. To answer your question, would we turn a customer away? I think the answer would be if we did that policy, that would probably be what our policy would be. But knowing Metcalf's the way I know Metcalf's, we would probably, if they couldn't afford to buy one or didn't want to buy one, we would probably just give them one and let them in the store and not create that confrontation. But so that's a decision that we've yet to make.
Okay. So this question would be for actually all three of you. And I'm just wondering if there's been any uptick in workers concerned or workers quitting in the last several weeks. I know maybe when this whole pandemic started, there were concerns. I had a couple employees, that were concerned, but just wondering if all three of you could just maybe even with a yes and no answer, if there's been any upticks in workers, being concerned and coming to management and saying that they didn't feel comfortable at work.
We'll start with Troy Berg. Got your mute on, Troy?
Sorry.
There you go. Whoop.
Mute's still on.
Try it again, Troy.
I'm sorry. There. Can you hear me now?
Yeah.
Okay, pardon me. Early on in March, when it was really new and the news was streaming lots of information about the disease, we tried hard to stay up on top of what was relevant and factual and work hard to keep that information in front of our employees. We do a little bit of a shift change at the start of every shift, 15 minutes. We do a little bit of a in the shift, and the team leaders run that. So the communication all the way down through my management's always been to try and educate and work around facts and keep the hysteria low. No employees have walked off the job or quit. Early on, some went home for fear of the disease and the spread, and we have a couple that are working from home because they are vulnerable employees, but they're still with us. So hopefully that answers your question.
Mm-hmm.
And next to Mike Nicolai.
I would say the unemployment rates were so low in all of the areas that we manufacture that we've actually seen an improvement in our attendance, because I believe the worker is more scared about will they have a job when they come back at this point over the effect of the virus. But again, we're operating in population densities that haven't seen a huge effect to the virus. So that's really where we're at in Wapaka. I think because we had the action teams in place before it hit, that we did enough mitigation to make people feel at least safe enough to come to work. And we have been able to move people around who I would say were uneasy with some of the protocols where we couldn't put exact CDC guidelines in place because of other safety concerns, because we have molten metal in place. So some of the areas to have a face mask on, there's no fire protected face masks that are easy to get a hold of. So some of those areas we're doing the best possible to make the employees feel well.
And we'll finish that round of questions with Tim real quick.
Yeah, thank you. Early on, we have young employees that are beggars, and their parents didn't want them to be here during this time. So we probably had 20 or 30 young people that didn't want to be part or didn't want to be in this environment because they knew that we were going to be one of the only businesses that were open. Since that, I think our employee base is very happy with what we've done to mitigate the risk throughout our store. I think they're actually really proud of some of the things that we've done. Now that we're starting to discuss the reopening and what that looks like, the input that we're getting from our employees is a little bit of concern of like, what does that look like? How do we maintain social distancing in terms of some of these service cases, and how do we maintain social distancing for our employees? So I believe that we're going to come up with a plan that's going to take all that stuff into account and make our employee base feel comfortable. We haven't had any people not want to be here or leave in recent weeks. They all feel comfortable, but we're starting to talk about the reopening, and that's where I think once we communicate that, I think they're going to be comfortable with it.
Okay. Representative Onstead.
Well, thank you, Mr. Chair, and I'd like to thank all three for being here today, and just want to say what an incredible job you're doing, and also thank all of the essential workers, the hundreds of thousands of them working across the state of Wisconsin that continue to, certainly the economy is not at its best, but it's still sputtering along, and it's because of the hundreds of thousands of workers that go to work every day in these essential industries. And I have to say, just amazing stories in terms of just how proactive and creative you were. Tim, especially, you spoke to that in terms of how you've made your grocery store just so safe. And Mike, I just got to say, in January, you were looking at doing something particular. If I guess if the whole country would have been as proactive in January, we may not have been in the situation that we're in now. But I would just like to say that in the Back to Business plan, it states that 48% of the cases are in Milwaukee, and that's a relatively new plan, and that number has changed from 48% to 43%. It said that it's not in 7 counties. Now, unfortunately, that's gone down to that there is none in 6 counties. So we obviously are not, although I wish we would have had further opportunity to talk to Mr. Manley, because he talked about flattening the curve. And even though we've seen some progress in that direction, the question is, if we have not flattened the curve, as directed really by the CDC and the White House and also the governor's plan, do you think that without further progress in terms of flattening the curve, Do you think that there are serious dangers in terms of going back to work too soon, eroding people's confidence in all of our workplaces and in society in general, and also, of course, causing the unnecessary deaths of tens of thousands of more Wisconsinites if we were to spike again? If somebody just wants to speak to any or all of that.
How about, let's go to Troy.
Sure. So there a couple of problems with your statement. Number one is we haven't seen tens of thousands of people die in Wisconsin. We've seen a couple hundred, and let's not make the assumption that everybody that gets C19 is going to, in effect, die. The death rates are somewhere between 0.1 to 4%, depending on what studies you want to look at. And the majority of the people that die are over 70 years old. And so a lot of our workers, my workforce demographically ranges from 18 to 58. And speaking strictly about Dane manufacturing, a lot of those workers, if they were to contract C19, would probably come out the other side healthy. And so at some point, we have to deal with the differences between a life and livelihood. Because if you impact this business much longer than end of May, we're not going to be here for the 1,400 people that are impacted by the business. That's my short answer.
We'll take one more. Mike Nicolai, you want to follow up on that?
I guess I'll more address the why I support the B2B plan, because your question really is about risk, and that's what the plan, I believe it does. It's the same thing when I make a automotive rotor for, say, the Toyota Camry. We go through all the protocols of what the failure is, and then you look at the risk. Everyone wants to pay the least amount for a car. So when you look at it, you look at what is the severity, and in this case, the severity is high. It's if you're in the right age group, you do die. So the severity of this situation is simple, but you have to look at the other risk factors in it. What is the occurrence, the demographics, and I think it gives you a reasonable way to address how to reopen the economy, because if you want zero risk, then you'll have zero economic activity.
Want to follow up, Representative Onstead?
Yes, I would. Just for a second, I obviously was referencing the 60,000 U.S. citizens that have died, more people who have died in the last 6 weeks than died in nearly 20 years in Vietnam. And obviously there's some risk. There was risk getting here today, but that was a choice that I made, not a choice that was made for me. So once again, I'd like to thank all of you for what you're doing in the state of Wisconsin, keeping people employed, and all of the workers that work for you, and all of the essential workers that work across the country. But I think that we all want to get back to work. We all want to get Wisconsin back to work. But we also have to make sure that we do it responsibly, in a way that protects our workers, that protects our citizens, and our senior citizen. As somebody who's going to turn 68 next week, that's pretty close to 70. I don't want to die from COVID, and I don't want my neighbors to die as well. And I'm sure you don't either. Thank you very much.
All right, thanks. We have a couple more people in the queue for questions, but out of respect, Missy Hughes, I'm just double checking that we're a half hour behind what we thought you were going to be on. Are you still okay? Okay, then I'm just going to take questions from Representative Kuglich and then Representative Sinicki. And then I think we'll probably move on. I apologize for the others that are in the queue, but we're still trying to maintain our schedule here. So Representative Kuglich, who do you have a question for?
Thank you, Mr. Chair. And the first one is to Mr. Metcalf, and then another question for the other two. So when you're kind of going through your timeline, it seemed like it was about a 6 to 8 week process. And your industry or your sector is a little bit different than the other two because you have interface with customers. Have you had any feedback from the customers as to the level that they feel safe with the different mitigation that you put in place?
Yeah, we get Facebook comments and emails throughout the day regarding all the mitigation that we've done to keep them safe at our stores. And I don't think that's just, I would say that's probably most grocers in the state, because we are one of the very few things that are open right now. That I think most of the grocers are taking many of the same steps that we've taken. And I think we're getting lots of comments from customers about what we're doing to make sure that our employees are safe, and making sure that our customers are safe. So it happens all the time.
So just going to have a follow-up. So you have feedback from your customers that say they feel safe because of the mitigation you put in place.
Yes.
And then if you look at this back to work program, is there any additional mitigation processes that you put in place that wouldn't be in place in this WMC program?
Yeah, when I was asked to speak today, it was really the request that was given to me was really to kind of give a snapshot of what we've been going through. So
okay.
I have to be honest, I really haven't studied that program, in its entirety. So I apologize for that. I'm trying to represent what the
Sure.
grocery industry has really gone through.
No, I appreciate that, because it sounds like you have done a lot, and it sounds like the grocery industry overall has done a lot to mitigate it, and it seems like the customers feel safe. And I have gone through this program, and it seems like that what you've done is in parallel with what this back to work program is. And then a question for the other two gentlemen. Based on your comments in my notes, so please correct me if I'm wrong, is that currently you've been able to keep your staff or your employees employed, but based on both of your testimony, is that you've kind of gone through the backlog. Your new business is down because of this closure in our country, and that both of your businesses really rely on demand from the other businesses. And my question is, if you continue to see a decrease in your, let's say, sales or revenue, how long are you going to be able to keep your employees employed, or are they going to have to go on the unemployment line? Thank you.
I guess I can take it first. So to direct when, like we have facilities that are strictly automotive. Waupaca, Wisconsin here, we operate 3 facilities. So one facility is directly automotive. That plant has used the unemployment, so we use the additional week vacation that I discussed to be able to bridge to the unemployment. So we are using the unemployment systems. None of our salaried, though, has been furloughed. We will continue to operate that way. We do pay a profitability bonus at Waupaca Foundry based on 6 months of our fiscal year, so it's paid twice per year. We have had to announce the suspension of that benefit. So there was a economic study done by Waupaca County to the effect that Waupaca has. And if you look at that we, between the businesses we support and our employees, we operate at about $82 million into the Waupaca County economy. And if you just look at our bonus paid into Waupaca, that's about a $7 million effect that will not happen because of the lack of demand.
And Troy.
That's a tough question. I'll try and answer it as quickly as I can. Because of the PPP program, we were able to obtain a loan through the federal government. We're less than 500 employees, and we are a small business. And that helps our payroll and some of our other expenses through from April 16th through June 16th. So from that time period, it's very easy to make the decision that no employees, staff, or direct hourly will be cut, furloughed, or anything else. Past that point, we need to start to see some recovery. As I explained before, manufacturing has very high fixed costs, and so not just the plant and equipment, but also all the operating expenses to support the machine. The machine being the factories, and so big spaces, lots of big capital equipment, and lots of it with some debt on it, because in order to operate, you have to constantly be replenishing your equipment to stay current and stay competitive. It's still a very competitive market. So past that, I think it's difficult, and so every additional day or week that we stay open to try to protect the vulnerable is a challenge. And I'm not trying to say that I'm insensitive to the lives. I have lots of family members that are in that vulnerable category, all of my neighbors as well. And so I'm not insensitive to that. At the same time, I'll have a lot of families that depend on these jobs. And so at some point in time, the bank wants to be paid back, right? And so the bank needs to have their monthly payments, and the people that have the debt on the machinery need to have their monthly payments. And so without the certainty of opening and just no clear definition coming from the governor, it's very difficult to plan.
Okay, thanks, Mike. Representative Sinicki.
I am going to.
Turn your mic on.
Sorry.
Thank you.
I'm going to yield my question time to Representative Stubbs, but before I do that, the reason I'm doing it because I'm 60 now, so I have 10 good years left, evidently, so my questions don't matter. So
Representative Stubbs, I understand that Tim Metcalf is actually a constituent of yours.
Absolutely.
So we are going to allow you to ask a question to Mr. Metcalf.
Always honored to be given this opportunity. Thank you to Representative Sinicki. Thank you, Chairman. My comment, and then I'll go to my questions very quickly. Given the update on status for COVID-19 cases as of April 29th, 23% of COVID-19 cases are Black people, 33% of COVID-19 deaths are Black people. Black people only make up 6.7% population in Wisconsin. My area of questions is with minority and low-wage employees during this health crisis and their concerns. With your businesses, many of your businesses employ minority workers, and we know for a fact that minority workers are less likely to be paid sick leave and thus more likely to continue work, even though they're sick for reasons. What specifically have you implemented with your organizations, your businesses, as it relates to sick leave?
So we'll start with Tim.
Yeah, Sheila, thank you for that question. We didn't qualify for the CARES Act. So what we did here at Metcalf's is we bridged any employee that comes positive for C19 for the first week at, I think I'm not sure if it was 66% or 100%. But then they would be eligible for short-term disability, which I believe that goes out to 13 weeks. But that's what we did here. We also relaxed our PTO policy that if employees needed or wanted to use their PTO or vacation times, they can do that. We wish we actually qualified for the CARE Act, but we did not. So that's what we did here.
Okay, and Troy?
Yeah, so in our Dane plant, 28% of our workforce is Hispanic and 10% is African American. In our Wanakee facility, it's 50% African American and the remainder is Hispanic. So we don't, all employees get the same benefits. Doesn't matter race, doesn't matter age. They're 13 days paid vacation the day they start working for the company. And we have a short-term disability policy in place should anybody fall ill. They get paid 66% of their wages for 13 weeks. They have the 13 days of paid time off, and as they're here longer, it grows to be up to 25 days of paid time off. So most of our workers have, as I said, nobody's contracted C-19, and should they contract C-19, obviously they would be eligible for a short-term disability, and then after that, I believe they would be eligible for FMLA and some other benefits. So what we'll do is make sure that none of them fall between the cracks, minority or Caucasian. We value all of our workers no matter their race.
Okay, thanks, Troy. Mike?
And I covered ours. We added the 1 week vacation, which can be used for sick leave. So basically, starting employees get 2 weeks vacation. So we added to that week to be able to bridge. And then we have the other benefits that other speakers discussed, and the qualification for the CARES Act.
All right, gentlemen, thank you very much. This is going to end the discussion for the essential business block that we had set aside. I just want to thank once again Troy Berg from Dane Manufacturing, Mike Nikolai from Wapaka Foundry, and especially Tim Metcalf from Metcalf Markets. And Tim, I do apologize for cutting you off initially, but I want to thank all three of you for taking time to spend a little virtual time in the state capitol today. So thank you, gentlemen. You may feel free to disconnect.
Thank you.
Thank you, Mr. Chairman.
Thank you, Mr. Chairman.
Next, I am very apologetic, but I want to thank very much Missy Hughes, the Secretary-Designee from the Wisconsin Economic Development Corporation, for being here. I'm appreciative that your schedule wasn't as tight as some of the others. So thanks for waiting around. I am very happy you took time to join us today. I apologize for the short notice on the meeting itself. And with that, I think you're going to bring us up to speed on Wisconsin Ready. I think, is it Ready Wisconsin or Wisconsin Ready? Wisconsin Ready. Wisconsin Ready, all right. Missy, thanks again, and you have the floor.
Thank you very much, and I'm glad to be speaking. It'll give me a chance to be in the hot seat and warm up. It's chilly in here. So, good afternoon, and thank you, Chairman, for inviting me to speak with you today. So I want to start, I appreciated your words at the beginning of the hearing about the relationship with the administration and working together. There's lots of opinions about what is happening and what we need to be doing here in Wisconsin. But through all of that, I continue to see places of agreement. And so I just want to start by emphasizing where those places of agreement are. First of all, everybody agrees that public health is incredibly important in this moment. The next thing that everybody agrees on is this isn't flipping a switch. This is going to be a phased approach to re-entering and gaining momentum in our economy. And the last thing that everybody agrees on is we need data and metrics to help guide this. So for all the controversy that we tend to make for ourselves and the conversations, there are places where we agree. And I think if we can help focus and help each other focus on those places of agreement, we will get farther in this whole process faster and quicker. So, Chairman, I think you might remember that we met in Rhinelander.
We sure did, Nicolay College.
Yeah, that was about 7.5 months ago when I started my tour here as CEO and Secretary of Wisconsin Economic Development Corporation. And the one thing I'm thinking about as I sit here are the beautiful fall colors that we saw in Rhinelander and the forward-looking I have to coming to your supper club and having an old-fashioned. So I hope we can plan on that at some point in the future. And I know you're anxious to reopen your supper club and are faced with challenges there. So since October, I have had the opportunity to travel throughout Wisconsin, visiting businesses and communities. I've attended groundbreakings and ribbon cuttings. Everywhere I've visited, I've seen people working together to improve the quality of their lives, whether it was a small business hiring kids in town, a larger business expanding their capacity, a transformative model like Sherman Phoenix in Milwaukee, or a community like Shell Lake that has built a clinic with the idea of attending to their year-round citizens, their senior citizens that live in Shell Lake, and they wanted to make sure they had ways to take care of them. So there's always an overwhelming spirit in Wisconsin for caring for your loved ones, your neighbors, and your friends. So specifically, though, I want to remember a time in January, late January. I visited a large employer outside of Milwaukee, And we were talking about a potential expansion and how WEDC might assist with that expansion. And as we're walking out of the conference room, you know, that small talk when you're chatting, ending a meeting, one of the gentlemen mentioned that he had had his trip to China canceled. And in fact, the company had canceled all travel to China, and that they were anticipating that the 6,000 employees that this company has in China were all going home, and the factories that they were working on were closing. So it was just at that moment when I realized that even if nothing else happened, the impact on the Wisconsin economy was going to be incredible from this virus. A few weeks later, I had the chance to travel to Wisconsin on a trade mission. Mexico is an incredibly important trade partner to Wisconsin, with over $3 billion exported every year. And in fact, Wisconsin exports a total of $21.5 billion to over 200 countries every year. So it's something to keep in mind as we think about recovery and about the impact on the international marketplace and what we're seeing there. So while I was in Mexico, I met the Deputy Minister of Foreign Affairs. He's a lovely man. One of his best friends went to UW of Madison, and we had an incredible discussion about Mexico and United States relations and what was happening with USMCA. At one point, we did discuss coronavirus, and we discussed the fact that it was impacting China very much. And was there an opportunity for Mexico and Wisconsin and the United States, in light of that disruption in the supply chain, for opportunities to come to both of our countries? So that was on February 20th, less than 75 days ago. Since that time, 1,700 people in Mexico have died, and 61,700 Americans have died. And then in late February, I had the chance to go down to Kenosha and meet with the Kenosha Area Business Alliance. And again, what's going on with coronavirus? What can we expect? What's happening with that? And at that moment, we were talking at the administrative level about preparing hospitals to understand if somebody walks into your ER with symptoms, what are those symptoms you need to be looking for? What are those things that you should be thinking about? We're at the very, very early stages of this. So after that, things turned rapidly and changed rapidly. Social distancing became a term we all knew. First, gatherings of more than 250 were advised against, rapidly changing to 50, then 10. Wisconsin cases began to grow. On March 17th, we saw the impact of social distancing restrictions on businesses in Wisconsin, and the WEDC board unanimously approved SB 2020, an emergency grant program of $5 million to help businesses with less than 20 employees impacted by COVID-19. Rapidly after that, on March 19th, we saw our first 2 deaths in Wisconsin. Since that time, we have lost over 300 Wisconsin citizens. And I say that not only to remind us of the impact on the state, but to remind us of the speed with which this has been experienced. Those first deaths in Wisconsin were just 41 days ago. And since then, I have watched the public health community carry every one of those deaths on their shoulders. On March 23rd, WEDC assisted the process of securing the statewide federal major disaster designation in Wisconsin, providing an avenue for Wisconsin businesses to receive aid through the Small Business Administration. Since that time, over 43,000 businesses have been approved for $8 billion in loans. Wisconsin has punched above its class in that situation, a testament to community banks and credit unions working tirelessly to process applications on behalf of their borrowers. On March 24th, with the issuance of the Safer at Home order, WEDC was tasked with helping businesses navigate the essential, non-essential question. I volunteered WEDC for this role because I believe that WEDC had the best knowledge and relationships with businesses and the best ability to help businesses with a complex question that no one wants to ask themselves: am I essential or not? We have fielded thousands of inquiries. To date, 4,725 unique inquiries from businesses, and we've received a lot of tough calls. My team stepped into an unknown role and has done an incredible job of building a system providing consistent and empathetic counsel to businesses trying to do the right thing. In late March, I had my first conversations with businesses looking to help Wisconsin access personal protective equipment. A handful of these businesses were considering pivoting their production from beer and vodka to hand sanitizer. And since that time, WEDC has worked with groups like Wisconsin Manufacturing and Commerce and Wisconsin Manufacturing Extension Partnership to bridge the gap between PPE manufacturers and the State Emergency Operations Center. To date, we have more than 100 companies providing PPE for the state's healthcare workers, and we are creating a resource for Wisconsin businesses to locate PPE to keep their employees and customers safe through the Wisconsin Supplier Network. And I want to emphasize for a moment the help that we've had throughout Wisconsin from our businesses, including help from businesses like Exact Sciences and ProMega to help stand up our testing capacity, and businesses like Epic and Johnson Controls that have helped with our emergency operations and tracking record keeping and helping to stand up different areas and facilities within the state. Like Wisconsin's best businesses, WEDC is working proactively, not reactively, and rooting our decisions in data. We are accessing real-time information on consumer and merchant transactions across the state, which gives us the ability to see exactly who is and who is not open, not only on a statewide basis, but region by region and potentially county by county, where the greatest impact is and where commerce continues today. When viewing this data, we can see that a large section of our economy continues to run at this time. Businesses like grocery stores, gas stations, building and garden suppliers are all still up and running and open and have been since the Safer at Home order came into place. We are also surveying small businesses throughout the state and relying on our regional economic development teams to give us insight into what is happening on Main Street. While improving our assessment of the impact on our economy, its diverse sectors and subsectors, WEDC continues to seek resources to support businesses, whether it is maximizing federal dollars through the CARES Act, state dollars, or our own budget. As a public-private entity, we have taken advantage of our flexibility to shift our resources and budget, shift our priorities to make sure we are deploying resources thoughtfully and with the best impact. Economic development continues, although we know that our job is now to focus on recovery. Just last week, the WEDC board unanimously approved a $2 million program to support ethnically diverse Wisconsin businesses and micro businesses that have slipped through the cracks of SBA's emergency programs. So with our focus on recovery, our job is to get ready, to prepare our businesses, employees, and customers by sharing knowledge we have gained about best practices for dealing with a virus that has no vaccine and is highly contagious. When our doors open, our employees and customers will expect to be safe, and our businesses must live up to those expectations. And as you just heard from 3 amazing businesses, they are stepping up to meet those expectations. Businesses are anticipating that challenge. I've had many conversations with businesses about their proactive steps to assure safety for their workers and customers. There is no business that wants to watch someone get sick on their watch. And Representative, I would add one other piece of customers coming into stores. A store is taking temperatures of customers as they walk into stores. And in fact, the customers want their temperatures taken. They're excited to see whether or not they have a fever. So there's room there for working with the customers coming in. So central to every part of recovery is gaining confidence of the customers and the employees to come back from their homes and re-enter the marketplace. We must all commit as leaders to support the collective effort to maintain the practices of social distancing, hand washing, cleaning, mask wearing. Recovery can only start with assurance that we understand the risk, that we have the tools in place to mitigate the risk, and that we are prepared if and when faced with additional outbreaks or surges. That assurance will come from our public health community. When I learned about WMC's work discussed today, I immediately reached out to Kurt and his team at WMC and asked if they would be willing to provide an overview. That evening, Secretary Palm, Secretary Brennan, and I spent 90 minutes with WMC walking through their work. I found it very thoughtful and reasonable. I am not, however, a public health expert, And I would no more expect Secretary Palm, Dr. Westergaard, or Dr. Raymond to opine on tax credits or community block grants or other economic development tools than they would expect me to opine on a tool to determine when a risk of an epidemic has passed or at least been mitigated to the point of manageability. I will therefore leave assessment of a public health tool to the public health experts. And as I stated earlier and want to emphasize now, the public health community, the healthcare community, our doctors and nurses and first responders have carried the weight of this epidemic on their shoulders. We need to thank them and respect their hard work by continuing to heed their advice. They have served us well. Finally, over the course of the past few months of my role and the past few weeks of this crisis, I have had the chance to talk to many, many businesses, chambers, ad hoc groups, and individuals. I have sought advice and learnings from CEOs of Fortune 500 companies who have seen this disease travel around the globe, and directors of minority and ethnically diverse chambers of commerce, and many small businesses, towns, regional groups, and others. I have learned about small businesses that run on cash, the unbanked and the underbanked, businesses that are not eligible for PPP or EIDL or any other alphabet soup. I have had resources on my website translated to other languages to assist businesses. I have spoken with my friends who have laid off my other friends. I know there is a call for a task force for the best minds. I also know that I want to keep my door open for all voices that have been impacted by this crisis. We find ourselves in a great moment of tension and balance. In reflecting on my testimony today, I thought of that time during a relay race, when a baton is being handed from one runner to the next. Critical teamwork is required to assure a smooth transition from one runner to the next. As public health passes the baton to economic recovery, WEDC is taking steps now to facilitate this smooth transition. However, it is incumbent on all of us to assure that in handing off the baton, we do not pass it too soon or too carelessly and risk dropping it. At WEDC, we are preparing to receive the baton. We are helping businesses to take those first steps to receive the baton, but we are also focused on the track ahead. Once we receive the baton, we have a race to run. We will look back at this moment in time, and hopefully we will have found a way to smoothly transition. We will have the tools in place to handle any additional surges, and we will not drop the baton. We have a long track ahead of us. We must run the race together. We owe that to our businesses, our workers, our citizens. We owe that to Wisconsin.
Thank you very much, Missy. Thanks for all you do
Thank you.
at WEDC. A couple of questions here. Representative Kuglich.
Thank you, Mr. Chair, and thank you for testifying. So one of the things, and I'm sure a lot of the legislators may have the same question, but when it first came out that there's going to be essential and non-essential businesses, what was the criteria that was used to deem something essential versus non-essential? And then the appeal process and how did that all work? Can you just give us some input as to how that whole thing was done?
Absolutely. I want to first say that Kurt from WMC and I spent a fair amount of time on the phone before the Safer at Home order was put in place. I hate the non-essential, essential designation. No one wants to be non-essential unless it's a snow day and you get to stay home for one day. But this was a wave that we saw, a developing program that we saw coming across the country. First, New York, California, Ohio put in safer in place orders, and the governor's office worked hard to look at all of those different orders and determine what was the best way to approach this for Wisconsin. And I will say that the Ohio order formed a basis for a majority of what we did here in Wisconsin. It's reflective of the Wisconsin industry, the Wisconsin economy. The Ohio order and subsequently the Wisconsin order focused on using the federal listing, the CISA listing, and I should know what that stands for, but it is a listing of essential workers. And so we took that list and said, if you're an essential worker, then you're employing essential workers, then you become a part of the essential order and the essential businesses that are part of that order. The order passed by the governor expanded on that list and included to make sure we had food and pharmaceutical, pharmacies, those essential places where people need to stop and get their supplies. So that was part of that. So once we determined that we were going to use the essential, non-essential designation, I distinctly remember saying, okay, who's going to make that decision? And that's why I say I volunteered WEDC to do that, because if you look at our relationship with the business community around the state, I felt that we were the ones who could understand best the nuances of different businesses. And when they came to us, really what we did is we tried to help them navigate the order. To be honest with you, in that moment, a lot of people forgot how to read. And so we sat with them and we helped them navigate their way through that order. It's a lengthy order. It's a long list. And many, many businesses are able to find themselves in that order. That's why we're able to say that a fair amount of the economy continues today and has continued since that time in March. For those businesses that had one foot in both, essential versus non-essential. So to give you an example, a landscaping company with a small retail shop on their property, what should they do? How should they approach that? So we helped them work through that. We were able to combine, we bucketed a lot of the responses so that we were able to respond in a very short time. So for the, all the dog groomers, which happens to be the example of this period, we were able to say, this is how this is treated in the order. So we tried to be consistent. We tried to respond as quickly as I could, and to remind you that this was not something that we are used to doing at WEDC. We're not used to helping people to navigate whether or not they are essential or non-essential. We're used to helping them do economic development and helping make their projects bigger and stronger and better. So this was something that we literally stood up in a matter of 24 hours, and I don't often say I'm proud, but I'm proud of my team and I'm proud of the work that they did to address businesses' questions and to try to get them answers consistently and as empathetically as possible.
Follow-up?
Absolutely.
Thank you. So would you say then that the essential businesses have been operating safely?
I think I'll go back to saying businesses don't want anybody getting sick on their watch. I think that there has been confusion among our customers and our consumers that essential means safe, and that they are not required, the grocery shopper, if you're in a grocery store, you're safe because it's essential. That's not the case. And that's where I think we need to go back and we need to continue to educate each other and hold each other accountable for the social distancing, the hand washing, and all of that. I think that, I have had a number of conversations reflective of what the CEO of Metcalf reflected, which is wanting to keep their workers safe, wanting to have the social distancing in place, and wanting to do that. And I think it's incumbent on all of us as citizens of Wisconsin to respect that their employees who are going to work in those essential businesses. They have, moms and dads who are at nursing homes, and they have folks in their families who are facing cancer treatment and are compromised. They might be compromised themselves. It's incumbent on all of us to learn the best behaviors as we continue to face this challenge.
I mean, I was impressed with listening to the three individuals and what they did to keep their customers and their employees safe. And I guess I just look at it and say, if we can do that with essential businesses, why can't we just mirror that with non-essential businesses? I mean, that's just kind of, if we're able to do it with essential, I just don't know why we can't open up the non-essential and use the same protocols that we heard earlier that both the customers and the employees feel safe on.
Yeah, I think that we are seeing that with the governor's dialing of the safer at home order and allowing these innovative opportunities that businesses have come up with whether it's curbside drop-off or takeout. I mean, it's from my position, it's been incredible to see the innovation that we have seen at small businesses and even large businesses all around the state to really move through the challenges and to be able to continue to gain revenue as best they can. Of course, there's always room for more, but that's why I as we're seeing those at the administration's level, that's reflective of the changes that you're seeing in the Safer at Home order, because we are seeing that there are opportunities to continue to be safe, but to reopen the economy.
Thank you for coming today.
Thank you.
Representative Vorpagel.
Thank you, Mr. Chairman. Kind of two questions. One of them was actually half of one was sort of got at by Representative Kuglitch. I'll maybe just start off by saying at the beginning you had talked about using data-driven approaches and data-driven metrics, things like that, to make sure we open up in a safe manner. And I was sort of going to ask something that Representative Kuglitch had asked. For example, I have a bait and tackle shop that's 3 miles from a fleet farm, and while I get that the fleet farm, it's not necessarily safe, they are performing the same function that the bait and tackle shop owner is, and he would probably argue that he could do a better job of making sure there's 2 people in the store, safe social distancing, things like that. And I think we have seen some positive steps from the administration, for example, dog groomers. Which I'm really glad for, because Teddy was really in need of a haircut and got in just under the wire. So,
well, I'm just going to say I shaved my kid's head with my dog clippers the other day. So
Well, let's hold that from the record.
There seems to be a common thread here, because wasn't it
exactly.
Mike from Wapaka that said the same thing? His son cut his hair.
Yeah, I laughed when he said that. I was like, he did a better job than I did on my son's hair.
So I guess my question, first question is, how was it decided that something like dog groomers could do curbside pickup and things like that, when there are a lot of other businesses that that can do those things, call in orders and leave them out, that are now being called non-essential?
Yeah. So I think for my response to that, as I've viewed it, and that's why I go back to the speed of how this has come across the state. Remembering, this is 35, 40 days old. Decisions have been made. Focus has been kept on standing up a public health system and a response to this. And so now that we have gotten to the place of a good response, there's been conversations today, have we completely flattened the curve? We continue to see an uptick in cases. That's where the public health focus has been. And so now we can come in and we can have these moments of saying, okay, there's opportunities here to restart the economy, to recognize that we've done good work, and where can we do more good work, and where can we respect the fact that businesses understand the requirements of social distancing and those pieces of the puzzle. So I think you are seeing that opening, and I think it's reflective of the fact that we've had a chance to take a breath and look at those things. And it's that moment I described of passing the baton, where we have this tension and, we have obviously a lot of pressure to reopen the economy, and public health and the governor more than anybody are feeling that pressure and are wanting to respond to it. And the governor is very much concerned about the small businesses all around the state and helping them be able to access those opportunities. So that's where, I think we're starting to see that passing of the baton. And, you can think about that moment when you're looking at it and you're like, let's go. And so, but don't drop it. And that's right where we are.
So, it sounds like you would agree that the health metrics are sort of driving the data for, kind of slow turning the dial on reopening. That seems to be the primary driver. And then, it's kind of unfortunate that it's all being put into the same basket, and it seems to be looked at as the whole state rather than areas where there, aren't as many cases or we have hospital beds available and healthcare resources, and just kind of looking at it in totality. And then the last.
So can I
go ahead.
just mention that there's a lot of conversation about the regionality and the approach to that. So I live in Vernon County. Until a week ago, we had no cases in Vernon County. We now have one case. I live 2 blocks from the hospital, and I'm very good friends with a number of the docs there. One of the docs gave my husband 2 new knees. And we have had conversations throughout this process about the availability of PPE for those hospitals. The fact is, there's not a ventilator in Vernon County. So again, as we're seeing this moment of passing the baton, are there things that we can be doing and turning the dial on a statewide basis and watching those metrics and watching those things? I think so. And the governor is looking for those opportunities, and where can we find those opportunities? But again, we need to be thinking about the fact that those communities, my community, has not been incredibly exposed to COVID-19. And, we have to be cautious. Before this all started, a lot of the conversation I had around the state was about our workforce and about our aging population. And the reality is, out in those communities, we have an aging population, we have vulnerable populations, and we need to be thoughtful about that. So that's just to say that, I live in one of those crazy counties that only has 1 case, and I can, I can see that conversation, and that's why, there's this moment of tension.
Yeah, and I'm not even talking about the ones that have 0 cases, and because obviously some of them have different abilities of healthcare resources, like you said, the ventilators. But I know in Sheboygan County we have 2 hospitals in the city of Sheboygan, and we have 5 as of the department, the county public health department. We have like 5 active cases. The rest, like hundreds, have recovered since then. So. Leading, I guess, into my last question is using the example of a dog groomer or something that has been, before the order was lifted, I must have got 25, 30 contacts from constituents wanting help and asking dog groomers themselves, their customers, and I'm sure this is happening all throughout different sectors of the economy. And I don't particularly think of myself as being a grumpy bastard, and I don't want to be a grumpy bastard who just says to them, well, the legislature doesn't have any say in this, go talk to the governor. I want to be able to help them. They're my constituents. They're your constituents as WEDC. They're the governor's constituents. What can we in the legislature, I would be open to any suggestions, what we can do to help them navigate a process, if there's some formal appeal process where on an individual basis they're coming up with creative and innovative ideas. I just want to be as helpful as possible and not just pass the buck on to someone else. And any suggestions from you, I'd be open to hearing and want to work with you on.
Oh, so we've taken hundreds of calls from legislative offices seeking assistance for their constituents, and I believe that we've handled most of those and been able to have those conversations. If there's particular moments of advocacy or innovation to bring to the forefront, I think that's welcome, and we should be doing that and communicating about that. And I've seen that come across my email hundreds of times in the last few weeks, and I know that my general counsel has handled many of those conversations, and so I think demonstrating that and learning from each other is incredibly important in this moment.
Okay, thank you.
Mm-hmm.
Representative Schra.
Thank you, Chairman Swearengin. Missy, thank you for coming and testifying today. 2 quick questions for you. So, what is it? I'm interested in your opinion, or maybe. If you've probably, I'm guessing you've made some estimates with your team at WEDC as to what the dollar amount this pandemic, in 2 parts of that question, has cost the state of Wisconsin so far, and depending on forward thinking, like how much. With the shelter in place going maybe another month. Because my concern is, Troy from Dane Manufacturing said sales were down 15% in March, 30% in April, and Michael from Wapaka Foundry, based on $50 to $60 million a year, and they only book $2 million in sales, that extrapolates out to about a 50% loss in revenue. So I'm wondering if WEDC, if you worked with on the numbers as to what you think the total economic impact could be.
So we've approached that in a number of different ways, all of which have not landed on an exact number or even a dollar figure. But let me tell you, so I mentioned in my testimony the consumer data that we're looking at. So by looking at that data, we're able to see the drop from, say, March 1st until now. And the reason that's important is because, honestly, sales tax data or other data is lagging in such a length of time that it's, sorry to Secretary Barca, essentially useless to understand, the impact of.
Could you repeat that again?
I only say that because you all know him. But it's essentially, because it's so lagging, you're looking at February's data or even March's data, and we know that it's getting worse. So that's why the value of this consumer data is really helpful. And the consumer data is terrible. We're down 25 to 30% as far as, and that's where you see that retail moment, right, where a consumer is using a debit card on a transaction. So we've got that data. I've got a survey that the UW Oshkosh just did of small businesses that are reflecting what we heard in the testimony, that the longer this goes on, the harder it is, and the harder it is for businesses to be able to sustain themselves, which is why we need to keep looking for federal resources with the next layer of PPP coming in and the SBA work. We have to be accessing that, and we got to be fighting for it.
Dollar amount wise, though, I'm looking. Have you guys made estimates, dollar amount, on how this is going to affect our economy just in the state of Wisconsin?
I mean, only on percentage down. So I want to add one other percentage down that we're seeing. So I'm talking with manufacturers. I had a conversation with a manufacturer from Waukesha who is doing okay right now. Was his name Dale? Is Dale from, or was it Mike from Wapaka? Right. As he was reflecting, things are okay right now, but seeing out into the fall. So we can have a number for right now. And that number would be 25% down from last year's GDP. I don't know the dollar number. But I think, as leaders and as thinkers, we also need to be thinking about these impacts into the fall. So that fellow from Waukesha is telling me we're doing okay, but our orders for September and October have dropped off because they work in the healthcare industry. And, hospitals are going to stop doing their projects and things like that. So there's no doubt at all that there's an ongoing impact here, and that the sooner we can get the momentum going based on phasing in our economy and having the assurance of our consumers going back into shops and getting people moving again. Right now we have folks staying at home. That all is critical, but it won't happen without the consumer assurance of safety, the employee assurance of safety, which is why we need to keep doing the work on the public health side, passing that baton.
Do you have a percentage of the number of Wisconsin businesses that are closed because they're considered non-essential right now? Is it 50%? Or?
I will tell you that when I look at the consumer data, we're seeing about 25% down from there. And then the way that it's surprisingly hard to understand when a business is closed because they just shut their doors and walk out, right? So there's a couple places where we're looking to see, we can identify who hasn't had a transaction in the last period of time, or who has had a very minimal number of transactions, like literally credit card transactions, and assessing that. So we see that happening. We also see a decrease in transactions, but for about 75% of the businesses that we can track using this data, we're seeing activity.
Okay, and my last comment. So you had mentioned the 300 deaths in the state of Wisconsin, and they are horrible. they're tragic, they're heartbreaking, and I'm not minimizing those deaths at all, but I think we need to put everything into perspective. And if you would extrapolate out, let's say we triple the amount of deaths, so we have 1,000 deaths in the state of Wisconsin, and you divide that out by 5.8 million people, you come out with 0.00005. If there are 1,000, and that's with 300 deaths. If there's 1,000 deaths, and you divide it by 5.8 million, comes out to 0.0001. And so I tried to find, just to put it in perspective, I tried to find something that people die from with the same percentages, and the only thing I could find is dying in plane crashes. 1 in 9,821 people die in plane crashes. That comes out to 0.0001. So what I'm trying to put into perspective is when a plane crashes, it's horrible, it's tragic, but we don't shut the whole economy down. And I think I appreciate you coming, but I think you also have to look at, the overall economy. We had business people here today that are probably, going to never open again, or their sales are down 50%. The longer this goes on, there's so many things that I'm not going to take the time, from my other members, but, calls into the National Suicide Hotline, up 800%. So many other things that the shutdown, is causing, that it's going to be long-term effects. And that's my comment to you. Please keep it in perspective.
The way I would respond to that, sir, is I've been, as I mentioned in January, I saw the potential impact on the Wisconsin economy with the business that we were talking about that was closing its operations in China. Throughout this, I have had my eye on the economy and watching the impact on it and watching the impact on the small businesses. WEDC has done what we can within our budgetary, what we have to try to deploy resources to help with that. I have spoken with small businesses. I have spoken with large businesses that have seen the global impact of this. There is absolutely an impact on the economy that we all have to keep in mind. I would like to have the assistance of all the good minds we have in Wisconsin, including all of you, to be starting to solve the problems that we are going to continue to have coming at us. And I understand that there's this moment in time right now where we want to have a healthy discussion about what the date is, but this is going to come and go. It is a moment in time, and in September we're going to be looking back and going, okay, what happened in May? Because we're going to have things that we all need to be working on together to go forward to think about how to reinvigorate the healthcare industry that's taken a huge hit, what to do about manufacturing that's seen a slowdown. I came into this job to help farmers. We have work to do. And so I absolutely agree we need to keep this all in perspective. And my perspective is a long-term perspective, and my role is to help businesses plan right now to be ready when their doors open, and to help them keep running down that track, and to help all of us keep running down that track.
Okay, I'm going to try to do a hard stop here shortly for Secretary-Designee Hughes, because I appreciate her time and her waiting around. So I'm going to go to Representative Knodel, and then hopefully we can get Representative Sinicki in. And then I'm probably going to call it, I'm probably going to excuse you to go about the rest of your day. But with that, Representative Knodel.
Thank you, Secretary Hughes.
Microphone.
I want to say it into the mic. I sincerely appreciate your efforts to be here today. We heard a little bit about the essential, non-essential status of companies, and I am a bit uncomfortable with your position there, and throughout your testimony, I didn't sense there was a acceptance and a realization that, in fact, every job and everybody who goes to work performs essential duties. And anybody in my district that has to provide for their family, there is no question that their occupation is essential. So I think we first have to accept that premise. Every occupation, every job is essential. And then how do we frame the parameters of making their workspaces safe and et cetera? So I just want to read this. To advance and maximize opportunities in Wisconsin for businesses, communities, and people to thrive in a globally competitive environment. Your mission statement. WEDC's mission statement. There's nothing in there about essential business, non-essential businesses. It's to advance and maximize opportunities. So whatever we have to deal with, whatever environment we're handed to us. You mentioned globally competitive environment. We have a global crisis here that has been introduced, but still you have to go back to the mission statement. That's, I believe, what you're operating under. But yet you indicated throughout your testimony that you're either waiting for a baton or the baton's about to be passed. I can't understand that. Why would we be waiting for a baton to be passed to perform your mission? And so we have to accept where we're at. Can you tell me, do you accept that every occupation, every individual in the state of Wisconsin is essential?
I believe I said earlier that the essential, non-essential designation, I do not like it. I did not like it as I saw it coming across the United States. I think it is a ridiculous way, but it is the speed at which the conversations and these things that we have found ourselves in, the situation, as you say, that we have found ourselves in, that is very difficult, and to find a way to mitigate the ultimate risk to the health of United States citizens and Wisconsin citizens. This was the tool that was used and was consistent with what was happening in other states. And nobody wants to be non-essential. Nobody opens their business and spends their life savings and their family's life savings and gets their friends to invest in their business because they're non-essential. And so I almost take exception with that. And I do absolutely appreciate, everyone in Wisconsin is incredibly hardworking and incredibly desirous of the effort to get back to work. We also have a deep need to take care of our families and our friends and our vulnerable communities, and we step up when the time comes to be able to do that.
And I appreciate that, and that's what I simply want to have, that recognition of our citizens, that we recognize all of you are essential. We're not Ohio, we're not somewhere else. Let's be leaders here in Wisconsin, and how do we make this a place for everybody who's essential to be able to support their families? And I just think we're starting off with the right way to develop that conversation. So I'm hoping that we can do that here in the state of Wisconsin. In the meantime, we're suffering through this: what's essential, what's not, and it appears there's some steps where some places all of a sudden become essential, or they're allowed to operate. And then, so just a little bit more on that criteria. Are we taking into, and I'll step back, we've heard the ingenuity involved from the private sector, going beyond what's mandated in providing protections for their workers. So we have to have trust and some faith in the private sector that they will do what's correct to be able to operate. But are we taking in the consideration in your essential, non-essential criteria, capacity issues in a business? Are we taking in the amount of human interaction at a business? We've mentioned the golf courses. There's not a lot of human interaction there. In fact, it can be virtually zero if they're paying ahead of time and just showing up and going. But are those things taking into consideration, those and others, since you're determining what's essential and what's not? While we're trying to make everybody essential, or recognizing everybody in every business is essential.
I would say that, we have a path forward that is the Badger Bounce Back Plan. And as we move towards that path, we're taking steps along the way. And I understand you kind of referred to, well, there's things happening. Each of those steps that have been taken have been steps forward in this path towards opening and helping, and it's been taking into consideration those opportunities where we can socially distance, where we can act safely. We have we have a blunt instrument of essential versus non-essential. And as we gain the ability and the time and the chance to look at these and refine that tool, that's what we're seeing happening. And I think those steps are positive steps, and we're going to continue on that path as long as we can do it together and we can work together and have good conversations and healthy conversations and keep moving forward.
Thank you.
Thank you.
Representative Snicky, you got a quick one?
Yeah, I'll try to be quick. Thank you, Secretary, for your very thoughtful remarks here today. I truly appreciate it. I got a question again about essential, non-essential, and I want to thank Representative Knodel for making the point that we all are essential, including those of us, not me, but those people over 70. It still really bothers me. Anyhow, so Madam Secretary, thank you so much. But here's one of my first questions. I think I have two, if you don't mind, and I think they can be answered quickly. If not, you can always get back to me.
No problem.
So one of the questions that I keep hearing from my constituents is about parity. For instance, big box stores. I mean, I've been to some of the big box stores. I go to Target for grocery shopping and that kind of stuff. I go to my grocery store. And, you know, Mr. Metcalf, I just want to say, I don't know if he's still listening, but thank you for doing the right thing in your stores. Mm-hmm. Most of the big box stores are trying to do the right thing. I am living with a serious heart condition, so my mask goes with me in everywhere I go. But the question of parity. So, for instance, you have a place like Walmart that is considered essential because they sell food, correct? But then you got a place like maybe a small convenience store that sells maybe some snacks, some basic cleaners, household items, but they're not allowed to open, even though at most times they have maybe 2 people in their store at one time. How is that determined? Just so I can tell, if you want to get back to me on that, that would be appreciated. I just don't know what to tell people anymore.
So I would say in that example, that small convenience store is still essential because they're selling food and beverages, and that's included under the essential versus non-essential list. Just in broad strokes, I would say that's my response to that. It's not to say that there aren't challenges. If we go to the Walmart example, Walmart is open and gets to sell puzzles.
Right.
But a toy store, a lovely little toy store on Main Street, is not open. I think that's, it's one of the unfairnesses of this situation. And I think, as we can work towards recognizing the opportunities that a small retail store can have 1 or 2 in there, and 1 or 2 employees in there and 1 or 2 customers in there, we can get there. I think one of the big challenges is, asking that toy store to open and employ their employees and not having customers come in. I read something very distressing in the last 24 hours that in Georgia, where things are open, businesses who are choosing to open are being boycotted because they're being accused of not caring about the community health and not caring about those vulnerable communities. So this is why having alignment around what we as leaders are talking about, and alignment around that we have, we are in agreement about moving forward. We are in agreement about a plan. We can find that assurance and confidence for consumers. So when that little cafe opens or that little shop opens, the customers will be there, and they won't be accused of not caring about the community health. That we'll be locked arms, and we'll be all in this together.
Okay. And then just one other quick question. Thank you. One other quick question. I don't want anybody to misunderstand my first question. I strongly support what's going on right now. I have a concern with reopening too quickly. But my other question was, when we do start reopening, what kind of support is there going to be from either state or local governments to help those small business owners? Because they're scared. I mean, frankly, they are worried about how they can reopen. Are we going to be there to support them in some way when the time does come?
Yeah, thank you for that. One of the roles of WEDC is to try to incentivize businesses. The representative was kind enough to read our mission statement. Our goal is to help businesses be open, be stronger, do more than they could otherwise do on their own. And so as this health crisis has developed, and we saw the large amount of federal stimulus come in, in my mind, that federal stimulus, if you were closed half of March and April and you are able to access a PPP loan, you're going to use that for your current expenses. You're going to pay your rent that you haven't been able to pay in the last few weeks. You're going to use it for your payroll. You're behind on your payment. You had to throw away some inventory. You're going to use that for a current moment right now. And so what is it that we need to be able to provide? I like to use just an example of a coffee shop. If you're a coffee shop and you need to reopen, you need to go out and buy milk. You need to bring your employees on. You're going to need to float your employees for a couple days. You're going to need to do a little marketing to let people know that you're open. So there's some grease of the wheels that we need. And, in anticipation of that, we've been talking about a program called Restart 72, which would provide a grant to small businesses around the state to be able to just have that moment of, okay, I've used up all of my PPP. I just need a little bit extra to be able to open my doors. And I think through the CARES Act, through conversations with the legislature, I hope that we can find the resources to be able to help businesses with just that little bit of push to help them get rolling again. A lot of these businesses are having to cut back on their capacity, with having one or two people in the shop, or you have to remove 50% of your tables from your restaurant in order to have enough spacing. You have to put up PPE. There are costs associated with going forward here. And that's the new normal that we're going to face. And where we can find resources to be able to help businesses with that challenge, I think we should be digging deep. We should be looking under the mattress and finding those places.
Mr. Chair, really quick follow-up, if you don't mind. And so, you're talking about restaurants and hotels. I'm really concerned about the small businesses such as, you got maybe small gift shops, small dance studios, that kind of stuff that really don't know where to access this help.
Mm-hmm.
So, that's what I would really like somebody to take a look at.
Yeah, so we are doing better and working to have more accessible resources at the WEDC website, which is wedc.org. I'll take the little moment to be able to say that. As I mentioned, in this moment, folks have forgot. There's so much information coming, and it's hard to absorb. And so we really want to try to make it A, in the language that you speak, and B, maybe a video, maybe something that's just more accessible so you can understand what those resources are, and then you can dig into that. But it is really, that's one of the biggest challenges that I've heard from small businesses. I'm sure you have, wading through the red tape and making, really challenging decisions about how is this going to impact my cash flow? What are the strings attached to a particular loan, or, working through those things? What's this going to look like in December, January, when I have to start paying these things back? There's a lot of challenges there. And I want to say, that I mentioned the community banks and the credit unions. They've done incredible work to help small businesses. The chambers and these small economic development groups all around the state have provided an incredible support network for businesses going through this. It's one of the biggest strengths that we had coming into this crisis, is to have that fabric of support for our small businesses around the state.
Thank you.
Thank you.
Okay. So now you got me started.
Yeah.
So you have to answer two quick ones for me.
Yeah.
And it goes back similar to the dog grooming thing, but we're not going to go to dog groomers. I read a memo from the Wisconsin Professional Golf Association earlier this week. Mm-hmm. And in there, it states that golf courses are now, and this has to do with alcohol, are now able to serve food and beverage out on the course. Now, golf courses hold a Class B license, just like what I would have at the Supper Club or any other tavern would have.
Yeah.
My question to you is, and maybe this is part of the unfairness, right? My question for you is, and I'll give you an example. In Three Lakes, there's a 9-hole golf course called Big Stone. on the third hole, there's a little bar across the street from the cup. You know what the name of the bar is? Billy's Third Hole.
Okay.
Right. So, my question for you is, and this is verified by WEDC because I saw some additional.
WEDC.
Yes. So if your department is saying that it is okay for a golf course at this point to serve alcohol, mixed drinks on the course, and the little bar at the third hole is watching the golfers drink over there, and they both carry the same Class B license, do you see what the frustration is going to be?
Mm-hmm.
So I would ask that you reevaluate that for all these Class B license holders that have a patio. At least consider giving them the outdoor opportunity. Obviously, we have to stay 6 feet apart and all the precautions that everybody should be taking.
Yep.
Just a comment. I don't know if you got a follow up on that.
Only to bring Secretary Barca back into the ring and say he described the other day on a call I was on, what's happening with the golf courses, and it's like you get the mixture, and then you can put a little brandy bottle in for your old fashioned. I will follow up on that.
The point is they're serving alcohol
Yeah.
at a golf course. God bless them.
Yep.
If they've got your permission to do that, that's great. But it isn't necessarily fair to the tavern across the street. The other question I would have.
The golf courses are almost as loud as the dog groomers.
Yeah. The other question I would have for you, if it was just you and me, and there wasn't a microphone connected to WisconsinEye, and there wasn't TV cameras, we've had a lot of discussion today about the WMC plan and getting Wisconsin back to business. And we also talked about, very briefly about the Badger bounce back. And you're the only connection we have today to the administration.
Yep.
And I'm not saying you can speak for the governor, but as lawmakers, is the governor open to amending the Badger bounce back plan so that everybody can come together and let's have a comprehensive plan that addresses both health and hopefully, small business in the state? I mean, do you think he's open to a much more comprehensive plan?
They said the camera's just packed up, but I'm not going to buy it on that one. The governor is open to healthy conversations that are productive. And, I love the idea that they could happen without WisconsinEye watching, but we are in the public eye. We do have a responsibility to be transparent and accountable to each other. And I think as leaders, rather than as politicians, I will not include myself in the politician department. I think as leaders, we need to find ways to talk to each other. We are obviously in a very difficult situation right now with a lawsuit between the legislature and the governor's office. For those of you who have been in business, I spent a long time in business. I was general counsel of Organic Valley for 16 years. The last place you ever want to end up is in court. Nothing good happens there. It's no fun there. You don't want to do it. And so, I would challenge us that finding a way out of that situation and finding a way into productive conversations would be the moment of leadership that we all deserve.
Missy Hughes and Wisconsin Economic Development, thank you very much for your testimony today. We appreciate you taking the time. I apologize we ran way overboard, but I think that your comments were valuable, and we look forward to working together with you and your department in the future.
Thank you, and I apologize. I had actually hoped to be able to stay and listen to the rest of your folks that are coming in this afternoon, but I do have to go chase some things down right now, so I'm going to do that. I really appreciate your having us here today.
Thank you very much for taking the time.
Thank you.
Next up, we are going to move to the Wisconsin Restaurant Association, and coming in on Skype is Joanne Paulskill. I think I probably screwed that as Paulskill from Dragon Eddie's Restaurant in Altoona. There she is. How are you?
I'm fine. Can you hear me?
Yeah, you're doing great. Thank you for waiting so long. You're finally up. It's your time, and appreciate you taking time away from the restaurant. I must admit, I was at your restaurant earlier in March and had a wonderful dinner on a Saturday night.
Wonderful. Thank you. I appreciate it.
And you weren't there. I didn't see you. I don't know why you weren't working.
I was probably in the back doing dishes.
So with that, after Joanne, then we're going to move into Bob Prosser from Ishnala, And we also have the CEO of the Wisconsin Restaurant Association, Christine Hilmer, here in person. So I don't know if you want to tag team it, Christine, or we'll just let Joanne take the lead.
Yep, Joanne.
Go ahead, Joanne, you have the floor.
Okay, good afternoon. I'm Joanne Pelsko, owner of Dragonetti's Restaurant and ZA 51 Pizzeria in Eau Claire, as well as the Enchanted Inn, which is a campground and seasonal restaurant north of Hayward. I'm also the current chair of the Wisconsin Restaurant Association Board of Directors. Thank you, Chairman Swearingen and members of the Assembly State Affairs Committee for inviting me to speak today on the Back to Business Plan. Together, my siblings and I own and operate the 2 restaurants in the Eau Claire area, as well as the seasonal restaurant and campground I mentioned. I was born and raised in that area. My family began business there in 1951. As for our Eau Claire businesses, we employed an average of 25 employees at each location when we were open under normal operating circumstances. Our mothership restaurant, Dragonetti's, has been there for over 39 years. And our newer restaurant, ZA 51, is just going into its 3rd year. We're family owned and operated, and many of our employees have been with us for many years. It was gut-wrenching for us when we were forced to furlough nearly all of them because of the current operating circumstances that we are dealing with only require us to staff 2 to 4 people per shift currently. We've gone from serving about 150 to 200 guests on any given day to just a trickle during the limited days and hours that we can be open for takeout. This is the current situation we have here in the Chippewa Valley, but I really want to particularly draw your attention to the seasonal location up north where I grew up. I know that area and all of its residents, hard-working residents, well, and as I mentioned before, this is an area north of Hayward that relies primarily on tourism to support its residents. I have very grave concern for our neighbors who own and operate restaurants and bars there all year long. They nearly starve all winter as they deal with the cost of keeping their doors open because tourism is limited in the winter season. And these are people who live and work there full time. They travel 25, 30 miles plus to get groceries and other provisions when they need them, sometimes daily. And it's a beautiful place, but it's remote. And of course, that's the attraction from a tourism perspective. These people rely heavily on 3 primary summer holiday weekends: Memorial Weekend, 4th of July, and Labor Day. And for them to have to lose one of these 3 key weekends this year will be absolutely devastating. I know many of them won't be able to survive if they aren't able to open before Memorial Day. At our Eau Claire restaurants, I have people who want to work. Many of them are suffering from anxiety even because they're trying to function with limited income. They're on unemployment, they can't get by. They're attempting to homeschool their children, and they're not teachers. They don't necessarily have the skill set, the patience, or the physical space to do it. They're stressed out. I've had occasions where I've checked in with them and they're in tears trying to explain to me their situation. Our industry is one that provides jobs for many people who have difficulty getting jobs in other sectors. So these people are really being hit hard. Our restaurant sales in the Chippewa Valley are down by nearly 80%. We are struggling to keep our team in place and to pay the bills. Restaurants run on razor-thin margins. Even during the best of times, most successful restaurants end up with a 3 to 5% profit margin after paying all the obligations. Our customers are very happy we're open, dealing with what they can right now, and they're supporting us the best they can. But being partially open doesn't mean that we're still maintaining a profit margin. There's some cash flow, but it's just enough to pay a few bills. It's certainly not profitable by any means. Thankfully, I come from a part of the state that has not had a high percentage of positive COVID-19 cases or deaths. We are blessed with fantastic hospitals, healthcare professionals who've been able to take care of our communities. However, I'm hearing great frustration and even fear from colleagues and customers alike as we watch all of our businesses just wither from the vine. Many restaurant owners are telling me they need to lay off more people, or even worse, if they're not open, will they ever be able to even continue going? What's going to happen to those employees? The federal loan programs are not working for restaurants. The Paycheck Protection Program only works if you've not already furloughed staff. The program is meant for businesses that can operate at full capacity, not folks like me who are partially shut down. If we can't be open for business in some manner by Memorial Day, I worry about what will happen. I may be forced with a difficult decision of whether my business will survive or be one of the restaurants that will close for good because we can no longer withstand the losses. My restaurant won't generate state sales tax along with the local taxes that contribute to my local area, as well as the state's economy. We will still have our fixed expenses, such as property taxes, insurance, licensing fees for the health department, and municipal liquor license without the normal sales income to pay for them. And finally, this hurts my family too. It's our livelihood. We all have bills, college tuition, and mortgages to pay. Please know that we want to protect our customers and employees. As a restaurant professional, I train my employees on food safety and sanitation as a rule all the time. We know how to take safety precautions and do what's necessary to keep our customers and ourselves protected. To conclude, I would like to emphasize that we want to open safely. The last thing we want is to put any family, staff, or customers in danger. My ask is that we agree on a viable solution to safely open, and the Back to Business plan puts the framework in place for us to do that. Thank you for your time today.
Thank you, Joanne. Thanks for the testimony, and I can tell you that Representative Knodel and Summerfield and I all feel your pain being in the same business. So, with that, we will. And Joanne, please stay on the line because we're going to take you as a block here and might have some questions for you. Just stay on the line.
Okay.
Next, we're going to Skype in Bob Prosser from Ishnala Supper Club in Wisconsin Dells. Bob, are you with us?
I am. Can you hear me?
We can hear you. There you are.
Oh, there we go. There I am.
Welcome.
Thank you. Good afternoon. I'm Bob Prosser from Ishnala Supper Club in Wisconsin Dells. The #1 supper club in Wisconsin, by the way.
Yeah, we are all about it. Quit showing off.
Yeah. Thank you, Chairman Swearingen and members of the Assembly State Affairs Committee to speak today on the Back to the Business plan. I started out as a busboy for the Hoffman brothers, and a lot of you remember the Hoffman houses throughout the Midwest. I grew up in Wausau, Wisconsin. I was 16 years old, and on the day I turned 16, I started as a busboy. I've been in the business for 46 years. I currently own restaurants in Illinois and Wisconsin, the two states that are open, they're not open, unfortunately. And one of them is the Hoffman House in Rockford, Illinois, and a wedding facility in Rockton. Ishnala has been around since 1953, 67 years. We're open May through October. I generally have around 75 employees that start in April to get the property ready for May. And my payroll in 6 months is $1 million at that property. Today, I have 13 people employed at about $15,000 a week currently what we're paying. So we're way down in that. In May, my payroll would have been $110,000. This year, I'm going to be paying $40,000. I have kept on as many people as I could, and I continue to do that, but I couldn't keep everybody on. And as Joanne indicated, the PPP money works for manufacturers, but most of us now are going to be closed for 6 weeks before we even get to open, and that's going to be open at maybe 50%. So you're supposed to use the same amount of money in payroll as the first quarter of this year. Well, that's impossible. We can't do that because I can't bring everybody back. The social distancing, I can't bring everybody back because of the, bringing people back. We just can't do it. Just can't pay for people to stay at home. I would have spent $350,000 in goods and services in May. This year I spent $20. Sales tax loss to the state in May was $30,000. I estimate my 35% loss in sales this season. I'm hoping it's only 35%. And that will be an $85,000 reduction in sales tax. Just for one little guy, Ishnala, $85,000 in sales tax lost revenue. 50% of my profits will be down, 35% sales down. Usually I go through June as a seasonal restaurant. You have all the upfront costs. You have to open a restaurant every year. I get through June and I break even. Now it's going to be hopefully July, which is the monster month in the Dells. I'm hoping to get to the break-even point by July, and it's going to be a challenge. We talk about curbside delivery, and obviously that doesn't work for supper clubs that are set up differently. People aren't going to drive a mile into the woods where my restaurant is to get curbside. As I indicated, I have restaurants in Rockford. We are doing curbside in Rockford at the Hoffman House. But to give you an idea, curbside is a non-issue. I normally do $150,000 a week in Rockford in sales. I do $15,000 now, but my payroll that I'm carrying is $30,000. And that's all on my dime because the PVP won't pay for that unless they relax the rules by the time my 8 weeks is up. So we realize that when we open, it won't be 100%. We're making provisions. We've got the Wisconsin Restaurant Promise to sanitize stations, cleaning and sanitize things after each use, designated employees to direct people. We're in a unique situation. Additionally, I have 3 bars, so I can separate the people as they come in and outside decks. And I'm real interested, Chairman Swearingen, about the golf cart liquor, because I heard that too, and I thought, hey, why can't I have one of my bars open and we are surrounded by a state park, which is now open. Why can't I not sell to the people out of one of the bars and they walk around our grounds? What's the difference between being right inside of a state park that's open or a golf course? So I'm really interested in that. We're in a unique situation or position as restaurants because we are all about sanitation, food safety classes, food safety managers. We're talking about this stuff all the time and dealing with this stuff all the time. So it's not easy, but it's an easier path for us to get there to make people feel comfortable, both our employees and our customers. And that's exactly what we're going to do. Joanne said we want to protect our employees and our customers because it wouldn't do us any good if we didn't. So my family also, as Joanne indicated, you try and throw everything into one basket in the Dells in 6 months, and if half of it's going to be affected before we can even get full go, that's going to hurt a lot of people. It's going to hurt a lot of my employees that I'm very concerned about. And, I don't want anybody to get sick. None of us do. And we, obviously, there's a sick leave function of all this. Because we're a smaller company and we're in pretty good shape, depending on what you are in your situation with your business. Right now, before now, we would have been able to pay for people to be home if they were sick. And we will do that if it doesn't become too big a deal, because we want to help our employees. I don't want my employees to miss out. And I'm paying a lot of I'm paying between the whole company right now, 40 people. They're pretty good salaries. I'm spending about $50,000 a week with my entire company on payroll, with the concern that I may not get it paid back because I don't want my employees to suffer. So I represent the restaurant industry that are family oriented. We take care of our people, and I'm sure across the state that is the mindset that we will do whatever we can to be safe. But we need to get back to work. We need to get open. Thank you so much for your time. I appreciate the opportunity.
Bob, thanks for your passion, and it's good to see you. Hopefully next time we see each other in person. But
Well, I hope so, because I want to go out fishing up my neck of the woods and go to your restaurant.
Fair enough. Stay on the line. I'm going to have Christine take the helm here, and then maybe we'll have some questions for you and Joanne. So, Christine, President and CEO of Wisconsin Restaurant Association, you have the floor.
Thank you, Chair Swearingen and members of the Assembly State Affairs Committee for the opportunity to speak to you today about the Back to Business Plan. From the beginning, the Wisconsin Restaurant Association has been an active part of the discussions to design the Back to Business Plan before you. We strongly feel that a common sense, data-driven, analytical approach to slowly reopen the state makes sense to ensure the safety of our operators, their employees, and the customers that they serve. To understand why this plan is critical, let me begin by setting the table and sharing the status of the restaurant and food service industry pre-crisis, then give you data on the effects that we've seen, and finally share what we are doing to help our operators plan for the inevitable time when they can reopen their doors. So first, let me refer you to a document, and all of you have copies of it. It's called the Wisconsin Restaurant Industry at a Glance. All right? So prior to the crisis, there were 12,796 eating and drinking establishments in our state. We employed over 284,000 restaurant and food service people, representing about 9% of employment in our state. That represented $10.1 billion in estimated sales in Wisconsin. And for every dollar that was spent in the table service segment, it contributed $1.89 to the state's economy, and that's almost a 1-to-2 ratio. Every dollar spent in the limited service segment contributed $1.65 to the state's economy, a more than 1 to 1.5% return. Restaurants have truly been a critical and large piece of the Wisconsin culture, identity, and economy. Next, I'd like to call your attention to the document titled Wisconsin Industry Impact Survey, and that's what this one looks like. These are the results of a survey conducted between April 10th and April 16th this year, and illustrates the devastating impact of the crisis on our industry. 136,000 plus restaurant employees have been laid off or furloughed since the beginning of the outbreak. Remember that this ended on April 16th, so that doesn't count those who have been added to the unemployment rolls since that time. Wisconsin stands to lose $630 million in sales by the end of April. On average, restaurant operators have reported, and this is just average, a 70% decline in sales. I've personally talked to many of our members who have lost 95% of their sales, and if they've closed their doors temporarily, that's 100%. 44% of Wisconsin operators have already temporarily closed, and another 40% anticipate closing temporarily in the next 30 days. And for those of you who think the federal dollars will help, 61% of operators say that existing federal relief programs will not prevent more layoffs. And you've heard Joanne and Bob say that the PPP program is just not workable for restaurants. Anecdotally, I can also tell you that as dire as these statistics are, the longer that restaurants are closed to most business, the more at-risk restaurant businesses are. We are predicting that if the closures continue long-term, half of our restaurants are at risk of closing for good, and all of the jobs associated with those. Many of these businesses are independent, small, family operations that are the heart of Main Street, Wisconsin. The ripple effect will be severe not only to our economy, but to the small towns, countless families, tourism, employees, and the cultural heritage of our state. So as you can see, the comparison pre-crisis to now, it shows the dire circumstances that the restaurant industry currently face. We are at an extinction level event for small businesses and restaurants, and it's urgent that we use this time to figure out how these businesses can reopen safely. As we have indicated by the testimonies of Joanne and Bob, there is a true need to look at the various parts of the state differently. Joanne's restaurants in Altoona and Bob's in the Dells should not be shuttered because of the different situations in other parts of the state. These areas of the states are simply not comparable, and they should be treated differently based on the circumstances they face in their county and their local community. In anticipation of the eventual reopening of restaurants, the Wisconsin Restaurant Association has worked on 2 projects. The first, the Back to Business Plan, and the specific activities that are allowed in each of the risk categories. This document here that I gave you is what we've worked on, so that when we get the different statuses of being able to reopen slowly, these are some of the mitigating risk factors that our restaurant operators are already planning to do. These are attached, or they have been reviewed by food safety, public health experts, in addition to leaders from our restaurant organization. Next, we developed the Wisconsin Restaurant Promise, which is a brand new, and you are getting an advanced copy, and this is what it looks like right here. This is a document that provides guidance on reopening, but more importantly, helps to build the confidence in the safety of eating out when customers are able to do so. This plan uses not only mitigation strategies, but also is in tandem with the reopen guidelines developed by the National Restaurant Association, which is developed with experts from the Food and Drug Administration, Conference for Food Protection, as well as other safety experts. This wasn't done in a vacuum. This plan has also undergone extensive review and is included for your information, so you are aware that once restaurants can reopen safely and slowly, there are plans in place to ensure the safety of restaurant employees and the guests they serve. We strongly encourage you to support the Back to Business Plan so that we can slowly but surely open up our state's economy. The Wisconsin Restaurant Association and our 7,000 member locations are readying their businesses now and with their staff so that this can occur. We strongly feel that this common sense, data-driven, analytical approach to slowly reopen the state makes sense to ensure the safety of our operators, the safety of their staff, and the safety of their customers. Thank you for your time.
Thank you, Christine. Appreciate your perspective from the Restaurant Association. And we will get to some questions here. Representative Jagler.
Thank you very much, Mr. Chair. It's been a long day already, and I think minds might be drifting. Can you just repeat again the prediction on if we stay at this, how many businesses or how many restaurants are going to shutter for good?
And this is anecdotal, so it's not statistically relevant, but in talking with our operators and knowing the statistics of how many are closed who may not be able to reopen, if this goes on long term, we could very easily lose 50% of the restaurants in the state of Wisconsin.
The Badger Bounce Back plan that the governor has announced has metrics that I don't think anybody realistically thinks we might not ever open based on it. And some of the metrics that are available online and their own scorecard, particularly with the Hospital Association, some of the data, it's not even there. They can't even when we start the 14-day thing, they're not even ready to do that. So I don't think anybody thinks that that's realistic. So with that being that there is really no hope right now to reopen under the current scenario, is there? I'm just putting myself in the mind of a restaurant owner here. If we start this plan, whether it's the WMC plan or whatever plan you want to call it, there might be some restaurant owners who have a certainty because they can't just flick a switch. And we were talking about this dial.
Absolutely.
Well, they need product. They need to know if they have to get rid of the food that maybe they're holding on to. Certainty, I think, might keep some of those businesses open, right? If we just had, this is what we need to do to get open.
Mm-hmm.
I guess that's more of a
statement?
A statement than anything. So with that, I'll go back to being quiet, Mr. Chair.
Representative Sinicki.
Mr. Chair. Thank you, Christine. So, just like everybody else, I love a good restaurant. I am dying to go out for a good meal, but I know it's not safe right now. And I guess I'm just going to have to be patient, and it'll just taste all that much better. But Two questions for you. Number one, I want to go back to the unemployment insurance issue. What happens to employees that could be, will eventually be called back to work? And under this plan, it could be sooner, much sooner than what anybody's ready for. What happens if they say, I don't want to go back to work yet, I don't feel safe?
At some point in time, we have to reopen the state. And it's something that I know operators, including Joanne and Bob, as well as all of our other members, are grappling with. Nobody wants to put their staff at risk. Nobody does. And they want to figure out how they can reopen in a way that assures the safety of their staff and the people that come in and dine. And the great thing about restaurants is that restaurants know how to be safe and clean and sanitize and so on. So they already know how to do that. And so that's an important piece. And there are going to be situations where somebody may not be able to feel safe in coming back. And that's something that is a real possibility, and I'm not going to sugarcoat it. I'm not sure what's going to happen with the unemployment for those people. But at some point in time, we do have to recognize that we're going to mitigate the risks as best as we possibly can. We haven't gotten rid of measles or polio. So I'm not certain that we're ever going to get rid of this virus. And so how can we mitigate the risks to make it as safe as possible so people can start supporting their families in their jobs again?
Well, thank you. You gave me a much more honest answer than when I previously asked it. So I do appreciate that. At least it's an honest answer. Then my second question is, I'm looking at your the Wisconsin restaurant promise.
Mm-hmm.
Actually, it looks really good. It looks ambitious. And if you do all these things, just wonderful. But how are you going to enforce it in how many restaurants?
Well, it's a voluntary program.
Right.
It's not mandatory that anybody does the Wisconsin Restaurant Promise. What this document is meant to do is it's meant to give tools to operators to make sure they're doing everything they possibly can to be as safe for their staff and for their customers, and also instill a sense of confidence to those that want to go out and eat and say, okay, our restaurants are doing this. They're doing the social distancing. They're at half capacity, whatever it is. And as you work through the risk mitigation, if we do the back to business, that's going to happen. But it's meant to say the restaurants are promising to their consumers and their employees they're going to be safe and sanitize and do whatever they can. The promise from the consumer back to the restaurant is that they're going to honor social distancing. They're going to not come in and be sick, or if they're at a high risk, that they're going to do takeout. And so that's what this is meant to do. It's meant to be an agreement between the different parties so that we're going to do this as safely as we possibly can. And it's voluntary.
Okay, one more quick follow-up, Mr. Chair, if I could. Because I do find it kind of intriguing. I mean, I honestly do. So if restaurants decide to adopt the Wisconsin Restaurant Promise, will that be advertised somehow? And how can consumers feel confident that they're actually doing it?
So the first page of the document is meant to be a flyer that you can actually post on your door.
Okay.
We have it on a PDF on our website that you can put it on your website. You can hand it out as a flyer. I've already had a number of folks contact me. How can we blast this out so that we can help people feel confident to come back and eat?
Okay. Thank you.
Thank you.
Representative Onstead.
Well, thank you, Mr. Chair. And first of all, I'd just like to start by saying hi to Joanne. I'm actually from Altoona, and my late mother's favorite restaurant was Dragonetti's, so consequently, it was my favorite restaurant north of Kenosha. So welcome if you're still there. Christine, on a more serious note, you had mentioned earlier that you had said long-term, that 50% may lose their job. What would you describe as long-term?
I would describe long-term past the May 26th.
Thank you. Representative Summerfield.
Yeah. Mine's more of just comments. Thank you, the Restaurant Association. I know Tavern League's coming up. I'll thank them. But this has been truly one of the hardest things for the last 6 weeks, being part of the industry, having good friends, people crying to me.
on, reopening. I do like your metrics. I've really just want to make a statement that I think us in the Northwoods, we do see, how we need to get this back started. It's not going to start on a dime, if you open up on May 10th, because I don't know how many customers are going to come back to Supper Club, going to go back down to Main Street Cafe. But I do like your approach. I really think this marketing thing is a great step. So just want to give my perspective from being up in the northern part of the Wisconsin, everything you do, and thank you for coming today.
Okay, we'll move to Representative Cabrera. Are you still there?
Yes, I am.
Welcome back.
Thank you. So I want to preface my questions and my comments with just making sure that I express the fact that I want to be respectful and I want to be understanding with the concerns that are being brought up, but regarding different businesses and the impact on their bottom line that this pandemic has had on them and the safer at home order. But at the same time, as you're saying that you've been hearing from a lot of businesses and how they're concerned about maybe not being able to reopen at all, a lot of constituents saying that their employers are not informing them when somebody tests positive at
Hang on, Representative Cabrera, we lost your audio. You get her back?
Try again.
Try it again. Nope, not yet. Does she have a mute button? No, we can't hear you. Apparently, there's a malfunction with your microphone on your end. We'll put you back in the queue, Representative Cabrera, and we'll come back to you when we get it rectified, okay? I think LTSB will reach out to you. With that, I will move to Representative McGuire.
Thank you. I have a couple of questions, so I hope you'll bear with me, Mr. Chairman. The first thing I want to say, though, is I want to thank you for being here and the other members of the hospitality industry who are here today. We really appreciate what you do, not only for our economy, but also for our culture. And I think I speak for the whole committee when I say we are concerned about what is happening to your businesses. I think one of the great things about restaurants and bars is that they bring people.
Chip, is your mic on?
I hope so.
Okay.
I'm just not talking directly into it. One of the great things about restaurants and bars is that they bring people together, and unfortunately, during this time, that's actually the struggle. And so we had referenced earlier the concept of a plane crash having a similar death rate, but plane crashes don't have exponential growth as diseases. And so one of my concerns I have when looking at the proposal by WMC is that while we may have drawn regional lines here, that as a person, I eat in restaurants and I drink in bars all around the state, and so not every weekend, but I do go to Representative August's district from time to time. I do go up into Representative Sinicki's district from time to time. I've been to restaurants in Representative Knodl's district and certainly around the state, and so those lines aren't hard drawn, and if we open up one region, there's a tremendous risk that people will travel to those locations so that they can experience some of the things that we've all grown to love about our Wisconsin restaurants and bars. Do you have any concerns about that?
So, excuse me, I don't think I have any more of a concern than somebody coming over from another state and we don't have any control over what their plans are. So whether it's county by county and so on, I think you also have to recognize that individuals are also going to self-regulate, that it's going to be a slow to reopen, not only for businesses, but it's going to be a slow for people to actually want to go in restaurants or want to go in bars or travel beyond their county and do that. It's going to be slow to reopen. My mom's 81 and she has an autoimmune disorder. She's not going anywhere anytime soon. My sisters and I have bubble wrapped her. But when that happens, she's going to go out and start going out when it makes sense for her and so on. People are self-regulating. Can we ever confidently reassure there will be no transmission across county lines? Of course not. But I think that you have to recognize that you can't treat Bob in Wisconsin Dells or Joanne in Altoona the same as you would, say, a restaurant in Milwaukee. And the other point that I need to make is each restaurant operator will also make their own risk assessment internally on what they can do. We've got some plans for them to think about, but they're going to go above and beyond that. And if they have to cut their capacity to 40%, they'll do that. I would welcome to have Joanne and Bob talk a little bit about what they're doing in their restaurants currently, also to make sure that it's safe. We're never going to get to a point where we can't guarantee that either county to county, region to region, or even state to state that there's no transmission. But I think that there are paths forward to try to do it as safely and smartly as we possibly can.
Right. And so I don't think anybody here thinks that we'll ever be able to restrict transmission until eternity, right? But obviously, the key component is getting the numbers down into a range where testing and tracing can satisfy those kinds of cases moving back and forth. This plan doesn't incorporate any testing and tracing. Is that a concern for you?
I think there is an absolute opportunity for the Badger Bounce Back program and the WMC program to work in tandem. I think there's a lot of overlap, and I think there is that opportunity. And we're also watching very closely what's happening in Texas and what's happening in Georgia. They're the two, and Tennessee. Those are the three states that have opened restaurants right now. Iowa has not even, they haven't closed. And they're right on our border. So I think there are things that we're watching and we're looking at, and we're going to have to adapt based on if there's going to be a transmission risk in one area of the state or not. We're going to have to be adaptable and flexible to meet those needs. Absolutely. I think that Joanne, in her testimony, was talking about the devastating impact by her family's campground in that area, that if they're not able to open up over the summer, they may not survive up there, and that's a critical area. Joanne?
Yes.
If you want to talk a little bit about any concerns you have about people coming from other parts of the state up by either your campground or Altoona, if you have any concern about that.
Well, I agree with you. I think people are taking precautions based on what their level of, their individual situation. Everyone is taking precautions now. But the extra due diligence is happening if you already have a pre-existing condition or something else. In our northern area, those counties have issued very strong statements about already asking people with second homes not to travel to them if they happen to have a place in Hayward or surrounding. So there's already that sort of, it's not a legal thing, but it's a very strong statement, and everyone's aware of that. We shared that with our people on our Facebook, for example. So my main concern earlier was just about economically, because these people literally, they live there. They live in the backs of their bars and restaurants. That's their home. And they, we're fortunate. We have restaurants in Chippewa, in the Chippewa Valley, where we can provide jobs because there are people to take the jobs. Up there, there's hardly anybody under fabulous circumstances that is able to work other than in their own businesses. And so they're really going to suffer. I worry about the economy up there. And, I'm digressing a little bit, but my main point is, to answer your question, I think those areas that have to be extra cautious, because it's true, they don't have the hospitals up there. Would there be a serious outbreak? They're taking the actions to get that word out there in their own way. But, that's just happening in and of itself. Every area of the state is doing what it needs to do, I think.
Thank you. And I have two more questions. And I'm very brief, Mr. Chairman, so don't worry, it'll move quickly. I did appreciate the inclusion of the mitigation strategies by level of transmission. To your knowledge, is this available for all the industries? I mean, we didn't really see anything in the packet that we were given. It was simply 4 factors, and then we don't have an understanding of what that would actually mean, or whether. And I noted this in the restaurant one that it encourages masks at the critical level rather than requires them, which is something I'm curious about. Is that something that we're flexible on? I feel as though that's one of the more common ways of transmission at this point. And so when we're in that critical zone, wouldn't that be something that you would absolutely be open to requirement or having obligations on the businesses to ensure that their employees have that?
So the way we wrote the Wisconsin Restaurant Promise, and this is a tandem piece to it, that whether the back to business plan goes or not, or we go in another direction, all that work can be used in a slow to reopen process. But one of the things that we know is the CDC has not mandated masks. And so we are mimicking with what the federal government, what their recommendations are. If they were to come and say, we mandate masks, then we will mandate masks.
Okay.
But if they say it's highly recommended, that's how we're going to be doing it. So we are following the guidances of people that are a lot smarter than I am, who live and eat and breathe what this all means.
Okay. And then my last question is really just more of a one-off. I've been contacted by some constituents about business loss insurance. Is that something that you guys have been looking into at all?
It's a huge issue for our industry. So restaurants have taken out business interruption insurance so that if their bar or restaurant burns down, a car crashes into the wall, whatever they're covered for the loss of that time that they can be open. Most insurance plans don't cover things like a pandemic or a viral outbreak. And so it's not covered. And so you're seeing that there are some lawsuits that are happening that that a lot of restaurant owners have seen that they're not covered and they're not going to get any insurance because of it. On the flip side of it, you also have to remember that insurance is a necessity for any business. And if something like this is covered, it's going to be so prohibitively expensive in the long run, you won't be able to get it if you're a bar or restaurant or even a manufacturer for that matter. The other thing that I also know is that there's an insurer that we work with in our association. They have enough dollars on hand to cover this for 17 days. It will bankrupt the insurance industry, which is going to cause a whole nother set of issues. So what needs to happen, and it's happening federally, is they are in discussions about having a federal backstop to help backfill some of those insurance claims. But right now, a lot of the insurance policies are specifically written that it exempts pandemics, viral outbreaks, and so on.
Okay.
And so that's something that's in the minutia in all the fine print, that if you're not aware of that and you're expecting that to help you, it's a nasty surprise.
Thank you.
Okay, I'm going to go back to Representative Cabrera, and I'm going to ask members to keep their question to one. I'm trying to, obviously we're running way over here, which just is what it is, but if we can keep the members' questions just to one, it'd be great. So is Representative Cabrera back with us, and do we have audio?
Can you hear me now?
Yes, we can.
I can hear you.
You have the floor.
That was so weird because I could hear you guys. So first of all, I want to preface my questions and comments by saying that I do want to be respectful to the folks that are speaking today, and I want them to understand that I am empathetic to the circumstances that they are describing with regards to owners. But I want to also point out the fact that I too have been hearing from a lot of constituents that work at some of these businesses, and on the one hand, you're saying you're taking all the precautions necessary to protect the employees and the consumers, but I have heard of many places that have not been providing PPE to their employees. They are not actually even advising them or notifying them when somebody tests positive at their establishments. They're not allowing folks to, who are concerned about their safety to then take the 14-day isolation period without some type of negative consequence to their employment record. And so on the one hand, you're saying that everybody's going to do what is necessary to keep everything safe for employees and consumers, but then not everybody is doing that. And you're saying you want to take things that, slowly and safely, but then the WMC plan actually says the start date is next Monday. And so there's a sort of disconnect there with what you're saying, and even what you're saying that you want this plan to work in tandem with the Badger Bounce Back plan. But again, the WMC person said that this plan is to replace the Badger Bounce Back plan. So it's not really connecting there for me. So if you can explain to me those inconsistencies and how you plan to address them, that would be helpful.
Mm-hmm. So I think it's safe to say that, May 1st is tomorrow. And even if they were to, and May 4th is Monday, so pick whatever date you have, it's not going to be all of a sudden the doors are open, everybody's open, and so on. So whenever those metrics are and whatever date is set, I think it's safe to say that it's going to be a slow reopen. So for restaurants in particular, I think you're going to see a 50% capacity or less. And some of those businesses who are on the bubble, they're like, I'm just not quite feeling it yet. I'm not really quite sure that it's time for me to open yet. They have that choice to stay closed or to even go 25% capacity. Just because you can doesn't mean you should, first of all. Second of all, I think the two plans could mesh together. We believe that the Back to Business plan is data-driven, it's analytic, it includes a lot of metrics, not only from each business sector, but also the public health officials and capacity and demographics and all of that, so it makes a lot of sense. I think we also have to recognize there has to be some collaboration and compromise on both sides of the aisle, and I think there's a space between the Back to Business plan and the WMC plan to mesh together. I would welcome that because nobody wants anybody to be sick. Nobody wants anybody to lose their business. I think there is a path forward to make that happen, but we need to get everybody working together. That's at least how I view it.
Okay. Representative Kuglitch.
Thank you, Mr. Chair, and Christine, thank you for testifying today. So I'm just curious, how do your members feel being deemed non-essential?
When you look at
Bob, you want to weigh in on that?
I hear Bob. Go ahead, Bob.
Let me weigh in on that.
Go ahead.
So, actually, I'm glad you asked that question because I wrote non-essential on my piece of paper, and I was disappointed that this hearing was scheduled and it was, I blocked the whole afternoon, assuming if you needed to ask questions or I needed to be here. I'm a little disappointed that the Secretary-Designee isn't listening to the restaurant people, but I thought, well, we're not essential. So I guess that answers the question as to given the importance. We are essential because we provide lots of jobs for families. We provide food. I mean, this whole argument of Walmart being safe and restaurants not is a little confusing. But to answer Representative Cabrera's question, if I could open tomorrow at 20%, I would. I don't care what percentage. Let us open and we'll control it. You know, I'm in the Dallas, and we've been very successful over the years, and a lot of notoriety and all that stuff. So when we generally open our doors May 1st, I'm on an hour and a half late. So do I expect whatever day in May we open, I'm going to be an hour and a half late? No. but do I still think I'm going to have to be responsible and control whatever I do have come in? Because people may be, oh, well, let's just go there. Let's just drive in the woods. Let's just walk around. I don't want to screw it up for the future, and none of us do. If we get a chance to open up, we're going to control it and sanitize and do things that we've never done to the 10th degree because we don't want to close again. So I don't know if that answered the question, but I don't like being called non-essential. Nobody does.
Actually, I do want to correct the record. Restaurants are considered essential. They're part of the food supply. Restaurants are able to offer curbside or delivery or takeout. They are considered essential. Right now, they can't do in-dining options, but they are part of the food supply. And the other piece of that is you have to remember a lot of these families are home with their kids, now having to feed them 7 meals a day. And so restaurants help fill that void when they may not have that food at home. So actually, according to the federal government, and when they said essential and non-essential, restaurants are considered essential.
So just one quick follow-up. So if you would do the WRA promise, I assume that mirrors what the WMC plan is. And if a customer or a potential customer doesn't feel safe going in, can't they just stay at home?
They can stay at home, they can order online, they can have the food brought out to their car. There's a lot of options.
Thank you.
Mr. Chair.
Representative Stubbs.
Representative Cabrera had one more question. Could she get back in the queue?
Probably not. We're going to wrap this up.
She's had very little chance to ask it.
She's had just as much chance as everybody else. Representative Stubbs.
Thank you, Mr. Chairman. Thank you, Christy, for your presentation. Always appreciate it. I wanted to speak a little bit about the back to business plan that is developed to open the state up on the 4th. With this particular plan, it gives guidelines, and this will give businesses time to recall furlough employees and contract supplies and other necessary steps to open the doors. If you force employees back to work, will they be able to get unemployment, or how is it going to work within the restaurant industry if employees decide not to return back to work because of their own health and safety?
It works the same in any industry. It's not just restaurants. So if you call them back and you have them job, and it doesn't matter if you're a hairdresser or if you are in the restaurant, you're a manufacturer, it's not just restaurants. Unemployment is unemployment regardless of the industry. So if you call them back, and this is my understanding of it, and I'm not an expert, I'll be the first to admit that, but if you call them back and you have a job and they don't feel safe and, they may lose their unemployment insurance. That may very well happen, but that's not just restaurants, that's every single sector. So
I can jump in on that if I can.
Go ahead, Bob.
Yeah, go ahead, Bob.
And this is Illinois, a great state of Illinois, but
That's a matter of opinion.
I was being a little facetious, but anyway, I had restaurants there, and we tried to bring 2 people back, and they didn't feel comfortable, but they still get unemployment because you can't fight that. If they tell you they're not comfortable coming back to work, they're not going to lose their unemployment. And that's in Illinois, so because there are no rules in Illinois. So I don't know if that applies everywhere, but we're in a position that it's, initially for the startup of the restaurants, it's not going to matter because we're not going to be able to bring everybody back anyway because we're going to be 20, 50%. So if the few of them that are uncomfortable, and I get that, then they can stay at home, and we're not going to fight the unemployment because we want them to be safe, but we want to open, and we'll have enough people because it's not going to be 100%.
Representative Vorpagel.
I'll just pass.
Pass, okay. We're going to wrap up. So if we got something, I want to go back to Bob real quick.
Yes.
Bob, in Ishnala, and I just want to put this in perspective, how long is it going to take you to ramp up Ishnala to 50%? And I mean, and what I'm asking is ordering product, assuming the distributors have the product because everybody's going to be ordering at the same time.
Right.
Staffing, how long are you going to get up and running to 50%? How much of a lead time would you need?
It's 10 days, 7 to 10 days. But I told my manager yesterday, order booze tomorrow to get here next week. Order booze so in the anticipation we can open, because I was concerned everybody in the world's going to order at the same time. So I wanted to get everything in. Now, I'm different because I don't have anything. We drain the water lines. I have nothing. So I'm ordering booze next week. I told my chef to order groceries that are non-perishable. I have to pre-order my beef, which is obviously now a concern because nobody has any. But we're ordering some next week in case it goes earlier, and I'm hoping it goes before Memorial Weekend. So I would say 7 to 10 days.
That's if the distributors have it available.
Right, but I'll still open with what I have because people are going to understand, hey, I don't have that product.
Right.
So
Okay.
I think I'll open with whatever I have.
Okay, thanks. And then can you switch to, is Joanne still there?
Yes, I'm here.
Joanne, quick question for you. Have you had to eliminate hours at Dragon Eddie's? In other words, were you open 6 nights a week and now you're down to 3?
Right. That particular location is dinner only, so starting at 4 p.m., 5 nights a week, typically. And we actually did that, ironically. We used to be 6 nights a week, but about 9 months ago, we ended up closing an additional day because we could not find enough people to work. Simply, that was the unemployment was so low. So our poor kitchen staff was, they're like, we want to work. I'm like, you're gonna kill yourselves. You got to have work-life balance. You have to have some rest. You can't work, 10 hours every day. You can't do it. So backstory on that. So we are 5 days, and what we're doing there is just from 4 to 8 p.m. Because, when this first happened, it was very sudden, and we did not know. We honestly did, everything goes through your head. Should we just close? And then you worry about your people who've been with you for 10, 15 years. Are you just going to pull the rug out from underneath them? No, of course not. So you try to sort of just sort through it all. And we ended up coming up with the 4 to 8 at that location. The other one, we're open 7 days a week, typically lunch and dinner. And because of the quarantine, we're next to a park in River Prairie in Altoona, we decided to do the same thing, but limit the days as well to just Wednesday to Saturday.
Are you doing to-goes at Dragon Eddie's?
Pardon?
Do you do to-goes at Dragon Eddie's?
Yes, and the other one.
And
But everyone here's doing that. Everyone here's trying to do what they can to keep who they can working and serve the public as much as they can.
And are the to-goes paying the bills?
No. No.
No. And the reason I ask is because I went from 6 nights to 3 nights, Friday, Saturday, Sunday, and, with the exception of an okay Friday night fish fry, the other 2 are kind of lethargic. And
Right.
all they've done is stop the hemorrhaging, but we're still bleeding.
And honestly, when you look at the numbers, if you think your food cost on the average is, 20, 30%, whatever percentage you use in your own operation, that's high. But I mean, by the time you do that in labor, you don't really make anything. We're doing it because we do have people who just say, we want to work. We will go crazy if we go on unemployment. We will absolutely go stir crazy. We need to get out of the house, and we love doing this. And so that's really why we're doing it, for the benefit of the staff, for their morale. But it's a handful. It's where you just do what you can do.
Yeah.
You got to love those people that can do 20% food costs in those pasta places.
Yes, Mr. Marsicano's coming up next.
I'm talking to a lot of supper club here, Joanne.
There's a lot of sausage meat on those pizzas. It's expensive.
See, listen, I'm going to wrap up this block of testimony from the Wisconsin Restaurant Association. I just want to say that obviously no visit is complete in the Wisconsin Dells without visiting Ishnala, and certainly Dragon Eddie's in the Eau Claire, Altoona area So Bob, you deserve all the accolades you continue to get, and hopefully we can get Ishnala running again and Dragon Eddie's and the rest of the restaurants across the state sooner than later. So I want to thank you guys for taking time out. I apologize it took us long to get to you, but with that, you may feel free to disconnect. And thank you, Christine, very much for your perspective.
Thank you for having me.
Thank you, Chairman Sorensen. Look forward to seeing you.
You bet. Next up, we will move to Scott Stenger and Chris Marsicano from the Tavern League of Wisconsin.
They're just going to go one at a time.
Oh, all right. You want to do Chris first? Can you sit up maybe on the edge or something, Scott, or right behind him maybe? Yeah. If you guys are comfortable with that.
We're fine with that.
Yeah, okay.
Spend more time with them than I would with my wife.
So before we start, you guys, and I don't know where Rob went, but the three of us and Dan Knodel and Representative Sommerfeld lost a very good friend this morning. Very good friend of the Tavern League and the state in Dan Frisch from was Mauston, Heine's Tavern, and then he lived in Baraboo. So Tuna Frisch was a good friend of mine and his lovely wife, Cupcakes. And I just hope you can extend my condolences and my sympathy that he lost his battle with cancer this morning. And that one hit home. It really hurt. He was a good guy.
Great guy. Known him for many, many years, and epitomized the best in the small business world. And just give you the shirt off his back. He's a great guy.
Yeah. With that, I will open up. You guys have the floor. Chris Marsicano owns the Village Supper Club in Delavan, on Lake Delavan, and represents roughly 5,000 members of the Tavern League of Wisconsin. So go ahead, Chris, you got the floor.
All right. Well, thank you, Representative Swearingen, and thank you for the State Affairs Committee for letting us be here today to talk to you. As Mr. Swearingen said, I do represent the Tavern League of Wisconsin. I'm the president. We have roughly about 5,000 small, independently owned and operated mom and pop businesses. It ranges anywhere from the supper club to the tavern to the resort with 500 rooms. So we have a wide variety of people that we represent. We have a big influence in our communities. The Tavern League last year gave away over $13 million in their community. So we are a big part of our community, the bars, the restaurants, and the taverns. And I would just add that during this whole pandemic, while we've been closed and shuttered and working at 20% doing to-go as curbside, that these business people with their own concerns about losing the roof over their heads have continued to give to their communities, feeding the first responders and the hospital workers and people in their own community that are out of jobs. They've continued to feed them with their extra time that they've taken away from their business. So that is the type of businesses that I am proud to represent. We are also, at the Tavern League of Wisconsin, as you know, we are the originators of the Safe Ride Home program, not to be confused with the Safer Home program. And we last year we gave away 91,000 rides throughout the state. So we are used to operating under the assumption of we want to keep our customers safe, we want to keep our employees safe, we want to keep our community safe. And at this point, our industry is in desperate straits. As of we sit here right now, we have been closed 45 days. We were told to close on March 17th, which is St. Patty's Day, which in the bar business, restaurant business, is a huge day. We had the corned beef on, we had the cabbage cooking, and all of a sudden we got a 3-hour notice to say, it's over. Turn your lights off. Shut your doors. And I've been in this business. My business has been in my family for 55 years, and my brother and I have owned it for 30 years. And never in my life, I've grown up in, that's all I know how to do is run a restaurant. And I've never seen anything like this in my whole life. And I think our other members in the industry can attest to that too. Who would have thought that you would lock your doors and nobody can come in? And so we went with the Safer at Home order. We abide by it. We closed our doors. Everybody did the best they could with to-goes, curbside. I've seen a lot of great innovation out there from our members of trying to do the best they can to make things work. But to-goes, as was alluded to in the last testimony, they're just not cutting it. I am open 7 days a week at my restaurant normally when everything's going great. Lunch and dinner, I am down to doing 2 days, Fridays and Saturdays,
I have a well-known fish fry in the area, so that is a big night for me. But one night of fish fry, and as Mr. Swearingen alluded to, the other nights are a little lethargic. Saturday night's a little lethargic. It's, people just don't think of eating prime rib and lobster out of a styrofoam box. So, supper clubs, we just don't do that much of a to-go business like that on the other nights, but fish fry has been good. The communities around Wisconsin, I have to say, the communities have been tremendous in support of our businesses and the places in their communities. They've reached out, they've been there to get the to-goes and support us, and we're grateful for that, but it's just not enough to keep our doors open. We estimate, in listening to my members, that we could lose close to 60% of our people, because not only, the people that have the food can stay open right now and do the curbside and do that, and maybe they're operating at about, 20%, they've lost 90% of their business, but there's other ones that they only have alcohol and they're completely closed. They have no income coming in. And as has been alluded to in other testimony, the PPP and all these other programs are not working for our industry. They are not working for our industry. There's a lot of these places are small, individual owners, family owned, and they are not getting the help that they need, and they are afraid. I get it that people are afraid to go out of the pandemic. They're afraid of getting sick. They're afraid of getting somebody in their family sick. They're afraid of dying. But my members are afraid too. My members are afraid they're going to lose a lifetime's worth of work. They're afraid they're going to lose a business that's been in their family for generations. They're afraid they can't feed their family and kids. They're afraid they're going to lose the roof over their heads. So we're afraid too. And so we get the part about being afraid, but we have to come to some kind of a medium here where we can get our doors open safely, responsibly, and we are willing to do whatever it takes to do it safely and responsibly for the safety of our customers, for the safety of our employees, and a lot of our employees are families. So we don't want to get our families sick either. I have 6 of my employees are my family members. So we want it all to be safe, and if that means operating at 25% to start out with, we don't think this is going to flip a light switch and it's all going to go back to normal. Nothing is ever going to be normal again after this. But we think that if we can do this slowly and open up, if it's 25%, if the mandate comes down that we have to wear masks and gloves, that's fine. If we have to get rid of all our paper menus and all the condiments on the table and go to single packet use, that's fine. We will do whatever it takes, but we have to get back to work. Our employees are suffering. Our members are suffering. And it's just not, when you say the restaurants are closed, the bars are closed, it's just not us. It's a trickle-down effect. With our industry being closed, it is trickling down because our employees don't have the money to go out and spend in other areas. The people that supply us with the goods and services, the meat, the eggs, the milk, we've all seen those things on TV. It is affecting everybody around us. And I think that we need to get back to work, but we want to do it responsible. We want to do it safely. But if we go to May 26th, which would be 70 days closed, I don't know a lot of places, especially with our profit margins, that are going to make it through 70 days with no income. We just can't do it. And we've already lost St. Patrick's Day. We've lost Easter. We're going to lose Mother's Day probably. And if we lose Memorial Day weekend, you can see, then you can just probably kiss the summer goodbye. And people are going to be skittish going out this summer. You're not going to see the crowds. You're not going to see the 3 deep at the bar. You're not going to see the 500 people waiting 2 hours in line for a fish fry on a Friday night. People are going to be skittish going out. They're going to be very conscious of social distancing and these things. So if we have to take half the tables out of our dining rooms, that's fine. We'll do that, whatever it takes to get us open. But we're looking for guidance. We need guidance from the state of Wisconsin, and we need a timeline. Our people are desperate to know. We're all sitting there going, when can we open? When do you think we can open? When can I start preparing? How do I start preparing my business? We're looking for information. We're looking for guidance, and we're hoping that we can get it soon because we are in desperate straits.
Scott? Thank you very much, Mr. Chair and members of the committee. As Chris mentioned, this is day 45. And I think one thing that really needs that we want to have resonate here today, businesses are open in Wisconsin. Businesses are open, thousands of businesses, and more have been this week with Governor Evers' amendment to the order, which we applaud. But we have to make sure we understand businesses are open today and safely operating. We aren't talking about just opening up restaurants and taverns, and it's the first business in the state to do so. We need to learn from those businesses that are open today, that are operating safely, that have the trust of consumers. So we have to say, as restaurants and the hospitality industry and taverns and supper clubs, we can do the same job that they're doing. What we cannot do, what the membership of our association cannot handle, is another 30 days of closure. We just can't do it. There is no way that the small operators, now if you're an airline in this country, you got your payout. If you're hotels, you got your payout. As Christine mentioned in her testimony, the PPP isn't crafted for small business. It isn't crafted for hospitality. So we haven't seen many of our members be able to participate with that. We are literally at the end of our economic rope. And we come here today asking for any ideas, anything. But I can tell you, in the conversations that I've had and that Chris has had, May 26th, that is, if we have to go to May 26th without a change, and any type of a change, one optimistic change that we saw was allowing golf courses to have food and beverage. I need, I guess, and Secretary Hughes made a point, and I don't understand why a tavern or a supper club or a restaurant who has an outdoor area couldn't do the same thing. If we had that change, and we could do that next week, that would get us to the end of the month. That would get us the revenue we need. But I want to be clear, without a change in the near future, all these small taverns that are such a unique part of this state's history are going to vanish. They aren't going to be in business. I think we have to really look at that dynamic. We don't have all the answers. The governor's in a very difficult position, and he's done a lot of good things to deal with this issue. It's very difficult. We understand that. One of the difficult challenges that he has is the 13,000 businesses that we have in the hospitality industry that are going to, I've been doing this for 28 years. Nothing compares to this. Nothing. I talk to members every day, and they are so hopeful for any kind of a change that gives them some trickle of revenue. They have nothing right now. Many of our members don't have food. So their revenue went from here to zero. They have 1 or 2 employees, if that. These are the backbone of small businesses throughout the state. The other point that we think needs to be explored, and again, we're happy to have any type of a discussion to address these concerns, but it's hard for us to answer to some of our members in northern Wisconsin, where in 20 counties in the far northern part of this state, those 20 counties represent 1% of the total cases. 1%. Yet all of those taverns and supper clubs up there are closed. So we don't have all the answers. This is very difficult. But we come here today and plead. We're begging. Our members are begging that we need help. And we understand all the dynamics. And Representative, you raised some good questions about a worker who doesn't want to go to a job. The reality is that worker's concerns aren't going to be alleviated until there's a vaccine. That worker will always have that issue. So the issue before this state and every other state, 11 states have begun reopening. The issue before this state is, do we attempt to reopen or do we stay shuttered until we have a vaccine? I mean, that really is. What is the distinction between today and May 26th? There's really not a lot going to change. We need to make a decision of how to safely and responsibly begin to reopen. And it might be a very slow start for a while. But we are at a point, the small businesses in this state, they need hope. And there is no hope out there right now. We need some plan, some mechanism that we can at least begin to plan. Right now, the plans of small business that we represent, they're planning how to exit. That's what they're planning. They're planning how to get out of the business. It's like a car on the side of the highway, taking the license plates off the car and walking away. And that's what we're looking at today. So we beg this committee, we beg the governor, we beg anyone that will listen to come up with something. Because I can't explain to a member why they can't have a beer and a burger outside of their establishment, but across the street at a golf course you can. And the other point I think that's important to make, as difficult as this is, I'm not aware of any non-compliance. I'm not saying there isn't some out there, but I'm not aware of it. Our members are following this order. We are frustrated. We want to see a change, but we respect it, and we are following it. So we really hope, as you move forward, the two issues that we would think could be addressed sooner rather than later is outdoor, being able to consume alcohol and food outdoor at those establishments that have that capability, and also to address the regional aspect of this. 1% of the cases in northern Wisconsin. So those are two issues we think hopefully you can try to work on quickly. With that, thank you very much.
Scott, go back to the freestanding tavern that's run by a husband and wife that may have a frozen pizza or may not, and all they have is a shot in a beer place, right? So when the order came down on St. Patrick's Day, they're done. They don't serve food. They have no opportunity to carry out.
And not only have they not generated any revenue, a lot of places that do have a menu, that do have food, but are in small communities, a small community by itself without having the alcohol sales and being able to supplement that income, those small neighborhood taverns can't make it, even if they do have food. So many of them have chosen to close, especially in small communities. But yeah, we've got members for 45 days haven't made a penny. And, you know, the only good news out of all this, and Chris and I were talking, if you're going to pick a month to have to close a lot of bars in Wisconsin, you know, March and April were the 2 months that you could. We're not saying that it was good, but those are the slowest months of the year. So that was somewhat good luck. But we go from a very slow month of April to a very big month in May. And to be closed through Memorial Day, I mean, that's another important point. Memorial Day is a big day for the industry. And our members are very frustrated that the order says you can't be open on Memorial Day. On the weekend before, you can't, but then Tuesday you can. So millions of dollars will be lost in that revenue over that holiday. But also, it's clear there is no, May 26th may change to July 5th. So that's what uncertainty is out there. And we're hopeful that this can bring people together and try to begin to provide some plan and some hope for a lot of those small businesses that are out there.
And Chris, can you take me back to March 17th? I just want you to relive your frustration on what happened that day as you were getting ready for the night's business.
Well, of course, let's go back to March 15th. Let's go back to March 15th when the order came down that we were going to have to limit our establishments to the 6 feet social distancing, the half 50 people or half your occupancy. We got that memo out to our people. This is the order starting, what we're going to have to do starting Tuesday. Or starting that Monday, it was actually, and so we changed our tables, we changed everything, we changed our seating around, we took out bar stools. All of our members did the same thing. St. Patty's Day came around. People, we thought we could be open at least for some business. We cooked the corned beef, we cooked the cabbage. Some people had all this food on hand because usually it's a big day. The green beer was in, and 1 o'clock in the afternoon, all of a sudden it says, okay, you got 3 hours and you can pull the plug, and you're done. And some people at that time had full bars full of people, and then full kitchens full of food. They were getting ready for the nighttime crew. We had to change I had a big fundraiser for the Lions Club. I had 1,000 pounds of corned beef cooked, and we had to pull the plug. And we had to do it all to go, all curbside, all to go. Nobody could come in, no drinks, no nothing. 5 o'clock, you got to leave. Everybody's got to leave. It was devastating for our people. It was just absolutely devastating. And people call me and they say, what do we do? I don't know where to turn. I don't have any revenue coming in. I'm going to lose my business. And these people call me and they burst into tears. And as a fellow business owner, I feel their pain. I mean, I'm right there with them. I'm down to work. I'm down to 1 day a week. And all my life, I'm 56 years old. I've never been down to work in 1 day a week, and I don't know what to tell them, and I'm at a loss. But I'm with them. I'm with you. And the other thing is that we might get open here, and we might open at 25%. We're going to be open at 50%, and it might take a while to get to where we're going. But these businesses, mine included, are never going to be able to make up these dollars that we've lost. You're never going to be able to go back and make up the money that you lost over the month of March and April, and we'll never catch up to it. And our profit margins, like you say, are not that good. And the real tell, I'm sorry to say, is going to be not in July or August when we get going here. These places, some of them will open up, and you'll have some traffic because it's summertime, not summers like we know it to be in Wisconsin, but there'll be some summertime traffic. But the real tell is going to be October, November, December, when the summer crowd goes home and these businesses didn't make all that money that they usually make in the summer to nest egg to get them through the winter. And these places are going to go out of business in droves. And my membership, I'm afraid I'm going to lose maybe a third to a half of my membership, because that's what I see happening. We'll make it through the summer, a lot of them, because there's cash flow, because there are visitors to the state, and there will be people around. But once you get to October, November, December, I can see these people closing their doors, never to return.
And despite all that, you respected the order that day.
We respected the order.
You continue to tell your membership to respect
the
order.
We continue to respect the order, and we have had calls. Can we open May 1st? Can we open, there's some confusion about the different days. Is it the 15th? Is it the 1st? And can we open, or can I do this? And all along, as we told our people, 5 o'clock on the 17th, you close your doors, and you remain closed until the order is lifted, and follow the law. Now, we've had some, as you've probably seen in the news, there's been some, in fact, there was just a story in the Polk County newspaper. One of the sheriffs up in Polk County said he didn't see any problem up there, and he could, and places could open at their discretion, and they wouldn't bother them. And the bar owner quoted in the newspaper article said, well, that's fine that he said that, but I'm abiding by the Tavern League's guidelines and what they told me, and they told me to stay closed until the order is lifted. So our members are listening, and they are staying closed, but we're waiting desperately for word of when we can start to get back to work. The people in our industry are hardworking people in the state of Wisconsin, and we like to work, and we want to get back to work, and we love our customers, and we want to get back to serving our customers. We want to see them. This is a social thing as much as anything. We love seeing our customers, and we want to get back to work.
Representative Sinicki and then McGuire.
Thank you, Mr. Chair. Thank you for your comments. Just the district that I represent, one of the cities is the city of Cudahy. And if anybody's familiar with the south side of Milwaukee, in the city of Cudahy, it's historically known as a blue-collar city with a bar on every corner. I mean, it's just the way it's always been. So the city of Cudahy has been hit really, really hard with this. That said, a lot of my businesses down there still support the governor's plan, because they realize that if we, as I've said before, if we open too quickly without a plan, we're just going to end up in the same situation next fall. That is most people's biggest concern. And I am going to have a question, but I just want to bring up one other thing. You keep talking about regional. You can do this regionally. Again, in the city of Cudahy, we have Patrick Cudahy, a meat packing plant. I would say 90% of those employees there live in Milwaukee, in the 53215 zip code. Lo and behold, Patrick Cudahy had an outbreak. We don't even know how many people it was yet. And 53215 zip code in Milwaukee exploded with the virus. So it does not, you can't do it regionally. Because if I live in the city of Milwaukee and there's a restaurant open, like I said, in Kenosha or Brookfield, wherever, that I want to go to, I'm going to go. So we need to stop talking about how do we get past regional. I don't know. I mean, because it's not going to work that way. And that concerns me. If we're going to do it regionally, I'm going to be wearing this mask for the next 5 years. I don't want to have to do that. I don't want to have to do that. I mean, I know the Tavern League, our taverns and our restaurants have been hit the hardest in all of this. I more than realize that. But we need to come up with everybody to work together. Like Christine said, work together, work with the governor's office, come up with a reasonable plan to get this done. And let's stop, this back and forth and saying, well, we want it this way, we want it this way. No, it's not the way it's going to work. And so I don't know where my question is, but I had to get that out there. And I guess I do have a question on going back to the unemployment. Now that I'm off my soapbox, going back to the unemployment issue again. So you're an employer.
Mm-hmm. Yes.
If you open and your employees decide not to come back to work, what are you going to do? Are they fired? Are you going to,
No, if they are, it's totally up to them. If they are comfortable coming back to work for me, most of my employees, I've been a family-run business. Like I said, a lot of my employees are family, and a lot of my employees have been with me I have the longest employees been with me for 40 years. And a lot of my other employees have been with me 10 or 12 years. Okay. So if they do not feel comfortable coming back, I would not hold that against them. I would say take your time, come back when you're ready. Your job is always here for you. I think we always have a lot of our small mom and pop places, like I like to call them. We have great loyalty with our employees. Their employees become our family, and so our concerns are their concerns, and so we would adjust to their needs.
Yeah, one more quick question. So let's briefly just talk about if one of your employees does come down with the virus, and it's because we all opened too early. I mean, it's my understanding that wasn't there something done where when we passed the COVID bill that your employers are not responsible for covering insurance for that? Was that something I misread? Could somebody answer that for me?
Yeah, I think Ledge Council is here on teleconference. Would you want them to weigh in on that?
Could they? Just, I think it's an important question.
Anna, are you with us?
I'm here.
Wonderful. How are you today?
Hi, everyone. The Federal CARES Act and also Act 185, which was just recently passed at the state level, both have some provisions relating to unemployment insurance. And particularly with the last question, the Federal Act essentially shifts much of the responsibility for unemployment insurance now to the state and federal government through the end of the calendar year. And there are also several eligibility exemptions in both, like I said, the Federal Act and the State Act. Some of those eligibility exemptions apply if the place of employment has closed, if a person has a lack of child care, if a person has to provide care for a household member who has been diagnosed, or if a person has been diagnosed themselves. And then with the state law, there were changes made to to allow a temporary waiver of the typical waiting period for initial claims for benefits, and certain requirements relating to work share programs, which might not apply as much here. But so I guess to answer some of the questions that have been asked about unemployment insurance, some of those criteria for some of the eligibility waivers might not apply if a place of employment is able to reopen and the person doesn't have either a lack of child care or a diagnosis of either themselves or a household member. But assuming one of those conditions continues to apply, though some of the
other changes to the law made under Act 185 may continue to help that person. For example, the waiver of the waiting period. And by executive order, the governor also waived certain requirements relating to some of the work search requirements that are typically required. And I believe that the Department of Workforce Development is currently working on a rule promulgation relating to that. So I think we'll have more details later, and some of those, some of what we still have, I think maybe coming down the pike might have more specific information about some of these questions that will come up after businesses are allowed to reopen.
You want, Anna, I'm going to have our conversation with you offline about it, if you don't mind, maybe tomorrow. Sure, absolutely. My question, and it's getting late, and I really just wanted to see if you were still with us.
If I could just to follow up, I think the answer to your question is irrelevant if the business is no longer there. And
well, yeah,
and so, but that's where we are. You know, we're not at a point where, you know, this employee, that we're at a point where there's no employer. And that's the issue that we're trying to address. And also, I believe other states, including New York, are looking at regional options for opening. So we're happy to have discussions on that and any other option. You know, the outdoor consumption is something that we think could happen statewide. That would help us tremendously. You know, that would really help this industry. That might help us be able to get from here, you know, to there. So we're open to any discussion with anyone on any of these issues.
And as I said earlier when I first started out, y'all need to just sit down with the governor's office and figure out how to do it.
Well,
together.
I'm available right now.
I don't know if the governor is.
Representative McGuire and then Kuglich.
Certainly, and thank you, Mr. Chairman. I'm restricted to one question, so I'll pick it wisely. Well, first of all, thank you both for being here. We certainly appreciate that, and I can say very truthfully that I am deeply concerned about the impacts that this malicious virus has had on your industry. My mic is on; it's just hard to look at people and talk into it at the same time. But I wanted to say in my conversations, there have been a couple of other things that we've discussed that haven't been mentioned yet today, and I'm just curious about hearing what your members perhaps feel about Class B license delivery, as well as changing in the credit laws temporarily, of course, to allow for additional credit for repayment for bar owners. And then lastly, whether any of your members have been able to successfully use the governor's most recent executive order, which I believe allows curbside sale for all businesses in the state of Wisconsin, including taverns.
Let you start.
Yeah. Well, we've been able to do the curbside essentially since the beginning.
With alcohol?
No, well, as long as the sale occurs on premise, that was permitted.
Right.
Yep. So we were able to do that. You raise a very good point on the 15-day and 30-day credit law. We will have a situation with some members who license renewal is coming up, so they have to have license paid for. Some municipalities are lowering that fee, which we greatly appreciate. But there is a provision in the statute that if you are not current on your beer or alcohol sales, that you are not eligible to get your license renewed. And so we are working trying to get support with the department to get a waiver on that for cases that have not been able to make that payment. So that continues to be an issue as we get closer to the expiration of the license year. And then on delivery, you know, that was an issue at the outset. I've had some discussions with the secretary. We think that would be helpful. We can have alcohol sales. You can't consume on the premise. But what we had suggested is, as other states, New York, Texas, have done in their orders to allow taverns and restaurants to deliver, and in Wisconsin be a Class B, to make delivery, which currently they are not permitted to do.
Right, and I think, and I won't ask any more questions, and I'm sure Anna could clarify this as well, but our governor doesn't have constitutional authority to alter statutes, and that's explicitly prohibited by statute, right? So we would have to change a statute, would have to pass through the legislature for that to be permitted.
Well, I think doesn't the health emergency give the governor certain authority? Because we have a closing hour of 2 a.m. that is no longer in force,
Okay. Yeah.
which is a statute.
Yeah, that's interesting. It was my understanding that that was the authority that he did not have to change statutes.
Yep.
So, okay.
Actually, Anna, are you still there?
Yeah.
Can you weigh in on that real quickly? Can the governor, by executive order, allow these places to deliver alcohol?
So I'm going to answer your question a little evasively. So
We're used to that from everybody today.
has been that the emergency declaration does not give the governor the authority to waive any requirement that is statutory. But it does give him explicitly the authority, the statutes give the governor the authority to suspend administrative rules and guidance based on administrative rules. So in the alcohol beverage area, anything that is more of a DOR guidance based authority rather than a Chapter 125 based authority could be waived or suspended. Something that is, rooted more solidly in Chapter 125 would need a statutory change.
So, what about 2 p.m. closing times? This is the question.
2 a.m.
Yeah, 2 a.m.
Excuse me. At 2 p.m. Boy.
We'll take 2 p.m.
You hear-
So I think that.
Yeah, go ahead.
That is statutory, and so it would need a statutory change.
Okay. All right, thanks, Anna. Representative Kuglich.
Thank you, Mr. Chair, and thank you, Scott and Chris, for being here today. So there's a lot of information that's been going around in this hearing, but one of the things that's just a fact is that, before I ask my question, is we currently don't have a vaccine and we don't have a cure. I think everybody can agree on that, correct? So I know Representative Sinicki has a concern that if we open up too quickly before we have a plan, she fears that there's going to be a big disaster. So we do have a plan, and that's what we're here today, and it's the WMC plan. And it does open up business, but if what I've heard today is it identifies risk, it manages, and it mitigates risk. So without a cure and without a vaccine, if we don't move forward with this type of plan, I don't see us opening up anytime soon. And I just wonder why May 26th is this magic date, when if you look at the facts, that may move back to June 26th, and then July 26th, and then August 26th. So here's the question is, because I get this from some of my constituents, when I talk about opening up now, but do it safely and mitigate the risk, and obviously to protect the most high-risk population, that I get pushback that I don't care about people's lives and I don't care about people's safety. So how do you answer that question?
Well, I can start. I think it would be difficult to answer that question if there weren't any businesses that were open. That question, I think the premise is every business in the state is closed. The person who probably asked that question just probably got back from the grocery store, went to the hardware store. I mean, that's the new activity for people now, is to go to the home improvement center. So we have businesses open today and operating safely and responsibly. So you're exactly right. Without a vaccine or a cure, I think the question we have to ask is, are we going to open? That's the question that has to be asked. Is Wisconsin going to open back up? And if the answer is yes, what difference if it's May 26th or May 6th? Nothing really changes. Let's open safely and responsibly and copy what other businesses are currently doing. Because we're not going to get rid of the risk. It's going to always be a risk until there's a vaccine or a cure. And there are some people that think we should be closed until that time. And that's, I don't think, a realistic option. But we need to look at what works today. We have thousands of businesses open today, thousands of businesses where people are going every day, and they are mitigating the risk. People are adapting to that, and we have to take that and apply it to other businesses, not just ours, but other businesses.
I would just add that I think that in our business, in the hospitality industry, we care very greatly about our customers. That's why we're in the customer service business. And a lot of our customers have become like family in the small towns and in the places we live and the places communities we send our kids to school and where we grow up. So I think we care just maybe that much more about our customers and their safety and their families because we get to know them, we get relationships with them, and we're going to make sure everybody's safe, not only for our customers, but for our employees and for our families too. And I think we as individual, small, individually owned and operated mom and pop businesses can do that a heck of a lot better than the big box stores and the corporate level.
Okay, we're going to switch to Representative Cabrera. Hopefully we're still connected. There she is. Go ahead.
Hello?
Yep, you're on.
All right. So I think a big piece of this plan that is missing and why is my biggest concern and what keeps coming up is it's not that anybody here doesn't want businesses to reopen. The concern is the safety and reopening. And what's lacking from this plan is the testing and contact tracing. And why that's important, because this is a virus that is transmissible even when people are asymptomatic, which basically means we don't actually know what the infection rate is, which is why this plan, even though it has these criteria that they're assessing risk, is premised on a false premise because of the fact that the risk is based on only known cases. And that's why we need the testing and we need the contact tracing, because that way we will have a better picture of really what is the rate of cases that we have in our state and what is the risk factor when we know who really is infected and who isn't, and where are they going and who are they coming into contact with. That's important, and that's why I believe the governor picked that date, is so that we would have the time to do the mass testing and have the results and see where things are really. And we have been having an uptick, so it isn't really safe right now. And so that is something that's important for us to take into consideration, that your plan, this WMC plan, does not include testing. So we don't actually know who is going to be at your businesses that are infected, who's going to come in as a customer who's infected. And that's important to know because it's so contagious and it spreads so quickly within a week. Again, if you look at Brown County, they have very low numbers, and then all of a sudden within 1 week their cases skyrocketed by 1,000%. That's how fast the disease spreads. So it's important to take that into account. And I have all the sympathy in the world for all the business owners who are either closed or have reduced capacity because of this, but it's keeping people safe. That is the reason why we only have the 300 deaths, which, by the way, isn't the only factor we should be considering, because even the folks who have recovered will still have long-term health issues because of the internal effects that the disease had on them. So it's important to keep that in mind, that we need to do the testing, we need to do the contact tracing. That is what's going to give us a real accurate picture of what the number is, and even in these places where there haven't been any cases, quote unquote, but we don't really know that because we don't have the mass testing that we need.
Representative Summerfield.
Okay. Just want to thank Scott, Chris, organization. I know up in Chippewa, Dunn counties, I've gotten pretty much most all the bar owners, tavern owners, restaurants reached out to me, and I tell them something, and they're like, oh yeah, Tavern League just texted us this or emailed this. So I know you guys are doing very well on the communication, but communication only goes so far. When, we have 45 days of being businesses closed. I would like to get to the point of the regional opening. I know this is, a one size, right now, the rate we're going at, one size doesn't fit all, with the capacities, 25% regional. I know, I'm just thinking top of my head, members in Chippewa County, I'm thinking 20% of them, 25, if you could open 25%, have 10 people through the door. 10 people max, because they're the mom and pops, they're working behind the bar, they can play the video games, play the darts, that's just money into their pockets. So I think the regional approach, which you guys are approaching, is a very good step. I mean, it's not going to work for, a bigger place like Loopy's, who's got, he needs volleyball to start in the dome. And, there's no great answers for him at this point. But I know if he could get, 20 people in his big place, it's a start. With that, I know Tavern League members, are they getting in with the buy-in with your proposal? I know you guys had a very detailed proposal last week and WMC has thrown that in. I mean, have you get overall, I'm not going to say any of the business owners are going to be happy with it because, it's quite limited, but overall have you seen, hey, this is something we can live with? Because my experience talking to all business owners, and especially restaurants and taverns, like any way we can start, even if it's a 10%, that's something we could go. This alcohol delivery, curbside, it's an idea, it's great, but we need people into the buildings, and the way we do it smartly. So I'm just curious if the buy-in, in the tavern industry, there's a lot of people with a little more stubborn, but have they kind of accepted that, hey, we need to get this ball rolling?
Yeah, I think a majority, I won't say all, because you can't please everybody. We all know that from being in the restaurant business. But majority of our members are supportive of our efforts to get open, and their goal is whatever it takes. Let's get the door open. Let's do it safely. Let's do it responsibly. If we have to have 10%, if we have to have 25%, if we have to wear masks and gloves, if we have to take every other bar stool out. Let's get this ball rolling. Let's get the door open, because right now I'm sitting here with nothing, and my building is built on quicksand right now. My business is on quicksand, and it's sinking rapidly. We need to get the doors open, and so they are very supportive of something to get open. And then as we get open, then let's figure out let's move it on from there. Let's adjust it as we get open. And these conditions are not ideal for all my members. Like I said, my members range anywhere from a 10-stool bar to a 400-room resort. And so the 10-stool bar, if you're going to say, well, every 6 feet, so I got 2 people in there, but it's something. It's something. It's something happening. It's they just want to get open safely, responsibly. We need to get back to work. We need to get open.
Yeah, I think 100% of our membership wants to reopen and in some form. And there are going to be challenges, and I think we understand that. But right now is not good, and we need to get some progress, a plan, because if we don't, May 26th, I just don't see a lot of our folks being able to survive 70 days with no viable income. So, yeah, there's going to be a lot of growing pain. This isn't going to be business right back the way it was, but we are supportive of doing this slowly. We do support making sure it's safe and responsible and learning from the businesses that are currently operating. So we don't want to just open up the doors and everybody come in. We are going to make sure to educate and train and make sure licensees around the state know what the requirements are going to be as they begin to open their doors.
And I just like to throw in that, people say, well, you are open, kind of, you have the ability to do to-goes and curbside, and that's just not cutting it. And if you're doing 25% of your business one night a week, and the bills are still flowing in, my property taxes still due, my mortgage is still due, I'm still paying, trying to pay as many of my employees as I can that have been with me for a long time. My electric bill is still due, all my utilities, my insurance, all that is still due, and yet I'm bringing in a quarter of my revenue, but 100% of my bills are still there. And that's, to a lesser or greater degree, every one of us is facing that as a small business. And we can't survive like that. You can't take in 25% and pay out 100%. The math doesn't work. So we need to get open. And I think going down the road here, once we get open, there's got to be some discussion of relief for this small business area. The federal grants are not doing it for our people. There needs to be something down the road. Once we get past this point and we get our doors open and we get moving again, there's going to have to be some talk about some kind of relief for our members and the members of the hospitality and all small business, because it's going to be a long road. It's going to be a long comeback. This is not going to be open your doors and everything's back to normal. This is going to be a long road, and a lot of people won't make it.
Okay, I've got Representative Onstead, then Vorpagel, and we're going to end with Representative Stubbs. So 3 more questions. Representative Onstead.
Well, thanks, Mr. Chairman, and thanks to both of you for coming in today. And everybody in this room wants you guys to be able to reopen like the very second that it becomes safe to do so. And I'm just going to try to be optimistic here for a little bit. It's kind of hard sometimes during these times, but I'm going to try to be optimistic and say that, some of the positive signs that we've seen in the last few days of, the virus perhaps subsiding a little bit. Hopefully that continues, and we get to a point, maybe the 14 days that the White House and CDC and the governor have decided maybe that's the number, maybe there's a different number. But let's say that we get to the point where it's decided by the parties that be that, it's safe to reopen on a gradual basis, as you've mentioned. I think of a bartender that I talked to earlier in the week. She was talking about her unemployment, and and she said, "Well, when do you think that we're going to be reopening?" And I said, "Well, explain the 14-day thing that's in the governor's plan, and it's also in the White House plan." And she said, "Well, as much as I'd like to go back to work," and she was getting $79 a week in unemployment. "As much as I need to go back to work," she's supporting a 16-year-old son on her own, says, "as much as I need to go back to work, I don't want to go back to work until it's safe." And I think that is, why we're all here today, because we need to go back to work, but we also need to go back to work when it's safe. And I think that the Wisconsin Restaurant Promise, I think that showed like a real plan to convince the public that they do have a plan in terms of, when it's safe to go back. I think our consumers are going to need to be convinced that it's safe to go back, and probably at a lot smaller number. So we got a lot of work to do. And I'll just go back to the Secretary's analogy just an hour or so ago when she was talking about handing it off on the race. We just have to remember that this is not a sprint. This is a marathon. This is going to be with us for a long time. We need to continue to work on a lot of different issues. We need to get this one over with quick, but there will be more issues in front of us, and we just this is the first meeting, the very first meeting that we've had of any committee to address this issue, and it certainly should not be the last. So my question is, what do I say?
There is a question there. Okay.
You're not going to get me gone without a question. So what do I say to that? To my friend, the bartender, who, despite the fact that she hadn't received the $600 allocation yet, she was living on $79 a week. What do I say to her in terms of I only want to go back when it's safe?
Well, I guess I would ask her when would that be? That would be when we have a vaccine, I guess, is what she would be saying, and I respect that, but that's 1.5 years or longer. And so I think the challenge is we can do both here. We can be safe and we can have business. We're already having business operate in this state. We can do both, and we have to do both, and that's our position. But if the standard's going to be we aren't going to leave our homes until there's a vaccine, I don't think that that's a viable position. And I think I don't think any state is looking at that as a viable position. And when we have spikes, I have no idea. But from what I've heard, this could come back in the fall. Are we going to close everything down again? If we open up and there's a spike, are we got to close? We need to start to figure out how to make sure people are educated and businesses are educated so that customers have a level of safety when they visit our establishments.
I would just add to your question as an employer, she came to me and said, I don't feel comfortable coming back to work, you're opening up. And I would say, that's fine, when you're ready to come back, you let me know. But she has that choice to come back to work or not. I don't have that choice. I'm closed, and I don't have that choice.
Just to follow up, if I may.
Real quick.
Well, the White House and the governor's office has decided that what makes it safe is 14 days. 14 days of no spikes. And he said, I heard him say the other day that, somebody asked the question, well, what if you go 7 or 8 days? And all of a sudden you have a little spike and then you go back down again. He said, well, if that's an anomaly, we would, certainly take a look at that. So maybe the best minds in the country have decided that 14 days of no increases is what makes it safe. I believe in China that at least allegedly theirs was 14 days of no cases at Wuhan. So you can't tell whether it's correct or not, but nevertheless, maybe 14 days is the answer in terms of whether it's being safe or not. But certainly, I encourage all of us to continue to have conversation. I hope that the governor's office or a secretary reaches out to you, or you reach out to a secretary, and those conversations happen because we all got to get back to work.
Yep. Representative Vorpago.
Thank you, Mr. Chair. This might involve getting on a soapbox for a second here.
Make it a quick soapbox.
We're
about 2 hours behind.
We're going to try. I've been holding it in for a while because I came here today optimistic, and I'm still optimistic. But I continually hear from folks on the other side of the aisle that we can't do anything until we have contact testing and contact tracing. We're already doing that. That's how we know in Sheboygan County. We have had 50 confirmed cases since they started testing over a month and a half ago. 7 active cases, 41 recovered cases, 2 deaths, and 924 negative results. We're doing that. It was also said we need to know who's coming in and maybe carrying the virus into our facilities or who's working here. We can't know that because that's a HIPAA violation. If you can hear the frustration in my voice, it's because I feel helpless throughout this entire process. I have constituents, people who are scared, business owners who are scared, business owners who want to open, business owners who don't, business owners who are trying to protect their people, and I want to help every single one of them. But up until now, I don't feel like I've had a voice. It's been told what is going on, and we're going to use the science, we're going to use this. Yes, great, we should. No disagreement there. That we can argue over whether it's 58,000 tests in a week or a less number, 14 days of a decline of positive percentages or less. But overwhelmingly, I've heard in the media and today is people want us to come together and work together to open things back up. This leads into my question. We've had the Restaurant Association who has said that they have put something together for them. You guys are working with your members and have put something together. WMC has put something together. So all this has been out there. At some point, you have to get together and talk. Where's the talk been? I mean, have you guys reached out? I mean, there's other things I can think of. The governor the administration has $2 billion to respond to this. Revolving loan fund for businesses who aren't part of the PPP. I mean, what has been, there's been a lot of stuff being put out there. What has been the come to the table to try and find some middle ground, to try and work something out? I don't think what the administration has is golden. I don't think what WMC is golden. There's got to be some common ground, but where's the talk? We're all just going like this. Where's people coming to the table?
No, I don't disagree, and we're frustrated as well. And so we put a plan out about a week ago to begin some discussion, to begin that debate. And, we haven't had any discussions with the administration since then. We're happy to, and it has been frustrating because of not knowing and the uncertainty. And that's really the biggest hurdle we have to try to get over. We have to get to a point where we can do both. And there has to be an acknowledgement. Yes, we're going to have businesses open, but we're going to have to do it in a way that's safe and responsible. And we aren't going to have a vaccine. I mean, that's the dynamic that we have in front of us, and we have to confront that. Right now, we tell our members, I can't tell you May 26th you can open. I have no idea if that's possible. If this 14-day metric, which no state has achieved to this point, if that's the metric, we might be looking at 2021. I mean, and that's a reasonable statement, because that metric could push us into 2021, especially when the fall comes. So what we're trying to say is, hey, let's make a decision that we're going to begin the process of reopening. We can figure out the details, but right now that isn't the debate. The debate is we're closed until May 26th, or until if the governor decides to change that. And May 26th could become July 26th. And so that's the concern we have, and there's a lot of fear in the business community, small business community, on what to do.
We also, to your point of working together, we did put out a joint proposal with the Restaurant Association about 2 weeks ago, I believe it was. We also signed on to a proposal of 38 other business organizations that was sent to the governor, and we sent our proposal out on April 20th to the state, to the governor's office. And and if you would ask me if we have heard anything from anybody, I would have to answer no.
That's my question.
Last question, Representative Stubbs.
Thank you, Mr. Chairman.
Microphone, there you go.
Thank you. I'm so sorry. I apologize. I was listening to our colleague and very sincere. Thank you for giving me this opportunity to speak. Since it's only one time for this, I will make it quick. Thank you all so much for being here. In this conversation we've had, there's an area that has not been talked about, which is childcare. And I wanted to know if you could speak a little bit about how your business would be phased in, and if it would impact essential workers, such as our healthcare workers, because right now that's the priority for childcare. So do you have an approach in your decision making if things were to happen quickly in the state and you can get business up and going? What's your thoughts with that?
I'm not sure I'm following the question.
Childcare. Childcare is a critical issue right now. And the positions are given to essential workers. So if you're phased in as a business, how would I make sure, or how would you have childcare not take the positions, those slots for essential workers?
Most of our employees are small business operators, mom and pop, who many of them are the only employees, and other employees tend to be younger without children. So it's not as probably as much of an issue for our sector of the economy or business community.
Thank you.
Thank you.
All right, gentlemen. Chris Marzicano from the Village Supper Club in Delavan, thank you very much. And Scott Stenger, Governmental Affairs with the Tavern League of Wisconsin.
Mr. Chairman, thank you.
Thank you, Mr. Chairman.
Hopefully we can get things moving here, and Wisconsin's known for hospitality. And,
yes, we are.
You have to admit that the Tavern is the forefront of hospitality in this state, and it's imperative we get the taverns and the restaurants opened as soon as we can.
Just a good point to end on. A national poll just came out today that said, listing what Americans miss the most. 85% missed going to their local tavern and being able to be with their friends and family at a tavern. So it's not just in Wisconsin, around the country, and people are missing it, and we're hearing it, and it's we need to get to a point where we can get people back in and do it the right way.
There's a lot of old fashions out there that need to be drunk.
Guys, thank you very much.
Thank you.
With that, we're going to move to the dairy farmers. And I know we're a couple hours behind here, but so I'm going to ask to Skype in Grant Grinstead, who is the business manager for Verclair Farms in Fond du Lac. Grant, are you with us?
Yes, can you hear me?
I can hear you great.
Fantastic. So thank you, Chairman and members of the State Affairs Committee. My name is Grant Grinstead, business manager for Verclair Farms in Fond du Lac, Wisconsin. Verclair Farms is a fourth-generation dairy and farming operation. My wife's grandparents started in the dairy business with only 12 cows, and over the years, the dairy has grown to allow the next generations an opportunity to be part of a way of life that we call agriculture. Today, we milk over 2,000 cows and farm over 3,000 acres. We employ approximately 40 people from our local community that depend on us here at Verclair. I don't think it's unknown here that the dairy industry has faced many challenges over the last several years. But this was the year that we were going to try to get ahead. Milk prices were going to improve, and we could rewrite some chapters in our dairyman book. We realized that the COVID-19 was unforeseen. However, the impact that this has had on our industry has been like no other. Approximately 90% of our state's milk is used to make cheese. And just like many other farms, Verclair's milk goes to make this cheese. And over half of that cheese actually goes to the restaurants and food service. So without the restaurants and food service being opened and to a level that we are used to be accustomed to, cheese is just not being consumed. This has devastated the dairy industry in Wisconsin. Earlier this month, we received notice from our cheese processor to immediately cut production by 20%. Now, in a dairy operation, that's a little bit difficult to do, to just shut off that production. It's one of those things that's of many challenges, and if you have any respect at all for the creatures that God gave us to take care of, it's not an easy task. Through careful planning and procedures, cows were removed from the milk groups, and some were even culled off. This reduction in milk represented about 40,000 pounds or 4,600 gallons of milk every day that had to be disposed of. So just think about this for a minute. At Verclair, we provide the utmost care for each and every one of our animals every day. We provide optimal nutrition and environment for her to thrive in. And in turn, she gives back to our family operation by providing a wholesome, nutritious product that we call milk. Then the call comes from our processor that we have to reduce our milk. Our costs have already been incurred. We can't get that back. The loss of revenue alone to date has been over $250,000 to our operation. Not to mention, we probably haven't seen yet the worst pay price for milk of that milk we're allowed to ship. The reduction in milk production and revenue has not only impacted our business operations directly, but also how we conduct business in our community. So here's how the math really works. According to the Wisconsin Milk Marketing Board and the Wisconsin Department of Agriculture, the Wisconsin dairy industry generates $46.5 billion in state and local economic activity every year. So take that number and divide it by the number of cows in Wisconsin, which is approximately 1.26 million, and that gets you to a number of $36,000 that each cow contributes. So through culling off our animals and reducing our milk supply, that's going to amount to about $14.5 million in loss to our local and state economic activity represented by Verclair. This reduction not only impacts what we do today, but it also impacts our plans for possible future generations. In closing, the federal emergency funds to dairies are just a drop in the bucket. Agriculture is the only industry who got caps put on it. Airlines didn't. The numbers you hear in the media amount to very little. You must realize that aid from the government certainly isn't our goal. A fair price that comes from a healthy economy is what is needed here in Wisconsin, which is why I'm here today. We need to get our state moving again, in the right direction to save us all. Who have ever imagined that we'd all be sitting here asking legislators to let people go back to work? We need your support more than ever. Please support the WMC Back to Business plan and get our economy thriving again. The future of my family's farm, along with about 7,000 other dairy producers here in this state and all of our allied industries and suppliers, do depend on it. Thank you.
Thank you, Grant, and I'm going to ask you to stay on the line. I'm going to hear from a couple more here, and we'll get some questions for all three of you. I'm going to jump over Kim real quick and go to Jim Ostrom. Jim, are you still on the line? I know you had some scheduling conflicts.
No, I'm still here, thank you.
You want to go ahead, or are you okay to wait?
I'm fine, I can go ahead right now. I've got my testimony as it is, so.
Okay.
Mr. Chairman and committee, I thank
Jim, you want to unpause your video so we can see you?
Sure can. How's that?
There you are. Perfect. Go right ahead.
Thank you. Mr. Chairman and committee, my name is Jim Ostrom, and I'm a co-founder of Milk Source, and I'm also here representing the Wisconsin Dairy Alliance. At Milk Source, I have a partnership with John Vosters and Todd Willer, and we've been in business for 26 years. We are three Wisconsin farm boys that grew up to live our dream, and we have our headquarters here in Wisconsin. We have several large farms in Wisconsin, a couple small cheese businesses, and we have other businesses in Missouri and Kansas and Michigan and Pennsylvania. We support WMC's plan for back to business. We think it's the right plan, and it's a measured approach. Grant just spoke a bit about the dairy industry, and him and I did not collaborate, but the messages are very similar. I'm going to speak about the industry specifically, in that we've survived a 5-year recession. It's caused by an international trade war and an oversupply situation for a couple of those years. The dairy farmers of Wisconsin and the United States were pawns in the international war between our trading partners that tore balance sheets up and caused a lot of stress. And you may have heard that last fall dairy prices were good for the first time in 5 years, and they were. In the industry side, a collective sigh of relief. Lenders were calming down, and vendors were heartened by the progress the dairy industry was starting to make after such a long time. And then, of course, that all blew up. And let me give you a little bit of insight into our markets. In January, the May futures contract, which is what the market predicts the May price would be back then, Class 3 milk price, which is essentially cheese, was at $18. Most dairy producers, if not all, in the state of Wisconsin would make a reasonable living at $18. And then the dairy farmer could begin a process of healing their balance sheets that would take probably years. But it changed drastically when COVID-19 shut down the restaurants. And we heard so much from restaurant and tavern owners today. Our hearts in the dairy industry are tied with their hearts, and we are absolutely feeling the pain that they're feeling. When they closed, our food service industry, our food service customers shut down, some of them in some cases to zero. We've heard stories about grocery stores selling out of milk and cheese. They're all true. And retail demand is up, but overall demand is actually down 10 to 20%. And I think Grant talked about the effects on his business to that. But let me put that into perspective, a 10% decrease in demand, what it really means to the dairy industry. Over my career, a 1 or 2% decrease in demand or 1 or 2% oversupply caused milk prices to drop to break even or a loss for your average dairy farmer. So if we get a little bit long on milk supply or a little bit short on demand, the average dairy farmer that you've met in your life are going to lose money. That's 1 to 2%. We're talking about 10 to 12 to 15%, and that's led to a catastrophic collapse in the markets. And it's not just the milk market. So that May contract that I talked about, tomorrow's the 1st of May, so the May contract is here. And as of this morning, it was trading at $11.30. So at $11.30, the average producer is not just losing money. I can tell you that every producer is hemorrhaging cash and hemorrhaging it fast. And many of them will bleed out on the table very soon at that price. Recently, the USDA announced a $2.9 billion bailout. Grant talked a little bit about it. It's not material to solve the problem. The losses to the dairy industry are over $9 billion in the nation, and Wisconsin is really central to the dairy industry in the nation and in the world. And so it's a big deal here. But Wisconsin dairy farmers are experiencing more bad news than that. Premiums are dropping. So over my career, we would get somewhere between $1 and $3 a hundredweight premium, which for easy math is 25% premium or 20%. Those premiums have now slipped from $1 to $2, maybe $3, to 0, and in some cases negative premiums, if you can imagine that. So you're delivering a high quality, high protein, high butter fat product, and you're getting a discount to the market. The other compounding problem is our second source of revenue. So every dairy farmer you ever met, their number two source of revenue is what they sell their cattle for. And that market's plummeted. In some cases, there's not a market. You can't sell it because the beef industry is going through so much chaos. And then the final economic insult is, and I think Grant said it best, is producers are being put on a quota. So produce less milk. You're not going to get paid for over 80% or over 90% of what you produced in March. Okay, well, if I'm producing beer or almost any other manufactured product, it's bad news, but I can turn off the machine and I can turn off the lights at the end of the day if we're a little bit short on demand. And as Grant said, dairy farmers can't do that. We have a moral obligation to take care of our animals. And the way we take care of our animals is we feed them and we milk them and we nurture them, and that all takes money. So dairy farmers have to pay and pay and pay and milk their animals and care for them. Unfortunately, recently, because of the market dysfunction that's occurred, we have to pay to dispose of that milk that we just made. And it's truly heartbreaking. It's a perfect storm for the U.S. dairy industry and for the Wisconsin dairy industry. So the plan forward, I think it's critical that we do get started, and I listened intently for hours this afternoon about how to do that. It appears that most players in the dairy industry or in the industry want a slow start and a careful start, and I support that. I absolutely do. But I want to caution our leaders in government, and that is to be careful not to micromanage too much. There are industry organizations that have stepped up, WMC and many, many others, to implement best practices amongst their members. And there are business leaders and owners that are committed to best practices, and let them decide what the correct size is and the correct volume is through their business. I am a healthy, somewhat risk-adverse or risk-preferring person, and I may view risk differently than my mother, who's 82 years old. And so if I go to a restaurant and the parking lot's full, I'm not going in. I choose not to be elbow to elbow with other people right now. But if I go to a coffee shop and it's not packed full, I would choose to go in and grab a coffee, and I should be able to do that. Now, my mother, who's 80, perhaps she should stay home and she should continue to shelter in place. There's a lot of talk about we have to do it safely, and I don't hang up on me, but absolute safety is a myth. And we're going to live with this for at least 18 months. That's the minimum time it takes to get a vaccine. And so what we have to do is figure out how to proceed with our lives and our economic livelihoods and the food on everybody's table with reasonable measures, so that those of us who aren't high risk can carry on and provide food and shelter and restaurants and bars for our communities. That I thank you for your time.
Thank you, Jim. Appreciate you waiting around. Please stay on the line in case we have any questions for you. And I had to skip over Kim Kroll, the co-owner of Gadke Rolling Hills Dairy Farm in Luxembourg. Kim, are you with us?
I am.
Welcome. Sorry I skipped over you. I thought Jim had some other scheduling conflicts, but in any event, glad you could make it. Glad you're with us, and you have the floor.
Thank you. Thank you, Chairman and Committee, for taking the time to listen to my story. My name is Kim Kroll, and I'm co-owner of Gadke Rolling Hills Dairy Farm in Kewaunee County with my parents, brothers, and sister-in-laws. We are a fifth-generation farm. Our farm started out in 1885 with a few cows, chickens, pigs, and horses. Over the years, we have grown with our 4 families now operating a 1,700 cow dairy farm, along with our 25 full-time employees and 2 part-time employees that we consider family. We are now concerned about the future of our family farm and the future of the next generation that will be coming aboard. When the pandemic of the coronavirus hit our county, which was the plunging of milk prices, the shutting of most businesses and schools, our family was at the start on a process of how we were going to keep our family farm alive. We started to see our milk checks come in short of over $150,000 or on a pay period. With the huge deduction in our checks, it put a discussion between our family on what bills we would be paying, what needs we would be cutting, what essentials would be first, and which one would be put on hold. Our farm operates with around 100 business suppliers and landowners locally. We purchase from local businesses and donate to local organizations. Many of these have been affected by these changes that we have had to make. Our family farm alone donates to over 25 organizations and events, such as local schools, activities, Special Olympics, local churches, and several local nonprofit organizations, such as Domestic Violence, Hunger. Some of these events that will not take place this year in Kewaunee County are the local fair in July, June Dairy Kickoff Breakfast, Breakfast on the Farm hosted by local family farmer, and also many local charity events. All of these are supported very heavily by dairy farmers. Our county, as of April 1st, has 125 dairy farms. Our county is number 6 in the dairy industry in our state. 96% of our farms are owned by families. Agriculture in Kewaunee County has a $669 million impact. Farmers in Kewaunee pay $13.2 million in sales, property, and income tax. Dairy farmers produce $222 million in revenue from milk and $37 million in revenue from cattle and calves. 28% of our workforce is in agriculture, and some of our largest employers are dairy farms in our county. But as of this year, our county has lost 6% of our dairy farms already. Dairy farm is an essential business in Kewaunee County. It is one of the main industries that brings brings much money to our county. When farming hurts, local businesses hurt, food pantries hurt, local organizations, and events. This shutdown of businesses has been a huge impact in the dairy industry and in our county. We all know with the businesses and schools shut down, our dairy products are not moving. The price we are getting for our product that we supply is going down, and we begin to struggle as a farm business, and in the end, our county starts to see the huge effect. Knowing that milk is being dumped at local farms, and possibly we could be next, put a great fear in our family. Having no income at all would destroy our farm. Keeping our family farm alive for the next generation is something very important to us. This business supplies the land and the housing that our families live, the wages for our employees to live, and the dairy products and meat supply for our state and our country. Grocery stores were running out of dairy products. Restaurants and bars and grills were only doing takeouts. and our local meat factories were struggling to stay up and running. Our food supply chain is struggling. We are around the clock, 7 days a week, running our businesses, taking safe, precautionary steps needed to protect our employees and our business. While the rest of our state is closed, waiting for the governor and the health secretary to come up with a workable plan on how to reopen our state, our people, our businesses, and our country suffers. We need leadership from our government to help us get our state open. We need you to listen to businesses, owners, and work with us instead of dictating us. Our county is a long chain of businesses all linked together, supporting each other in our county and linked to other counties supporting them. These links on a chain are being stretched and are starting to fall off. We need to keep our economy alive. I am a county board supervisor for District 13 in my county. A few weeks ago, along with Supervisor Aaron Augustine, District 11, a dairy farmer, we put together a resolution asking Governor Evers on May 12th to start the process of opening up our state. We presented this to our County Board of Supervisors on Tuesday, May 28th for a vote. It was passed, 17 yeses, 3 noes. 29 comments were written from the local businesses supporting this resolution. Our county is ready to get back to work, and we are not alone, with other counties reaching out to us, planning to do the same, and having the back to business plan is a logical option. Farmers have struggled with depressed milk prices over the past 5 years. Financial challenges, Mother Nature challenges, and trade wars have all impacted the dairy industry also. We were starting to see an incline in our future dairy, and the fear of our state not opening soon and our businesses in a huge financial deficit makes me wonder who will survive this. What will our food chain look like in 6 months, and how many farmers will be left in Kewaunee County or through our state? What will the future be of the next generation? So we are asking for you to support the WMC Back to Business Plan. We cannot live like this. We can protect people and livelihoods at the same time. Thank you.
Well, thank you, Kim. Thank you for the passionate dialogue. I'm going to ask you to stay on the line and switch to members for questions. And I will start with Representative Schra.
Thank you, Chairman Swearingen. And Kim, you bring up a great point about the dairy breakfasts being canceled. I know I just got a call. Winnebago County. I represent Winnebago and Fond du Lac County. I'm not sure if Fond du Lac's made that decision. I'm guessing they probably will. Winnebago County, I think last year had 5,000 or 6,000 people on a Saturday show up. It's their major fundraiser for a lot of good things. So I'm glad you brought that up. Jim, just wanted to shout out to you and your partners. Rosendale Dairy obviously is in my district. Jim and his partners, I believe at that location, have over 8,000 cows that they milk. And that's just at that location. And Jim, you talked about, I know I've talked to other smaller farmers that are being told that they have to dump 10 to 20% of what they're producing every day because their processors are asking them to do that. And you brought up an interesting point, and I'm just wondering if you could elaborate on that a little bit. I'm just wondering how many gallons that equates to, just so we can put this in perspective. And then if you could just elaborate on that cost, because I think a lot of people just think that you just dump it in the field.
Yeah, I'd be happy to. So disposal of milk in the United States has been a massive problem since food service and restaurants got closed. And we personally at one of our farms dispose of 13 semi-loads. We believe, at least for now, that we'll be compensated for it. But I think really the greater problem for the dairy industry in Wisconsin is if we cut back on production, which we're doing, our costs go up. And our cost goes up roughly by what we cut back because we have all the fixed costs involved with dairy farming. We bought all the feed, it's all sitting there. And we're taking care of the cows. And so our costs go up at a time where our revenue is imploded, as I've discussed. So that's the true cost. It's just, we've seen tough times, but we've never seen this before.
Are they DNR requirements? As I said, I think some people think you just have to dump it in a field. Can you just go through that process a little bit?
Yeah, we dispose of it in DNR approved manure lagoons, and it's commingled with manure, and then we'll pay to pump it out in the fall as nutrients because it has fertility value, but it's a very little relative to the loss. And so it's environmentally, it's handled perfectly sound. It's just a terrible economic tragedy.
Thanks, Jim.
Representative Talkin, we hear you. You want to unpause your video, and hopefully we can get you to chime in. You have the floor whenever you click on.
Can you hear me?
We can hear you. We can't see you. That might be a good thing.
Okay, can you see me now?
Not yet, Gary.
Well, I can see myself, so I don't know what else to do here. But here's the question.
Yeah, go ahead, Gary. That's fine.
All three of the speakers did a great job of explaining what's going on in the industry and the challenges we have right now. And I would just like them to talk about the length of time they feel like their businesses can survive. I know they're all larger businesses, but and then comment on the infrastructure and the impact it's going to have on the infrastructure that, we know that the schools were closed, that the restaurants were closed, and some people are having to cut their milk production, and so those are the two questions I have. So.
Okay, we'll start with Grant.
Sure. So as we look at this within our business, we're relying on equity.
Grant, before you start, can you unpause your video, please?
Oh, I'm sorry. There we go.
Perfect.
As we continue forward here, we're relying on equity to continue to operate, but it does question the fact of, how long can you, hold on. We do careful planning. We manage our businesses as best as we can in order to survive things. But, as everyone has commented here today, is with Kim and Jim is that this is something that we haven't experienced, and we're already coming off of 4 to 5 years of some challenging times, and to be hit like this. So I think it's, we're trying to poise ourselves to be here for the long haul, but again, it's what we've been talking about all day. How long is it going to be before we can get businesses back going here in Wisconsin, especially the restaurants and food service, to start utilizing our products that we're very good at producing? And so, my wife is on the fair board here in Fond du Lac County, and, they're having discussions about, are they going to have the county fair? My kids have 4-H projects, and so, we're full steam ahead and anticipating we can get there. But we've got to come together as a state and get it going.
Thanks, Grant. Kim, you got anything to add there?
Are you there?
Yep. Go ahead.
I don't know how much longer. We have dug into what we can, and we're hanging on. But what we're digging into is our future for our kids. We have 9 kids that are in our family to step up to the next generation. And it's been 5 years. Do I want to say hell? Kinda. And now we hit this, and if we do not open up our businesses, we are not going to make it. We're not going to make it as a farmer, and we're not going to make it as a county, because in our county, we have 125 dairy farms. That's a huge support to our county. And we're not doing anything. We need to come to a table, and we need to discuss a plan. And if we as dairy farmers can stay open and do the safety precautions that we are doing, we need to all work together as a team to do so. Or, I don't know, we might not see dairy farmers anymore, especially these family farm dairy farms that have been with us for 5, 6, maybe 7 generations.
Jim?
Yeah, I'd like to address a little bit more about the industry, and the way I see this is in our industry.
Jim, you got to unpause your video.
Sorry.
Okay.
The way I see the industry is it's really fragmented into a couple pieces. Those that have a high cost of production are very, very vulnerable. Those that have let's just say, a lack of contracting and hedging and buying inputs at a low enough price, they're extremely vulnerable. And those that have a weak relationship with their lenders are going to fail first. And I expect if the May price carries for the rest of the year, that 10 to 20 to 25% of the Wisconsin dairy industry will be out of this industry. It's a very sad state of affairs.
Representative Talkin, do you have a follow-up?
No, that pretty much covered it. Thank you.
Okay. I can tell you from somebody who's on the dairy, these numbers are scary, staggering stuff. Are there any other questions from the committee for the dairy farmers? Seeing none, Grant, Kim, and Jim, I want to thank you very much for hanging with us till your time was up here. I really apologize. We were running a couple hours late, but I really appreciate your passion and your perspective from what is going on in the dairy industry here in the state of Wisconsin. And we hope that things can get back to whatever the new normal will be sometime soon. With that, you guys, thanks again, and you can feel free to disconnect. Yeah, go ahead. Turn your mic on, Dan.
I want to thank the committee members for being here today, and whether they're virtual or in person, because I think it's important to show to the residents and the business people of Wisconsin that we are putting in our time and our hours to be here, to be their voice. I just want to address a couple things that I couldn't get in on a couple folks. But on UI, when we talked to we heard a couple things about UI, and these smallest of businesses, the mom and pop businesses, they don't even have an opportunity to collect UI, any. So not only are their workers are able to at least collect UI, but these mom and pops are really the only employees of their own business, but they aren't eligible for UI. So there's a new federal PUA that has come out, but already these people are starving, and I don't know if that or when it's going to kick in. So I have concerns. I know that these members on this committee are concerned. A tavern restaurant doesn't go to a Republican community or a Democrat community. It goes to where they think they can be viable and do business. And we all share that, exactly the same. And, we're frustrated here because I don't believe any of us have been able to engage the governor. And I mean, I'm asking the Democrat members here now if you've been able to engage the governor. I've handed in proposals and letters, some that have been brought up here. I'm curious to see if the other members of this committee have even been able to engage the governor. And you know, a statement though that I have to address from the governor is when he says that the Republicans don't care about the woes that at the time was 4,000 some people that are affected by C-19. And you know, that's just petty and disingenuous. All of us here care about all the people of our communities. So that's what we address. But yet we've picked winners and losers. The essentials versus the non-essentials. We're telling people you can't go back to work till it's safe, but yet all of those of you that are working, well, I guess it's safe enough for them. Who working at the grocery stores, the truckers, at the big box stores. I guess it's safe enough for them. That's exactly what we've said. But for the rest, we're trying to protect these other folks that are non-essential or whatever it is. It just makes no sense. So when it's going to be safe to go back to work, there's no answer for that. There's no medical person. We can get one medical results here, another medical opinion over here, and we can always get them to contradict each other. You know, we could manipulate numbers. So I just asked this committee, I'm thrilled that we're at least able to get together and that we're all here. Let's start the negotiating here. If none of us can get in and negotiate with the governor, maybe we can do it here. On the committee level, there was a number of things we could all agree on right now. Might be in the proposed plan so far, might not. But boy, as legislators, add us all up, we represent as many people as the governor does, because that's all the people of the state of Wisconsin. And we've got to engage in some fashion here. Yeah, I know you all care about your communities, but your communities are dying as well. If we're going to use the word dying with C-19, we're going to use it with your communities. Because without these businesses being open, without the economic activity, your communities are going to be dying. And they already are. So my question will follow when we get the next presenter, but I will even have a question following that perhaps rant.
So I just want to be respectful of people that are going to be Skyping in. We're roughly 3 hours behind here, but it is what it is. Trish Pugel from the Hotel and Lodging Association, are you with us?
I am.
Hi, Trish. How are you?
I am just fine. Thank
You
you,
got to
Mr. Chairman.
unpause your video, and we'll be able to see you.
It was unpaused. Should be good to go. Looks like it is. I'll close it and open it.
Okay.
There we go.
Got it, Joe?
Okay, Mr. Chairman and committee members.
There you are.
Can you hear me?
Yeah, there you are.
Okay.
Okay, go ahead, Trish. Thanks for joining us.
Okay, well, thank you for the opportunity, Mr. Chairman and committee members, to speak with you this afternoon on behalf of over 600 lodging properties around the state of all sizes and shapes, along with our chairman of the board, Greg Stillman, who will be speaking next shortly on the status of the lodging industry at this time. As a dramatic development of the COVID-19 pandemic began in late February and into early March, the lodging industry immediately felt a devastating impact on their businesses as one of the first industries to face a fast downslide that worsened as time went on. When Emergency Order 12 on Safer at Home was issued on March 24th, hotels and motels were declared essential businesses with a number of restrictions imposed. However, the fact remained that about 90% of our customers were eliminated as customers. The fast and long-lasting losses faced by the lodging industry fueled a need for significant financial assistance or relief from the government at all levels, and also the need to get back to business as soon as reasonable blend of safety improvements and business actions providing increased protections could occur. When the Wisconsin Hotel and Lodging Association was invited to participate in a new proposed plan that tapped the expertise of the healthcare industry, state agencies, and the business community, we were quite impressed by the data, thought, and foresight that went into it. This plan has the potential to bring everyone together to find a reasonable solution. Our organization moved forward with assembling a top quality task force representing small and large lodging properties covering hotels, motels, resorts, and inns, and using the concepts of the proposed plan, spent numerous hours with interactive discussions on the many facets of our industry. We also drew in input from a casino hotel and a bed and breakfast to comply with the NAICS grouping for lodging. Our approach was to identify commonalities as well as differences in addressing the mitigation of risk for lodging properties that could be rated from significant risk down to moderate risk, down to minimal risk, to enable businesses to begin to reach a reasonable level of the new normal. Categories for mitigation for our industry began with social distancing and then ranged to cleaning, to employee safety, to health checks, to group gatherings, to food and beverage, and each one with protection practices each step of the way. Between general protection practices and some practices that are specific to an industry, the guidance in the generated report to individual businesses can serve as a phasing in that is based on data and input provided by knowledgeable sources. We respectfully ask that this committee consider supporting the implementation of the Back to Business Plan, which was not developed in a vacuum, but instead wisely reached well beyond any single organization's membership to ensure a broad wealth of input. It is critical to Wisconsin's lodging industry that a well-thought plan tapping the expertise of multiple industries is moved forward in a manner that protects customers, employees, and the public, while avoiding the potential for businesses to lose their ability to employ their valued staff and to stay in business. Thank you.
Thanks, Trish. Appreciate your input. We'll move now to Greg Stillman, who is the president of Foremost Management Services located in Fish Creek, and he is the chairman of the board of the Wisconsin Hotel and Lodging Association. Greg, are you with us?
I sure am.
Well, welcome. Thanks for sticking around. And this is the Committee on State Affairs here in the Assembly in the State Capitol. Welcome.
Thank you, Mr. Chairman, committee members. Appreciate you taking the time. I hope it's been a long day for you. And I certainly would prefer to be there in my hometown of Madison, staying with my parents, but it is what it is. We are here pulling through it. So I am, my wife and I own Foremost Management Services. It's a property management company that oversees 3 condominium hotels that are smaller properties. One is 26 units, one is 38 units, and one is 57 units. And we also own and operate a small hotel in Fish Creek with 59 rooms. These are all located in Door County. I'm also the current chairman, as the chairman mentioned, of the board of directors of the Lodging Association, which is a good slice of people from all around the state of properties of all size. I've been in the Door County area doing this for 29 years. So reiterating what Tricia said, the lodging industry was certainly the first one and the fastest affected immediately. I know personally your life's work comes to a screeching halt in pretty much about a 48-hour time frame. So that's difficult to swallow. We also, one of the first things that was affected is group business, obviously, with conferences and conventions. Weddings immediately were needed to cancel, followed quickly by leisure travel and business travel. I know we have 2 properties that are seasonal and 2 properties that are open year-round. The year-round properties on the week of March 13th and 14th were quite busy, so we were kind of putting some safeguards in on our own to try to come up with some things to keep people safe. But while the hotels around the state here are certainly designated as essential business, currently 40 to 45% of lodging properties in Wisconsin are closed, and the remaining have very low occupancies of 7 to 19%, which makes covering payroll and bills next to impossible. The minimal gifts that we do have in some of our facilities are, for the most part, healthcare related people, first responders, limited government travelers, and other essential businesses with construction projects, shipbuilding, that type of thing. 43% of the lodging properties have had to lay off 75 to 100% of employees at all levels. 20% have not had to lay off any staff. However, many of those are seasonal properties that normally start at this time of the year or are hiring staff for summer businesses. So, while our businesses is delivering renowned hospitality to travelers to Wisconsin and beyond, our first focus is always providing a safe, secure environment, for the employees and for the people that are traveling to our businesses. The Back to Business plan blends identifying risk areas with mitigation processes to help enable a reasonable way to begin to engage the tourism economy and the hotel economy, so our employees can get back to work, our businesses can start to generate revenue again, and then obviously that brings the tax revenues back to the government, and then the customers that we do get can acclimate themselves to new safer practices and protocols that we're seeing already. So we ask you to consider implementing the Back to Business plan to rebuild the state economy in a data-driven method with the input from healthcare industry working along with the business community. So I thank you for your time.
Greg, thank you for taking the time to give us your perspective. A couple of questions. Can you paint me a picture of and I'm talking specifically of just your hotel, your 59-room hotel. Kind of walk me through where you were prior to March 24th or 17th, wherever it impacted you. And then how are, fishing season being this weekend, would that be considered, kind of an uptick for you? And then obviously heading towards Memorial Day, what are your occupancy, what are you looking at?
That is a property, our personal property is one that is seasonal that we would be opening tomorrow. We are not. We are going to be opening on the 26th. The two properties that one is located in Egg Harbor and one is located in Sturgeon Bay, both are year-round. One has been open for 23 years. One has been open for 24 years. They have never closed other than overnight, but we have been open every day since that time and had to close, on the 19th. 19th or 20th, depending on the property. So we were looking at a very robust first quarter record. We had a record January, February, and March was looking the same way. So I think one of the things that immediately affected us, we had to actually call and ask people not to come. So there was people that had business, they wanted to come. People were very understanding. So I think just because there's so much uncertainty, they were appreciative of that. But we also have seen a great drop-off, especially in the last 3 weeks, of getting money to get cash flow for the upcoming season. So we are looking at some huge negatives. We do week-to-week numbers, so we're seeing huge negatives in what we typically get in sales and what we typically get in advance deposits. So we have seen that come to a trickle. People still want to travel, but there's still much uncertainty. So even with getting back to at least hosting some visitors, and I think this has been said by most of the speakers today in all industries, it's going to be not what we're used to and slow, but I think the business Back to Business plan is certainly a step in the right direction there. So
realizing that you'll never get back the money you've just lost, do you think there's a chance that if the state could kind of turn the dial up and you guys could get back into, 25, 50, 75% of occupancy, would you be able to salvage some of 2020 if we get going?
Absolutely. So what we've had to do is become very flexible, and in the places that we work for 3 different board of directors, and those are people from all over Wisconsin and beyond. We're trying to mitigate and minimize expenses and adjusting, what splits that we give back to the owners and what we keep, and then adjusting. We took our projected approved goals for the year at all the places and knocked that back down to 60% of what we thought it was going to be, which is still somewhat of a guess, but at least you're not waiting and spending money that you don't have before you have it. So things like that. I think the businesses that will be here after we're on the other side of this have to do things like that.
Okay, thank you. Representative Sinicki.
Chair, thank you for your comments and your testimony. Being from Milwaukee, of course, I got a question about the DNC, which, as we all know, is originally scheduled for July. Now it looks like it's going to be into August. So how is the industry handling those changes? And are you going to be, if we reopen everything, will you be able to fill those rooms for the days in July that were set aside?
I'm guessing that's for Trish.
I don't know who it's for.
Greg, you want to take that, or Trish?
I can speak, operationally, and just talking to my colleagues around the state. Anything we do from this point forward, I think the time period that is open in July, especially in Milwaukee with some of the other large functions that have been delayed or canceled, Summerfest, specifically, obviously has a huge impact. And one of the things that I know the Milwaukee hotels were very much looking forward to is not only the usual things, but the DNC. So the rooms that were empty in July, some of them will be filled, but certainly not to the level that we would have with a national convention with 60,000 people coming into the area. So protocols on any hotel, and this is not only in the state of Wisconsin, but countrywide, we've always had to have cleanliness and sanitation at the first and foremost of everything we do. But this just brings it to a different level and making sure that we're following a lot of protocols that are out there on a national level that are helping to protect, probably first and foremost, the employees. I mean, we have to get them back and make them feel comfortable, but then equally as important is the guests coming in. And obviously there's going to be a certain sector that's waiting for the cue of the governor and the government to tell them that it's okay to at least maybe not get back to normal, but at least you can get beyond your immediate surroundings and travel safely to other areas. So hopefully that answers your question.
That's good. Thank you.
Yeah. Representative Kuglitch.
Thank you, Chairman. And this could be for either Trish or Greg. It seems like everybody that we've listened to today is basically waiting or counting on the economy to open up in the state of Wisconsin, or else they see devastating results. How long can your industry hang on if the rest of the state doesn't open up?
I mean, I can speak specifically to our area, and Door County is a seasonal destination. We start kind of opening back up. 85% of our revenue comes in between May 1st and November 1st. So, and even within that, May, we'd all be cautiously opening up to make sure that we're doing it safely and get to our peak time frame, which is July and August, and then our fall is obviously good. Understanding it's not going to be like it has been, but we can't. We understand we can't rush it and then possibly forego those peak summers, even at a much expected decrease. We certainly need to have those key months. And I don't know, it depends on what you have for mortgages and how, the relationship with lenders. A lot of these are especially in the Northwoods and we have all independent properties in Door County, and that's similar around the Northwoods of the state. You are making all your money coming up here in the next 4 months. So it's essential that we get some money.
Okay. Any other questions from the committee for the folks from the Lodging Association? Seeing none. Trish, are you still there? There she is.
Yes, I am.
Good. Okay. Well, I just want to thank. I got one weird one for you, and it happened in my district. I had a phone call from a restaurant, not necessarily a supper club. I think it might have been a diner situation, that was somewhat jealous of the hotel down the road because they were, deemed essential, and the restaurant, of course, was closed. And so there was a little bit of animosity between the two businesses. And the frustration, of course, was that, we're attracting people up here up to the Northwoods or into our state for fishing and turkey hunting, and yet the restaurant was closed, and they felt slighted that the hotel had an advantage over them to be able to still attract customers. And I could feel the frustration from the restaurant owner. I'm just curious if you have any thoughts on that.
Well, I think it is an interesting dynamic because we may be open, and even if we are, there's only about almost half are closed. But the ones that are open are getting very little business, and the revenue just isn't there to keep them afloat. So as far as the others, they are able to be open for carry out food and things like that, which obviously, as was spoken before, is not enough to hold them over either. So I think we're all hurting at the same time, and I don't know if that answers your question or not.
Yeah, I don't know if there is actually an answer for it. It was just an interesting thing that happened to me, and I didn't necessarily have the answer either. But with that, no other questions for you or Greg. Oh, I'm sorry, Representative Stubbs, go ahead.
Thank you, Mr. Chairman. My question is specifically regarding the homeless populations that are utilizing many of the hotels. What percentage of your hotels are being used by the homeless population? And then if you can tell me what amount of those hotels have contracts with counties?
I can answer that. We did a survey recently, and we only have about 5% that are doing contract business. And that could be, it's a mix of homeless, but also first responders. We've had a couple of different requests on that way, and they are special contracts because they may not need the same type of services, et cetera. So there are not a lot that have been requested, but I do know that it's contracted usually through a state agency or a government agency of some sort.
My follow-up question, thank you so much for answering that, is I know in Dane County there's room tax and there's a committee. Do we know, and I don't know if Ledge Council would have to chime in on this, but do we know if there's going to be some subsidies to assist in that area with the room tax?
Trish, do you have the answer, or should we go to Anna?
I thought you were waiting for Ledge Council.
Oh, you can answer, Trish. That's perfect.
It would be nice to have assistance on the room tax revenue that's not coming in. Obviously, we all benefit when tourism is promoted, and room tax is primarily supposed to go to tourism promotion and tourism development. So that would obviously be very welcomed by our industry.
Anna, you want to weigh in real quick?
I can provide some, can you see me? Okay.
Yep.
I can provide some follow-up on that. I think I have a colleague who might be doing a little looking into that issue, but I don't have a lot to add on the room tax issue.
Okay, fair enough, yeah. All right, with that, we will, Trish, really good to see you again. Does this mean you're coming out of retirement?
This means I'm assisting at the time.
All right, and Greg, thank you very much for taking the time to join us tonight, and best of luck to your association and business up in Fish Creek especially. Hope you can salvage the rest of the summer.
Thank you for taking the time to listen to us.
You bet, and you folks can feel free to disconnect.
Okay.
Thank you.
Next, we'll move to the phone, and I'm looking for Donna Fowler. She's the owner of New Creation Salon in Lodi. Are you with us on the phone, Donna?
Yes, I am.
Oh, fantastic. Welcome.
Thank you.
Well, you have the floor, so Yeah, if you have the floor, so whenever you feel comfortable, go ahead.
Okay. I feel honored because I feel like I'm representing, the salons in the state of Wisconsin. So I just want to address too that, the Wisconsin Department of Safety and Professional Services, as cosmetologists, we have had, protocol for making sure that everything is sanitary for our customers. So this is even, making us more aware and including continuing education on this kind of stuff. And I did want to say too, so my story, and I'm in Lodi, Wisconsin, New Creation Salon, is on that Friday, March 20th, is when I learned that we had to shut down by 5 o'clock that Friday, and I found out a little bit after 3. So immediately I went and found out through some other professionals in the salon business down in Madison. It's a Brava specialist that we could go with the Wisconsin Unemployment. So then I applied for that right away. I also applied for the PPP, the Paycheck Protection Program, and I haven't received anything from either one of them. And then I applied for the SBA, Small Business Assistance, and I did finally, I think last week, receive like a week's pay. So I was thankful for that. And then just recently, I applied for the PUA, the Pandemic Unemployment Assistance. And so what they're saying with that, so it's like it's like the unemployment, because with the regular unemployment, I didn't qualify for that. So with the PUA, I am still waiting to hear something on that.
So, how was your experience
Hello?
with? Yep, you still there?
Yes.
Okay. So, how was your experience then with DWD and on unemployment then, Donna?
I haven't heard anything yet.
Okay. Okay. And you are a one-person shop. You're the owner and the janitor and everything.
That's correct. That's right. Yeah. So for me, yeah, it's just me and the client. Probably 98% of the time, it's just me and the person in my chair.
Okay. And just to be clear, then you have not had a dime of income since March 20th. Is that correct?
Right. Yeah. When I had to close my doors on that Friday, March 20th. That's right. Except for a little bit that I received from the Small Business Assistance.
Okay.
But that didn't go very far.
Okay. Representative Sinicki.
Thank you, Mr. Chair. Just a quick question. Are you representing yourself or are you with a group? Because I don't see anything on the hearing notice.
She is representing just like small business.
Yeah, we're a small business. Yep.
Okay, so she's speaking on behalf of other small businesses. I'm just trying to figure it out.
Yeah, kind of.
See her on the hearing notice. Yeah. Thank you. But we can't invite you.
Yeah,
Any?
Just asked me to give share my story. Which
Yeah.
I appreciate that really. But I did want to, say that, we've gone through like the bacteriology, sterilization, and sanitation courses. So, as a salon and salon owner, I would really like to see us being open sooner than later.
Right. And you're licensed by the state of Wisconsin, correct?
That's correct. Mm-hmm.
Okay. And is your license, Donna, is that an annual inspection or an annual registration?
Well, you get our license renewal every 2 years.
2 years, okay.
Mm-hmm. Yeah.
Any other questions from the committee for Donna? Seeing none, Donna, thank you very much for calling, and we appreciate your input.
I just wanted to let you know something that I've been doing here for 30 some years, and years ago when I worked at Penny's, addressing the essential business. So one of my older ladies years ago at Penny's when I was doing her hair, she shared with me about the women in World War II, that women with their hair, that was more important for these women to have their hair done than to eat. So the money that they made, they would go and get their hair done, and they just wouldn't eat. So I thought that was kind of interesting as we're talking about, the essentials. So, but that's all I have to say. Thank you so much for listening to me today.
All right, Donna, thanks very much for calling in. We appreciate it.
You betcha.
Have a good night.
You too.
Next, we're going to move to another Skype from former Representative and Dr. Eric Severson. Eric, are you with us?
I'm here. Can you hear me?
Yeah, there he is. How you doing?
Well, how are you?
Good. Welcome back to the Capitol.
Thanks.
So you're going to give us a little perspective from rural healthcare?
Yeah, so I can talk for our hospital and essentially what's happened over the last 8 weeks since the shutdown happened. We were told that there was going to be a large surge, and what has happened for our hospital is the amount of revenue that we have, the amount of patients we're seeing is down at about 52%. And that's from this past week. It's been we've gone as low as only about 40%. Our clinic visits in our clinic have way down, but we've been tracking those up now as we see an increase in telehealth visits. But we're still down, probably 20% on those. So we have a lot of issues as far as just decreased patients and decreased revenue. And a large part of that has to do with people under the impression that we're going to be overwhelmed with coronavirus patients. Part of it has to do with people being afraid of coronavirus. Honestly, part of it's just that the whole community's locked down and people aren't out and about. As things go forward, we're looking at trying to increase our testing. We're going to need more materials. That's the biggest problem. We don't have the materials to do more testing quicker. We can't test for the antibodies at all right now at our hospital. We're looking at the community outlook. How comfortable are they coming to the hospital as people are afraid? And, they're looking at, is this what we call a dirty facility? Essentially, does it have coronavirus versus keeping a clean environment in areas like surgery so that people can come in, be intubated, have a surgery, and have no fear of picking up coronavirus. And then looking really into the future in June and July, we face the bigger problem of, because people are getting ill because they're not coming in for their routine care, they're staying at home, and now they're losing their jobs, and they either don't have insurance or they don't have money or a way to pay for the care that they need. This becomes a problem for not only for the patients, it becomes a problem for the hospitals, which becomes a long-term problem of, are we going to be open for the communities? So I know you guys have been at this all day. It's 6 hours now, so try to go real quick through that. If you have any questions, feel free to ask.
Yeah, sorry, Eric, I know there's been some conversation with other hospitals about them like moving back to more elective surgery. Is that part of the discussion by you?
Oh, yeah, boy. I mean, that's where a lot of that, we're seeing, we're only at 52%. So much of that is because we're not doing elective surgeries. There's some emergency surgery going on, but so much revenue loss is due to the cancellation of the elective surgeries. In the county that I'm in, there's been 4 cases of coronavirus. At the hospital I work at, there's been 0. The feeling is, boy, it would be really nice if we could get some of these elective surgeries going. I know our orthopedic surgeon, he said last week, he's got 8 or 9 surgeries ready to go. People are waiting. They're asking for them, wondering when they can get them in. And right now, everything is on hold. The long-term problem for that, this is the people's knees or hips that they need redone for those orthopedic surgeries. the long-term health of a whole facility, whether that's the facility we're at or, it's somewhere else in the state, is if the facility can't stay open, then you're looking at the health of the whole community. And we were able to get a PPP loan, as we are a small rural center, but I know there's another hospital in the county I live in. They weren't able to get that, and so they're going to have much more bigger difficulties, financially as time goes on.
And have
If
you?
they can't open up and start doing elective surgery to bring in some revenue to really kind of keep their whole community alive.
Are you like shutting down wings of the hospital or floors of the hospital?
Oh yeah, for sure. I mean, when you're looking at the hospital, and our inpatient census has gone from somewhere from 50% to 11% over the last 8 weeks from where we were beforehand. Yeah, there's just parts that are just shut off. An emergency has 1 week has gone up to being equal to where we were at, and boy, we thought everything's going back to normal. People are reverting to normal patterns, but it's reverted back down to 50%, and overall we're kind of hanging around 60 to 65% of our pre-coronavirus volumes. But a large part of that is because we've been able to ramp back up, or try to, using telehealth visits. The biggest thing for us would be getting a way to have the elective surgeries open again.
Okay.
As soon as possible, especially in a county that's only had 4 cases.
Right. And is your hospital in Osseo, Eric, or right in that area?
It's Osceola, not Osceola.
Osceola, I'm sorry. Yeah, okay.
Even farther west than Osceola.
Okay. Representative Jagler.
Thank you very much, Mr. Chair. Hello, Doc.
Hey, how are you doing?
Good. I know you're jealous of my tremendous flow I got going on right now, but we've been hearing some anecdotal evidence of I know you're used to you're in the emergency room setting, of people actually not even coming to the emergency room because they're scared that you might not be open, or that are you hearing any of that up there? I know that, like I said, some of our hospitals have actually issued a plea to us to go out to social media and say, hey, if you need emergency services, please come. We are open.
Yeah, I know that would be great. People should send those messages out. I've talked to many people in the community, and especially when this first all came out, they said, "Oh, you must be overwhelmed at the hospital." I'm like, "Oh no, it's actually just the opposite." But I have never had any patients come in to tell me that, "Oh, they didn't come in." But I have colleagues who have told me they have had patients that have said, "Oh, I wasn't coming in. I'm not going to come in. I'm not going to come in." And then things just got so bad that they came in, and then they get there and the ER's got 1 or 0 patients in it, and and they're thinking, "Oh, I should have come in earlier." And you hit it on the head. That's anecdotal evidence, and that's obviously hard to trace. Those are stories that are heard. Those aren't things that you can really say, "Well, this is hard evidence." But what we can look at is to say, the amount of people coming in is 50 to 60% of what was going on before. It's not like people are staying home. Don't get me wrong, people are staying home, so they're probably less likely to get injured. But at the same time, you're not going to see that for 8 weeks of staying at 50 or 60%. There's people that are just refusing to come in. And that's where now we're starting to see people come in who have some chronic health conditions that are worse. And you kind of think, well, how long has this been going on? And they say, oh, it's been 2 weeks. And you think, boy, they should have been here 2 weeks ago. And they've been holding out at home.
Thanks, Doc. Stay healthy.
Okay, thanks.
Representative Kuglich.
Hey, Doc. Good to see you.
Yeah, good to see you too, man.
Hey, so we've been hearing all day that, or what we've kind of said is one size fits all isn't the answer. We need to do this regional. But there's been pushback saying that if we open it up regionally, that rural hospitals aren't equipped as people travel the state. And a matter of fact, I think the WEDC secretary said that in her local hospital, they didn't even have a ventilator. So is that a true statement, or are the rural hospitals, they have capacity in case
Well,
they had.
We have 4 ventilators. We have been trying to prepare for reopening since we were closed down. So we have a fantastic CEO who's been kind of on top of this the entire time, and he's been really trying to strive to be ready when we're ready to be open, to be ready to go right away. So I would say that the only thing that we're limiting it on is the tests, the testing materials to test for coronavirus or to test for the antibody. That's our biggest limiting factor. We actually are reserving some of those ones that we have, the quick tests, for the surgical patients, so that we can say they don't have it, and we can get them into the OR when they need to have surgery. So now there might be some rural hospitals that aren't as prepared as them. I can't speak for every rural hospital. Obviously, I think it's a third of the hospitals in the state, might even be more. So I can't speak for all of them. Can say for ours, if we were given a regional score that allowed us to open, we'd be able to be open by next week.
All right, thanks, Doc. Take care.
And I think we'd be able to do it in a way that the community would be comfortable, and to take all the necessary testing and the necessary requirements to make sure that the patients are safe, including placing patients in the hospital in different areas of the hospital based on their age, so that they are able to stay safe from other people who might asymptomatically be carrying the virus.
Representative Onstead.
Well, thank you, Mr. Chair, and also thank you for your testimony today. I'm a little bit confused. I was on a call last week with WHA, and they said, one of the best things that we could do for them is to, let people know that they're open for business in terms of elective surgeries. So I guess I'm not sure why they aren't doing them there, because I know that other hospitals throughout the state are starting to do elective surgeries that that they have the room, and I'm not sure what's prohibiting them from doing that.
Well, I'm not sure how the others are doing it. I mean, they might just be doing it, but if you look at one of the governor's decrees, it's there's a part in there about doing elective surgeries and not doing them. Now maybe they have lawyers that are looking around that and they're willing to take that chance. We're trying to obey the law. So if the WHA is going around the state and telling the hospitals that they can open up for elective surgery, then I don't know if Kyle O'Brien there, because I'd like him to give us a call then and tell us to open up. So as far as we know, the governor's told us no elective surgery. So if the WHA is saying something else, or if something new has happened, please tell us. I mean, if you're confused, imagine us sitting out here. We're even more confused. You're sitting in Madison. You've got all the resources there to know.
Well, we'll certainly be finding out tomorrow.
I bet you'll be in a call.
Please do. Please call me.
That'd
be great.
Representative Knodel.
Thank you, Mr. Chair. Hi, Doc. Been a long time, and thank you for being available to give us some guidance.
Yeah.
I'm going to acknowledge that you are a medical professional, the ER doctor for many years, and I don't know about how professional you are in the political world, but I'm going to acknowledge you're a medical professional.
You would know.
Okay.
You would know, Representative Knodel, how professional I am in the political world.
Okay. But I'm going to, Representative Kuglitz kind of touched on it. I just want to carry it a little further. We've had some discussions when we talk about opening up regionally, and you are in an area that is when I was there at one time, I asked where Minnesota was, and you said, look across a bridge. And so do you think that with cross-state travel, you have many people who live in your communities that maybe even work in Minnesota. Do you think that is such a major concern that we should keep Wisconsin lockdown because of that, the travel that goes back and forth? Or can your facility handle that or address that? Or from your medical professionalism, how do you address that?
We do have a lot of people that travel to Minnesota for work. How many people are traveling now? It's a lot of decreased volume on the travel back and forth to Minnesota. So I think the question that you asked is, are we prepared to take care of patients that are sick? You know what? If they're living in Minnesota and they're coming here, or if they're in Wisconsin, we're ready to take care of them. We are, like I said, we've been preparing for this since day one, and now we're preparing to move forward. And so I think that we're ready to go, whether there was a coronavirus surge or if it was time to open up and do elective surgeries or start opening up our clinic more to see more patients. Does that answer your question?
Yeah, I think so, and appreciate you being there to serve on the front lines.
Thanks.
Any other questions for Dr. Severson? Seeing none, Eric, thank you very much for. I'm sorry, wait a minute. Who does? Which one? Go ahead, Representative Onstead.
Maybe just a follow-up for Ledge Council. I'm still equally as confused. What does the order actually say? Is there something that's prohibiting them from doing elective surgeries at this point?
Anna, can you weigh in on that?
I can, though it's not something that I've thought specifically about, so might want to confirm with you later. But my guess is it's more about what the orders don't say, which, in other words, that they don't include an exception from generally, staying at home for that purpose, and so maybe interpreted to being prohibited, to prohibiting people for traveling for the purpose of undergoing an elective procedure. But I will double check on that interpretation, and I'm keeping a list of follow-up items, so I will follow up on that as well.
Okay, perfect. Thank you. Any other questions for Dr. Severson?
Just to say, if we could get a Ledge Council decision on.
Oh, did we lose you? Oh, there you are. Okay. Go ahead, Eric.
So I was just going to say, if we can get a decision by Ledge Council on if the elective surgery is open.
Yeah, we'll let you know what we find out. Anna will make sure that she. Yeah, we'll let you know what we find out. Anna will let the committee know. We'll let you know.
Thank you very much.
All right, with that, Eric, thank you very much for joining us. Appreciate it. Good to see you.
Thank you.
You bet.
I don't think so.
Next up, we are going to move to the Wisconsin Bankers Association. So with us is the president of the Wisconsin Bankers Association, Rose Oswald Poles. Did I get that right? Hi, Rose. How are you?
I'm doing well, thank you. How are you?
Good, good. Thanks for joining us in person. We appreciate that.
Sure, very happy to. Thank you very much, Chair Swearingen, for allowing me to come testify today, and I look forward to the dialogue with all the committee members here as well. The Wisconsin Bankers Association, as most of you hopefully know, is a statewide trade association representing nearly 230 financial institutions that have a retail presence here in the state. And I've been asked to talk a little bit about the Paycheck Protection Program, which we've heard several references to throughout the day. I didn't hear all of the testimony today, but heard it a few times when I was listening in. So I'm happy to talk a little bit about that. Wisconsin's financial institutions have really been on the economic front lines of this crisis and have been really since inception. Before the government programs were even developed, Wisconsin financial institutions really proactively reached out to their customers, both individuals and businesses, to determine what needs they might have, how they were being impacted, and what could be done to help. So they've done a wide variety of programs, as I said, even before the government programs came into existence, that involve things like deferment of payments, whether it was a principal-only deferment or deferments of principal and interest payments for anywhere from 30, 60, 90 days to try to help out Many financial institutions created their own loan programs, small dollar loan programs, to try to help people cover their cash needs through this short period of time without really knowing how long all of this was going to go on for. And then, of course, the reason why I'm here today, the first of several government programs was signed into law on March 27th by President Trump. And the CARES Act, part of the CARES Act created the Paycheck Protection Program, which in the first round there was $349 billion allocated for that particular program. And honestly, the rules keep coming out. With as quickly as the program was pulled together to try to help react and help small business through the crisis, we continue to see rules developing and guidelines being written and more questions being issued. So it's been a highly evolving nature of the program, which has been really challenging for both lenders and small businesses alike to navigate through the program, to know who's eligible, how much is eligible, and moving into some of the other phases. So the program at a very high level provides for forgiveness of up to the principal balance and accrued interest for any loan proceeds used for covered purposes, so long as an employee headcount remains the same and compensation levels for those employee workers remain the same during the 8-week covered period that the program is intended to apply for. The maximum amount of money that any one borrower can get is 2.5 times their monthly average payroll costs. And payroll costs, of course, are a defined term in the law to mean certain things beyond just simply salary or wages. It does include a few other employer-related expenses beyond that. Within less than 10 days of the opening of applications, which began on April 3rd, the first round of money was fully allocated out to over 1.6 million businesses around the country by nearly 5,000 lenders. As you heard Missy Hughes say earlier, Wisconsin, I'm extremely proud of the financial institutions here. They all jumped in to be in the program from day one. They were ready for it when it opened up, and we certainly did our best to help them navigate through the program so that we could help small businesses in the state. At the end, when you look at the statistics as of April 16th, when the program closed, Wisconsin financial institutions and the lenders, the small businesses in this state, we ranked 14th out of 50 states in terms of the total dollar of loans that we were able to put out during that just under 10-day time frame. So I had lenders with stories of their staff working through the night, over the weekends, because this was a system that was open 24/7. So the more volume happened, of course, during peak times, during the middle of the day, when the West Coast was awake as much as the East Coast was awake. So our bankers were working till 2, 3, 4 in the morning to get these loans put in to help small businesses in Wisconsin, and we were able to help just under 43,400 small businesses in the state during those first 10 days, which is phenomenal and, again, something that we should all be very proud of. But even before the first round of money was exhausted, we all knew when looking at the data coming in from all around the country that a second round of money was going to be needed. So we were advocating for it before the first round of money was exhausted, like a lot of our colleagues around the country were as well. So a second law was passed on April 24th and signed by the President Trump that allowed for an additional $310 billion to be put towards this PPP program, and applications were opened up as of this past Monday of this week at 9:30 Central Time. So you can imagine what happened at 9:31. Systems crashed. So it was kind of a nightmare. But again, our lenders have been plowing through it for their customers, again, working overnight, long days to try to get applications in. And I'm getting anecdotally really strong reports from our members that they've been able to get a lot of applications in, and in some case, all of the applications in for the small businesses that they had in the queue. The data that I have as of yesterday at 4 p.m. was that about $90 billion of the $310 billion had been allocated around the country. There's no statistics broken down by state yet, but that leaves about $200 billion left starting today to be exhausted. So The money is moving a little slower, honestly, than what I think people anticipated. Some people thought the money would be exhausted by today. I think part of that is due to a wide variety of factors, one of which is the system being so slow to process applications that it's just taking longer to get them in than it did in the first round. And in addition, I do think there are a lot more questions about eligibility as we've had a couple weeks of guidance come out that has caused a lot of people to really pause and think whether they really are eligible, and so they might not be coming into their lender to talk about that quite as much. With all the media attention surrounding the program and the constantly evolving nature of the program, as I've alluded to, businesses, lenders have a lot of unanswered questions. And as we move into what's really the next phase of the program around forgiveness, WBA created a toolkit which we shared with all of you today, along with a borrower calculator, to try to help businesses understand what their potential forgiveness amount is, because right now it's a complicated formula that I created working through the law, and the SBA still doesn't have all their final guidance out yet on forgiveness. So there's still some more questions that need to be answered. But we did our best in putting this calculator out to, again, just try to provide some guidance to the small businesses that are in the program to at least give them a sense of how much potentially could be forgiven. The biggest issue that you've heard referenced in the context of a lot of restaurants and businesses that are currently closed or very limited in what they can do because of the governor's order really comes about with the Paycheck Protection Program and looking at what is the covered 8-week period. When the law was first passed and it said that it was going to be available until June 30th, there was a lot of talk about this 8-week period could theoretically begin at any point from April 3rd to June 30th. That would have been the ideal response. But unfortunately, there was an FAQ issued by Treasury that said, no, the 8-week period starts when the loan is first dispersed. And furthermore, the loan must be first dispersed within 10 days of you getting approval. So with everybody panicking that the money was going to run out, and of course it did in the first round, as I mentioned, everybody rushed to get a PPP loan. Only now, as we get the guidance being issued, the question now is, well, is any of what I got forgivable? Because my payroll is either non-existent because I'm completely closed, or it's much less than what it was in 2019. And that was the numbers, of course, that, as I mentioned earlier, you used to create your calculation on what your maximum loan amount was. So you've got a very large loan against your actual payroll costs that are very small. So you'll have, in that instance, some forgiveness of your loan, but it will be truly limited to what your actual payroll costs are in that 8-week period of time. In addition, forgiveness amounts can further be reduced by any number of factors based on applicability. And as I mentioned, it includes whether your employee headcount is down, whether you had to reduce compensation levels for employees. So there's a whole formula you have to go through. And the burden to track all of this is on the small business owner to do that, to bring in all the documentation to the bank. So again, that's another reason why we created the borrower toolkit that you all have that can be shared publicly to try to help people understand what they need to do through it. If any amount is not forgiven at the end of the day, it does become a loan. Now, granted, it's a very low interest rate loan at 1% for 2 years. And the first 6 months of payments are deferred. So interest does accrue during that time, but there's no expectation of a payment during those the first 6 months time frame. Lastly, I want to thank all of the members of this committee and frankly all the members of the Assembly and the Senate for passing legislation that ultimately became Wisconsin Act 185 to ensure that any monies as part of the Paycheck Protection Program that were ultimately forgiven were not taxable at the state level. That was a really important piece for business owners, and I want to thank you all for your work in that regard. The impact of this pandemic, of course, is being felt by everyone, and Wisconsin's financial institutions are really doing all we can to try to help people navigate the financial impact of this as much as possible. As I said earlier, I'm really proud of WBA's member banks that stepped up to the plate with virtually all banks participating in the program from day one and putting such a high volume of applications through on behalf of our small businesses to really keep the economy at some type of a steady state during this crisis and and get some revenue in the hands of these individuals that are affected by the coronavirus. With that, I'm happy to take any questions that anyone may have about the program. Thank you for your time. I really appreciate it.
Thank you, Rose. Appreciate the information. On the PPP loan, is it? I've gotten questions from economic development corporations and businesses on what is forgivable. So we're fairly certain that the wages certainly are. But there is some caveats in there that talk about utilities and mortgage or rent payments.
Right, so I have a Q&A document that I've been compiling over the last several weeks that's now this thick for our lenders on our website. So there's two components to forgiveness. One component is payroll costs, one is non-payroll costs. 75% of the forgivable amount needs to be payroll costs, which are defined to include salary or wages, the employer portion of group health insurance, contributions to 401k, and then state unemployment tax, not federal but state. So it's very prescriptive in that formula. So 75% of the forgivable amount can be for those payroll costs. Then 25% of the amount goes for the qualified non-payroll costs, which are any one of three things. One is interest on a mortgage obligation that the business owner has, so just the interest payment, not principal and interest, but interest payment. Second is rent, so if they don't own the property, presumably there is rent, all during only this 8-week period. And then the third are covered utilities, which can include things like, heat, electric, gas electric, internet, telephone, transportation.
Representative McGuire.
Thank you. Just briefly. First of all, thank you for being here. We appreciate all the work that you and your members do.
Thank you.
For our economy. Have you found the governor's recent executive orders to be that have begun opening up the economy on his timeline to be beneficial to bank customers and the Wisconsin economy?
Yeah, I think as we start to turn the dial back, as the term has been used by the administration, I think every incremental change we can make to open up business and open up aspects of existing businesses a little bit more improves the economy. Yes.
Thank you.
Representative Knodel.
Thank you, Mr. Chair. Thank you, Rose.
Oop.
Hell, I want to say that you cleared some things up for me, but I'm not sure.
Yeah.
Because as a legislator and also an employer who had to lay off six people. So are you, for the PPP,
Mm-hmm.
so should an employer just disperse the funds in payroll to these employees, working or not?
Yeah, so if you got a PPP loan and you currently don't have people working, or you have some working but not all, the only way that you're going to get it forgiven is to get back to a full payroll during the 8-week period, and frankly sooner in the 8-week period rather than later, because it'll become a formula, a fraction that gets multiplied into the formula. Some people are telling us that that's challenging, right? Because right now, depending on the wage that you're paying, it might be more beneficial for the employee as an individual to remain on unemployment. So it's a very delicate balancing act. But yes, if you're asking me, should a business bring people back or continue to pay them to potentially be sitting at home because you can't be open or you're open in a more limited way, if you want that money to be forgiven, they need to be employed during that 8-week period of time and on your payroll.
Okay, and just trying to clear it up. So, but being employed could be just sending them a check.
Right, as long as they're on your payroll.
Yeah, that's employed,
That's
whether
employed,
they're performing
yes.
any work for that.
Correct. You could be paying them to sit at home or.
And then in fact, that becomes their unemployment because they will have to report the wages.
Right, they will not be able to collect unemployment during the time you're paying them.
Right, or it will, whatever the offset will be.
Right, or if there's an offset, correct.
So, and now, if you could speak to it, with the $600 federal amount kicking in, I don't know if anybody's received it yet, but I think it's going to happen pretty soon, or maybe receiving it. So obviously that has put a number of employees, particularly in my industry, they have no interest in returning back to work because they're making more
Right.
for not working. So how does that interact with PPP?
Well, that was the point I was just trying to make a minute
Which
ago
I couldn't,
about,
not comprehending, I guess.
No, that's totally fine. This is a really complex program. It's really hard for business owners to get these employees to come back to work, even if it's to just get paid to stay sitting at home. So the result is then your employee continues to collect unemployment to get the maximum benefit for them as an individual. And the business owner will not have that money be forgiven because you can't spend it on payroll because you can't get them to switch during this 8-week period. So what you end up with at the end of the day is a loan at 1% for 2 years for the money that's not forgiven. So that's the struggle that really, that we've been advocating from day one, frankly, with our entire congressional delegation to say, once you tied that 8-week period to the 10 days disbursement requirement, you've now, in any state that has a safer at home, order, or where they've shut down some businesses even without a safer at home order, you've just put that segment of business owners at a disadvantage from others. And I personally, of course I'm not a member of Congress, don't think that's their intent. I think the point of the program was supposed to be to help these business owners out. But again, if you look at the literal language of the program, it says they meant to keep employed for 8 weeks. So if you go back to the literal language of the program, the outcome is what I'm describing. So hopefully a lot of these small business owners have not spent this money, so they can return the money.
That, I think, is the summation. You might receive it, but don't spend it.
Yes.
And then send it back.
And then return it. Mm-hmm.
But if you don't make it to full payroll, the people that are on the payroll, that still counts, right? I mean, in the 8-week period.
I lost the question, sorry.
I mean, if you don't make it back to full payroll within the 8 weeks, you still can have what you did pay on payroll is still forgivable, right?
Correct. So the scenario I described is assuming you have either no payroll or a limited payroll. But yes, assuming you have some payroll, even if it's small, that small portion will be forgiven. And then 25% of that on the non-payroll costs will be forgiven. But it isn't 25% of the original loan amount that's forgiven. It's 25% of the forgivable amount goes for the non-payroll costs. And I mention that nuance because a lot of these business owners that are affected still have full rent that they have to pay or full interest on mortgage obligations and full utility costs. And so there's also another way to try to skin this cat and say, well, then don't limit our forgivable amount for these non-payroll eligible costs to only 25%. Just let us take whatever we've incurred in this 8-week time frame and be reimbursed for all of that because our payroll is so low during this time frame. But again, right now, that's not the way the law 25%. Works. Right.
Representative Kugelich.
Thank you, and thank you for coming today. So I just want to, I thought I understood this until Representative Knudl just asked a question. So let's just say scenario, right? You've got 20 employees on your payroll last year.
Right.
Okay? And you had to close. You were in a business that the governor said you have to close. So now you can only get 10 of the people to come back because the other 10 are saying, no, I'm making more on unemployment. Can you hire 10 new ones to get it back up to 20?
Yes.
Yes, you can. The employee count just has to be the same. It doesn't have to be the same people.
Okay.
There's employment laws. I'm a lawyer, so let me just add, there's more to that question that probably should be analyzed than simply wondering whether you want to get this loan forgiven or not forgiven. Because there are obviously employment laws with hiring these people, and then I presume you're going to want to let them go at the end of the, this 8-week covered period. So, there's probably more that should be looked at by a business owner there.
But basically, as long as you just come up with that number, you'll get it forgiven.
your head count didn't
Yeah.
drop, it doesn't have to be the same people.
It doesn't,
That's
okay. And then one other question, have you seen with your banks, and maybe it's too early in the process, but have you seen an uptick in foreclosures or bankruptcies with businesses?
Not right now, because all of that effectively has been stayed for a variety of reasons. No, I think, as you heard conversation earlier, as we start to dial things back and open things up more, and we certainly want that trend to continue. I think the effect of this is still very long-term from an economic impact as much as it is a health impact. So, that question will be a great one 6 months from now, 9 months from now. And, how quickly were any of these, both people as individuals and businesses, able to truly recover to come out of this? And then what does that mean for foreclosures, bankruptcies, things like that?
Representative Onstead.
Well, thank you, Mr. Chair, and thanks for the testimony today. It's pretty fascinating, and thanks for the question, Representative Knodel. So I have a question. Let's say I didn't get the forgivable loan, so I have the 1% loan for a two-year period of time, I think you said. Is there any restrictions as to what I can spend that money on?
Well, the borrower made certifications when they applied for the loan that they were going to use it for these types of things, payroll, and then that's some of the non-payroll costs I've talked about earlier. So the question, a little twist on your question has been asked of me before, which is, well, can I just keep the money to use for payroll costs later on, not during the 8-week period? And you certainly can, because it's just not forgiven, but you can use it for those other reasons. I think the SBA, and lenders and others would start to question the attestations made by the borrower if they took the money and went out and bought a new car with it,
Sure.
And used it for completely unrelated purposes.
But for a business expense, let's just say that I had 20 people laid off and 10 of them decided not to come back, and versus I didn't want to hire 10 people I didn't really want to bring back, but I could use that extra money for other business expenses.
For other business expenses,
Okay.
and it won't be forgiven.
Okay.
That's correct.
Thank you.
Any other questions for Rose? We probably got plenty, but not for now. Check the website.
You can always call me later.
Rose, thank you very much for
Sure.
staying this late and giving us your perspective from the bankers.
Thank you very much for your
Thank
time.
you. Last, we're going to Skype in Noah Williams, who is an economist with the University of Wisconsin-Madison. Noah, are you with us on Skype?
I am. Can you hear me?
We sure can. There you are.
Okay, great. So thanks for adding me to the program, I should say. You guys should have received a copy of some handouts.
Yep, it's in front of us.
Okay, great. So these handouts summarize a report that we actually just put out on Tuesday. So I'm going to hit the highlights on that. I know you've had a long day, so there's going to be a whole lot of numbers thrown out, but I'll try to keep things lively. Since the start of the pandemic, we've done a lot of work in the center tracking the economic impact, particularly focused on the impact in Wisconsin. So we put out a whole series of reports, many of which are updated regularly. So if you want to get the most recent information, I suggest you go there. And we'll also be updating this report that I'm going to talk about, which has particular metrics on both the economic side and the health side. So we'll be following those going forward. So of course, as you know, a lot of states have imposed stay-at-home orders. When looking at relaxing the guidelines, most of the attention, if not all of the attention, again, a lot of the discussion today has been counter to that, has been focused solely on current health indicators. What is the spread rate? What is the positive test rate? Things like that. We think that in going forward, we need to weigh both the economic consequences and the health consequences. And the rationale for our report was really to put the numbers to that front and center, and particularly to look regionally within the state, since both the economic factors and health factors differ substantially across the state. If you want to think about the trade-offs, I think it's fairly clear that it's not uniform across the state. So just in brief, I'll hit the highlights on the report, and then I'll go into a few details as to what do we actually find. So overall, statewide, we estimate that the COVID pandemic is costing the state roughly $1.7 billion a week in lost economic activity. Our estimate, which is actually, I think, relatively conservative, is that we've seen about a 30% decline in output year over year. As of April 18th, we saw a 13 percentage point increase in unemployment statewide. I'll give our statewide estimate in just a second. It's actually gone up even more since that time. So just again to get a sense of the overall magnitude of the size of the loss, which is really unprecedented both in scale and the speed of declines. We do look regionally at both economic and health factors, and we find that on average, the counties that were in the worst economic condition prior to the pandemic have actually suffered the most during this crisis. And so I'll give some numbers to that. We do also look at health factors. We focus on them at a regional level. Again, a lot of the guidelines have been focused on things at a state level, but we wanted to drill down a little bit. Some of the health data is reported on a so-called HERC level, the Health Emergency Readiness Coalition. So basically grouping counties together. I believe there's 7 HERC regions in the state. Looking at the health factors, including most of those which are in both the national guidelines from the CDC and the White House, as well as those issued by the Evers administration, we find that if you look in the regional level, at least 3 of the regions have very low rates of infection, very low positive test rates, and we think they may be close to even satisfying those current health guidelines if you took them at a regional level. But however, at least some of the counties in those regions, which is something that the governor has emphasized, do have a larger vulnerable population and may have lower health system capacity. So that does maybe give some pause for relaxing guidelines, but nonetheless, the case rates and the infection rates are very low. Overall, what our finding is or what our take on this is that as policymakers like yourselves consider relaxing social distancing guidelines, I think it makes sense to go to a phased-in and regional approach. And again, you've heard a different, talked a lot about a different take on that today. We have slightly different guidelines, but a lot of our analysis, is constant and focusing on a regional level, and also looking at differences across industries with the WMC as well. Just again, I'm going through the slides here. So if you look at the slide showing the pre-crisis economy, just to kind of remember where we were, we'd come in, had a sharp recession nationally and in the state, but had sustained period of growth for the better part of a decade. Unemployment had peaked in Wisconsin at 9% in 2010 and had come down to 3% through 2017, 2018 before ticking up slightly. So we were in very good economic shape coming into this crisis. Again, as I'm sure has probably come up today, the number one complaint businesses had going into this crisis was finding available workers to fill jobs. Of course, we've basically slammed on the brakes. We've seen a vast change, again, unprecedented in scale and speed of slowdown since that time. So in particular, if you look at the next slide labeled initial unemployment claims, these are from, we include both the Department of Labor and the Department of Workforce Development numbers. They're basically the same. You can see 2019 versus 2020 there. Roughly starting around March 15th, we see a huge spike in unemployment claims in Wisconsin. We're past the peak of the initial filings, but unemployment filings still remain high, still roughly a factor of 10 or more on a daily basis relative to what they were last year. So we saw a very rapid increase in unemployment. Unemployment is still high. The unemployment rate is still going to be increasing as long as we're at this elevated level of people filing for unemployment. And you can see on the next slide, one thing which we've been doing, and we update this frequently, is using these initial unemployment applications to try to estimate where are we now in the state unemployment-wise. Again, going into this, we were below 4% unemployment. We just updated based on data as of yesterday, and our estimate is we're roughly 19.5% unemployment in the state. So, again, for comparison's sake, the peak rate in January of 2010 was 9.3%. We're more than double that right now. The highest rate on record in the state, state unemployment records go back to 1976, was 13% back in 1983. So again, we're at least 50% above that. And there's no, based on the unemployment claims, there's no sign of that stopping. Maybe the growth may be slowing down, but we're still seeing big unemployment flows. The next graph. So in addition to thinking about just people filing for unemployment, it's very difficult in real time to get measures of how many people are working, how much output is being produced, what businesses are still open. This graph showing hourly workers and businesses is based on a survey of mostly smaller businesses, largely employing hourly workers. So this is concentrated in retail and food and beverage. So there's some of the sectors which have been hit very hard by the crisis. What's shown on there are the number of workers and the number of businesses. What do we see? We see a decline in businesses open of roughly 45 to 50% year over year. And we see a reduction in hourly workers of more than 50%. So again, huge magnitude. This is the survey is concentrated in the areas which were more heavily affected, but nonetheless, the scope of this is really quite striking. To get a measure of how much output is being produced is very difficult in real time. Again, GDP numbers take a long time to be calculated. So one thing which we've done is there's a company which has provided us with cell phone foot traffic data. It's a sample of roughly 10% of the state population, so it's a significant number of people. And then we track their visits. It's all anonymized, so strict privacy guidelines. We look at the aggregate numbers. We look at the numbers of visits to 70,000 different locations in the state, and then we can break that down by region. And starting off, at the beginning of March, things were equal, or if not running a little bit ahead of where we were in 2019. Then starting roughly around March 15th, a very rapid drop-off. Overall activity, again, based on this measure, is down 50 to 60% over the past month, with significant variation across industries. So retail is holding up better. That's almost entirely due to grocery stores and warehouse stores like Sam's Club and Walmart and Costco in particular. Health, we just heard from a doctor just ahead of this. We see declines in visits to healthcare facilities on the order of 40%, and that's actually increased more in the last couple of weeks. Food, accommodations, hotels, and restaurants are some of the hardest hit overall sectors. We then use these foot traffic numbers to try to get a sense of the decline in overall activity. I mean, of course, we're seeing fewer people going to school, but schools are still being done remotely. I'm still teaching my classes online, so that doesn't mean all of that activity has stopped. So once we try to adjust for the amount of work which is being done at home, we get numbers on the order of 30 to 40% overall reductions in output. Again, with some sectors hit even more, arts and entertainment, recreation, hotels, restaurants, more on the order of 50%. And again, 40% in healthcare. Education, again, holding up slightly better because a lot of things are being done remotely. So again, that's all statewide. What we then do is look at how have different counties in the state been affected by this crisis. And again, statewide, the reduction is about 30%. We look at impacts. If you look at the slide labeled Current Economic Index, we have a number of different indicators there. But mostly, if you want to focus on increases in unemployment and our estimate of lost output in that county, we rank all of the 72 counties in the state. Best performers are Pepin, Pierce, and Taylor. The worst are the ones which have been hit the hardest are Trempealeau, St. Croix, and Menominee County, Menominee in particular being a small county, but also the poorest one in the state. So I think that is worth emphasizing. Menominee County, the median income in that county is roughly 40% below the statewide average. Poverty rates are on the order of 26% there. Within the last 5 weeks, they've had 19% of their population file for unemployment. Again, far higher than the statewide average. We also give numbers there to think about lost income and lost GDP. So again, these are things which we think help inform to think about the regional trade-off between economic costs of the pandemic and of maintaining the social distancing orders, and balancing that against the potential health risks associated with relaxing those guidelines. The next slide shows the regional impact of unemployment, looking at unemployment in February, and then our most recent estimate in April 18th, again at a regional level. And we see that unemployment went up overall across the state. It went up more in the northern parts of the state, which tend to have lower incomes than the statewide average. They're more rural, so they've actually been hit the hardest, even though, as we'll see in just a little bit, they've had less exposure to the crisis, to the coronavirus spread there as well. Menominee, if you can see on the graph, Menominee County is that one which is very dark in the northeast part of the state. Then there's just there's more discussion in the paper, but we give some quantitative sense to how much have counties been hurt and how did it depend on what their initial condition was. And we do find that the counties and the areas which were in the worst shape, highest poverty rates, highest unemployment rates, lowest incomes, tended to have fared the worst in this crisis. And again, that's consistent with a lot of evidence that we know in economics, looking at past recessions. We know that the people who tend to be hit the worst are those in the lowest end of the income distribution. Hotel, or in particular, food and beverage and retail are relatively lower paying industries. They've been hit hardest. So in some ways it's very unfortunate, but that these are the ones which have been hit the worst. One thing which we try to do, so I've been talking so far just about the impact of the crisis, of the pandemic. What we try to do, and we had a report which was released today on that, was to try to separate how much was due to voluntary behavior, distances shutting down in advance of the safer-at-home order, and how much was actually due to the safer-at-home order. And we do find there was a significant amount of activity which was cut back before the safer-at-home order came into place. Right, so if you just think about the timing, activity really started trending down around March 15th. The safer-at-home order didn't come in until March 25th. So a lot of reduction had already happened by that point. And to get at how big was this impact, we compare Wisconsin to other states which don't have these type of orders. And we estimate that roughly 20% of the reduction in activity was due to the order. Again, that's not to say that going forward, only 20% of the economic activity would be due to the order. It's basically saying on the way down, the order wasn't binding, but what the order has done is keep us frozen at a very low level. To the extent that people would voluntarily want to resume economic activity, then the order may be more binding. But again, our estimate right now is that if we were to, say, relax the order imminently, we shouldn't expect a massive change in economic activity, but maybe we could get back to where we were in March, which would be, perhaps a 20% increase. One thing we do as well is, again, which is consistent with what the WMC looked at, is to look at differences not just regionally but across industry. We use federal data on how close do different people in different occupations work. So it's a measure of proximity. And then we weighed up by industry the type of work which is done in close proximity. And we have a table there which lists across all industries from low to high. And what we see is that really gives a different picture from thinking about essential versus non-essential businesses. There are a number of businesses which would have relatively low risk of resumption of activity, relatively low health risk, whereas some of the highest proximity industries are the essential ones, so food and beverage, transportation, healthcare, of course, has its own complications and own safety guidelines which must be enforced. But again, if we're moving forward, we want to stop thinking about essential versus non-essential to think more about the risk of different activities. Finally, then, just to highlight, again, we tried to look at not only current health, but also look at the size of the populations in different regions, which could be more effective. So to try to get an estimate by county of the vulnerable populations. And what we see is, again, across the northern part of state that the region tends to be older, have slightly less healthcare capacity. So our measure of their baseline health index is that they are largely driven by the fact that they have a larger vulnerable population, is that it's a little bit higher there. Milwaukee County is the highest because of its high population density, which leads to more rapid spread. But again, relatively speaking, the western parts of the state are very low in the baseline health index, meaning that they're relatively healthier parts of the state. Then to look at current data, we split into the regions, which are just shown in the next. There's 7 different regions in the state, again, just basically grouping counties together. And we look at measures of current health indicators at this somewhat more aggregated regional level. What we find is if you aggregate up like this, essentially 3 of the regions, taking into account both the current infection rate, the growth in new cases, and the 2-week change in that, the positive test rate and the 2-week change in that, again, looking at these 14-day intervals. On all of those measures, at least 3 of the regions score very low. Meaning they've had very low cases, they've had very low increases in cases, and in fact have seen slight reductions. Again, these are very small numbers, but slight reductions over time, and they're not seeing more positive tests. What we do see is some of the hospitals in these regions are reporting shortages of PPE equipment, masks in particular, masks and respirators. So to the extent that we could alleviate those shortages, those regions would be even in better health shape. 2 of the regions faced very high, according to our index, health scores, meaning they're associated with larger infection rates and growth in infection rates. Not surprisingly, that's the Southeast, largely driven by Milwaukee, and then the Northeast, largely driven by the outbreak in Brown County over the past couple of weeks. But again, we have a particular way of weighting these indicators, but nonetheless, these capture a lot of the indicators which were in the statewide guidelines, and we hadn't really seen regional data on this. So again, looking forward, that's something that we're going to continue to update. So again, that's a broad overview of the report that we wrote. I'm happy to answer questions on either this report or any of the other work that we've done. Again, we've looked at a number of different aspects of the economic impact here in the state, and more recently looking at this disaggregated regional level.
So I think this is what it means to drink through a fire hose, right? A lot of information going on here, Noah. Any questions from the committee for Noah? Representative Kuglich, go ahead.
And I know it's not in here, but is there any correlation that you can derive with the GDP decline and the estimated tax revenue for the state being declined?
Yeah, there's going to be a certainly there's going to be a very strong relationship there. Yeah. A lot of the GDP decline has come through, we're measuring it through transactions. So certainly that will be directly show up in sales tax revenue. The unemployment in numbers would be something which would feed more into income, so that would be more on the income tax side. So I would expect there to be a very strong correlation there.
Thank you.
So Noah, I think you might have touched on it, but do we have I guess I'm still kind of in the hospitality segment kind of mode here, but is there a chance here to, if we can turn the dial up and can we salvage what's left of the summer of 2020 or the year of 2020 if we get back on track soon?
So I think there's certainly hope for that. Of course, what we can't predict is, again, what we see in our numbers is, what was the first thing that people did was they canceled travel plans, right? So even before the crisis hit here in the state, people started canceling travel plans. So it's going to take more than just dialing, allowing more things to open to get people back. We're going to need, stronger health signals that people will feel safe and that they'll then be willing and able to resume their previous daily lives.
So they would be comfortable spending that disposable income then on themselves. Representative Knoll.
Yeah, thank you, Mr. Chair, and thank you, Noah. It was worth the wait because
Thank you.
I think you've got some good information here. And I don't know if you were on earlier when I made a statement that all our communities are dying. I meant economically. But I wonder if you can confirm that. The summary I got out of this, in my own mind at least, was we have two regions in the state of Wisconsin that are significantly affected by the virus and infection. Yet, the entire state has been devastated economically.
Yeah, no, that's the takeaway from our report is once you break things down to a regional level. Again, all of this is ultimately going to come down, or at least part of the trade-offs will be thinking about, well, if we let off some of these social distancing guidelines, the shutdowns, there's the risk of reinfection, right? We have to balance that against the economic cost. But at least, three of the regions have seen very little spread of the virus. Even they haven't had perhaps a ton of testing, but they have very low positive test rates as well. So if you're looking at those economic versus health trade-offs, those would certainly be the ones which would stand out, saying that even if perhaps their health systems are, maybe have a little bit lower capacity than the rest of the state, the fact that they just don't have any evidence of this being widespread right now, but yet they are, in many cases, particularly the northern parts of the state, some of the poorer regions and been the hardest hit economically. Well, then if you weigh those factors, again, I would think that the economic one may predominate there.
Okay.
Thank you.
Any other questions for Noah? Well, Noah, thank you very much. This is quite a report. Obviously, this report has been released. Who gets this? Where do you share it?
It's on our website. So crow.wisc.edu will take you there. I think it's right on the front page, accessible from there.
Okay. And is this shared with everybody across the state then?
Yes, we sent it out to a number of people. I know actually the university was behind it, and the chancellor even sent it around to some people. So we're doing our best to get it widely distributed. Any help on those long lines is appreciated.
Oh, okay. All right. Thank you very much, Noah. Appreciate you waiting until the last here, and we appreciate the input and obviously the work that went into the report.
All right. Thank you.
You bet. Have a great evening. That concludes our last invited guest speaker. So with that, I will kind of move to adjourn. Once again, we'll end it kind of the way we started. We got a chance to listen to some of the people in industries and stakeholders who have been directly affected by what's been going on in the state. I appreciate everybody kind of dropping their defense shield so we can have a good conversation amongst the committee. And I think we were here to listen and gather information. If this is the first of several, I'd be happy to, help orchestrate the next one down the road. And with that, any comments, Representative Snicky?
Yeah, very briefly, because I really want to hit the road and get home. So there are actually two other plans, I believe, out. We've got the Badger Bounce Back Plan.
Yep.
And then I believe there's another plan that was written by a couple of Republican legislators, correct?
I think you might be right.
Yeah.
Yes.
Yeah,
Yeah.
I haven't seen the plan. Just wondering, it would be interesting to hear all of these plans and get input from them before you move forward.
Yeah, I think the goal is hopefully, I think, and I said earlier to, Missy Hughes, I just hope that we can take the best of all these plans, put them into something comprehensive. But I'm really hoping that, as a lawmaker and a member of the assembly, that, we can get the governor to, hopefully his plan is amendable as well. And so I'm hoping that, leadership on both sides of the aisle get together with a good conversation with the governor. And because I firmly believe the state needs to be reopened, and it needs to be reopened safely, for sure.
Yes, it does need to be reopened.
Yeah.
But like you said, safely,
Yep.
with a plan, and, let's not rush into it.
Yeah, fair enough. Fair enough. Any other, go ahead, Representative Stubbs.
Thank you, Mr. Chairman. My question would be, when would you think we would be notified if there's another informational session meeting? Would it be within the next week or so, since you've allowed us to suggest maybe future speakers?
Oh,
What kind of
yeah.
time
Well,
frame,
if you have, I would say if you have a suggestion, get it to either Representative Snicky or myself as soon as possible. There's nothing planned, I can tell you that. But if we can put together something, I would say, ASAP.
Okay.
And then if there's a feeling that we should get together again, I think that'd be a good thing.
Thank you.
Representative Kuglich.
Thank you, Mr. Chair. And I just hope the committee remembers the different people that talked today and that there's a sense of urgency. We can't take the normal legislative time frame to come up with a plan that everybody can agree on. And if you didn't believe the people that spoke before, if you didn't look at those numbers that we just saw out of the University of Wisconsin, is that every day that we are inactive or not opening up the state, there is mega consequences. And the question I asked about the tax revenue to this state is going to be huge, the decline. And that's something that we're going to have to deal with sooner than later. So I asked the chair that if we're going to move, we do move swiftly, because the crisis is very important, and it's important that we act fast.
I don't disagree, but I also echo Representative Snicky. We shouldn't just be jumping, but I do agree that we have to keep moving for sure.
I think we're all willing to work together and get something done.
And I'll tell you, Representative Kuglich kind of touched on it. The next budget cycle for the state of Wisconsin is going to be of grave concern. And I understand that, these people that are the safer at home people and stay home, but when we talk about government programs and school funding and everything that's tied to what's coming into the state, and he echoed the fact that the state is losing 1.7 million a week. That's going to be directly affect the next budget cycle.
And Mr. Chair,
billion.
Before the next budget cycle.
Yeah.
I think we all understand that, but we also have to balance the
Is your mic on, dear?
No, I'm sorry. I thought we were adjourned.
We almost are.
I understand the economic issues that we're looking at here, but you still have to balance those issues. How do you balance those issues with the life and health of the people of the state of Wisconsin? Coming from Milwaukee, we are not ready to reopen.
Yeah.
But you can't do a regional reopen either.
Yeah, well, and there might be disagreement there, but I'll point to the fact, and we've talked about this, that there are many businesses in this state that are still open.
Right.
And these same people that are worried about going out and other businesses opening are still going to the grocery store. They're still going to the gas station.
Right.
They're still going to the box store. And apparently these businesses are operating safely, and therefore you could make the argument that the rest of the businesses could do the same. And so I think that's been brought up, and then certainly I get the testing and the tracing and all of those things. But so I'd like to think that what we did here today was fairly productive, but I agree we should move swiftly. I also agree we should be cautiously. Representative Canola.
I'm buying the first round at the closest tavern that's open.
Great. All right, with that, the Committee on State Affairs will stand adjourned. Thank you very much for coming to the Capitol.
Remember, we can carry out at I stated the closest tavern that's open.
Hi, I'm John Henkes, President of WisconsinEye Public Affairs Network, and I'm speaking to you today to ask for your financial support. For 14 years, WisconsinEye has provided uninterrupted, gavel-to-gavel live coverage from our state capitol, the legislature, the Supreme Court, the governor's office. We're proud to continue to do that and continue through this time of crisis with important coverage. We are 100% committed to bringing these important meetings into your home or place of work. We've created online pathways that allow us to connect you live with these important events. But WisconsinEye needs your help to do so. At this time, we are facing unprecedented staffing, technical, and financial challenge. So if you rely on our coverage to stay informed on issues you care and need to know about, I ask that you consider a one-time charitable gift today to help us through this challenge. Whether you're following the DHS briefings, the Wisconsin Elections Commission, or leadership briefings from the state capitol, or any of the timely interviews conducted by our senior producer, Steve Walters, we could use your support today. If just a fraction of the thousands who value WisconsinEye coverage say yes with a gift of any size, it will provide a huge boost. So thank you. To donate, please text WisEye to 44321. That's WISEYE to 44321, or visit wiseye.org/donate. WISEYE.org/donate. Or you could send a check to 122 West Washington Avenue, Suite 200, Madison, Wisconsin, 53703. Again, thank you so much. Please be safe. Stay optimistic. We are Wisconsin.
This program is a production of WisconsinEye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. WisconsinEye is the nation's first and only independently funded state civic broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.